To the committee on August 30th, 2023, and sponsored by Mayor Michelle Wu. This hearing is being recorded, and the public may watch this meeting via live stream at www.boston.gov/citycounciltv and Xfinity 8, RCN 82, and FiOS 964. This proposal would prohibit camps or camp materials on any public property, including sidewalks, streets, schools, or public parks, unless authorized during a period when shelter is not available. The proposal authorizes the Mayor's Office of Housing, working with the Boston Police Department and Inspectional Services Department, to promulgate any additional regulations needed relating to the time, place, and manner for camping. The proposal also contains provisions relating to the offer of shelter, storage of property, notice, and penalties. According to the Mayor's transmittal letter, this proposed ordinance is one part of a three-pronged approach, which includes expanding overnight low-threshold housing and shelter capacity, and a coordinated response to return Atkinson Street to standard roadway usage. If members of the public would like to provide public testimony, you can sign up at the sign-in sheet to my left. If members of the public would also like to provide remote testimony, this is a hybrid hearing, meaning that we will take testimony both in person and through Zoom. So if you have not signed up to testify, you can do so by emailing Christine.O'Donnell, ODONNELL, at boston.gov to do so. Please make sure, however, that the name you are using on your Zoom is the same as the name you used to sign up for public comment, as otherwise we'll be unable to call you at the appropriate time. If you would like to just provide written testimony, members of the public can also email the committee at ccc.go@boston.gov with your written testimony, and that will be submitted to the record. This morning I'm joined by my council colleagues, Erin Murphy, Councilor Ed Flynn, Councilor Michael Flaherty, Councilor Julia Mejia, Councilor Tanya Anderson, Councilor Sharon Durkin, Councilor Liz Braden, Councilor Rusi Louis Jen, and Councilor Brian Worrell. As others show up, I think I got everybody. As others show up, we'll give them a chance, provided we're not already at the panel. Our first panel that will be presenting today is from the administration. So we're joined today by Commissioner Michael Cox, the Police Department Police Commissioner, Chief Sheila Dillon from the Mayor's Office of Housing, Dr. Bisola Ojikutu, Executive Director of the Boston Public Health Commission, and Tanya Del Rio, Human Service at the BCYF Central Office. Before we go to our panel, I'm going to give everybody time to give opening statements. I'm going to try and, just for the interest of time and the amount of questions I think people will have and respecting everybody's time, I'm going to try and make sure we stay to this system. When you hear this noise, which is less abrasive, hopefully, than what we normally get, that means your time is up. I'm going to give everybody up to 3 minutes for their openings, and then 5 minutes for questions, and then we'll go in as many rounds as it takes for everybody to feel as if their answers have been, the questions that they have posed have been answered, and things that they have questions about have been asked. And so with that, I'm going to go by order of arrival, beginning with Councilor Murphy.
Thank you. Thank you, Chair. Thank you for the panelists who are here, but also the public who are here. It's a well-attended meeting. As many people know, most of our meetings, it's kind of quiet in the chamber. So it tells us that we know this is a very important issue that is important that we address. So as the Chair of Public Health, Homelessness, Recovery, and mental health. I feel it's very important that we have all the stakeholders at this hearing, so thank you for being here as an opportunity for city officials to address the public concerns about the ongoing tragedy at Mass and Cass, which we know is unprecedented in Boston's history in its severity and in its duration. This hearing will give us an opportunity to ask questions and have the public, let the public know what steps have been taken and what more steps have to be taken to alleviate the suffering that we know goes on day and night down in this area. And I know when my other council colleagues speak and more is said, it's not just in this area, that's the epicenter, but we know that it has moved to different areas around the city. So many district councilors have been very vocal and brave to speak up to advocate for their neighborhoods also, because we do know that many, if not all of the resources are really centered in this one small area, but we really have to look at how do we make sure that all neighborhoods across the city have the same support. I'm hopeful that it will illuminate for the people of Boston how their tax dollars are being spent, how to clean up this crisis in a very safe and humane manner. We will, all of us, be judged how we respond to this tragedy. And so far, I am afraid, and I think many of you would agree, that the city has fallen short in its response. And the lack of accountability to me is very troubling. So I'm looking forward, when it's rounds of questions, I have more questions around the state of emergency and just the legality and the need, if there is a need for an ordinance, or if we are in a position and have the power now to just clean up that area and clean up the tents in a humane way. I've said it many times, I'll continue to say that if you're someone who's struggling and sleeping outside on a dirty street next to drug dealers and behavior that you're just not in a good space. So we need to make sure that we're supporting those suffering who need to get into humane housing and other opportunities to get on a path of recovery, and to make sure that we're stopping the illegal activity that goes on day and night, because there are business owners and neighborhood residents that I also have to answer to and make sure that we're not leaving all of the people in the city of Boston who are affected by this crisis. So thank you, Chair.
Thank you, Councilor Murphy. Next, we have Councilor Flynn.
Thank you, Chair Arroyo, and thank you, Chair Murphy, as well. These tents and large encampments at Mass and Cass are the sites of drug dealing, human trafficking, violence, and other illegal activities. They must be removed from public spaces immediately. I have heard from many constituents, especially in the South End, including Representative John Moran, who's on this call as well, who are paying close attention to this ordinance and who have questions about this ordinance and whether that would mean expansion of shelter services in and around the South End, Roxbury area. We believe in decentralizing the services in the South End. What impact will this have on their quality of life as well? This crisis at Mass and Cass and its negative impact on quality of life issues and public safety are affecting certainly the South End community, but other communities as well, such as Andrew Square in South Boston, Nubian Square in Roxbury, Clifford Park in Dorchester on a daily basis. The status quo is not an option, and we must provide positive leadership to address this emergency, this public safety and public health emergency and crisis. We need to stop the open-air drug markets, drug trafficking, human trafficking, exploitation of women, and violence. We need to get people into treatment. But we also need to ensure that the residents living in this impacted area are heard, are respected, their quality of life is addressed, along with the business community as well. There can't any longer be a climate in Boston where anything goes. People have to follow the rules, and if you don't follow the rules, there has to be consequences for that. Thank you, Mr. Chair.
Thank you. Councilor Flaherty.
Thank you, Mr. Chairman. Thank you to my colleagues and the panelists, as well as those that took time out of their schedules from the public to be here. This issue is, I think I speak for everyone, it's an absolute catastrophe. No one over there is getting healthy. No one over there is getting straight, sober, not getting their life back on track. And it's because their brains and their bodies are hijacked by some very powerful drugs. This issue needs a premium focus on detox and recovery. And that could be in the form of civil commitments or, if necessary, involuntary treatment, if we are to have any semblance of a chance at saving their lives. The tents need to go, the predatory behavior needs to go, and we need to renew the partnership with the public and the public health and public safety. And we all need to be sort of part of the solution. And the biggest part of the solution starts with detox. You can't go and give someone a set of keys if they're not on all cylinders, if they're not straight, if they're not sober. They will sell those keys. They will trade those keys for drugs. They will lose those keys, or they'll invite folks over to do drugs with those keys. The time and the focus should be on detox and recovery. We really should be leaning heavily on those in the recovery communities. They know better than anyone. Many of those folks were in very similar situations. And so why we're not reaching out to those professionals that have dedicated their lives one day at a time to help others along that path. Instead, I think we tend to think that we are the smartest in the room, and that whether it's because we have medical degrees and or we have other degrees that allow us to at least opine on the issue, the fact of the matter is, as I said from the beginning, if you're over there, you know nobody's getting healthy over there. Place is an absolute cesspool. It's with inhumane conditions. So how do we turn this absolute catastrophe around to, I guess, a recovery and a success story? It starts with detox. Thank you, Mr. Chair.
Councilor Mejia.
Thank you, Mr. Chair. You know, I've been really thinking about how we as a city meet moments that make everyone feel uncomfortable. And I have realized in my little short period of time that I've been in this chamber is that we are often in extreme opposing views, so much so that we are unable to really see each other. And because we spend most of our time and energy yelling at one another, we don't listen to what is being said either. And so I feel, as we continue to navigate this particular conversation, is that Boston is well suited to do things differently and to be a leader in what it looks like when we're able to do and, not one or the other. And I feel like it is our moment to be more reflective. It is our opportunity to think about how do all of these folks work more collaboratively to address the issues in a way that no one feels like they're losing, which is what it feels like oftentimes. And so for me, this particular conversation, I also understand the political undertones that exist, the personal beliefs that people have, and I think that we are legislating something that oftentimes we can't legislate people's behavior. We can't legislate what people will and will not do. And I feel like that is a very important pillar of this conversation, is that we understand the will of that person regardless of what that will is. And I think that that's also a piece that we need to hold in this space. I often talk about the fact that my cousin overdosed of a heroin overdose. I had a niece who was locked up and now is working in Mass and Cass to help support other people who are going through their journey. So this is not a conversation that I take very lightly, right? And I understand the impact. What I am concerned about is the the political undertones that exist in the way we're moving through this. It feels like one or the other, and I feel like we have an opportunity to find space for everyone here to be heard and affirmed. And so I do have questions, and I'll wait for those questions and an opportunity to be here. But I will say this, is that Mayor Wu walked into a space and took action swiftly. And despite what people may want to believe, you all managed to make some really good work happen in Massancast, and I want to acknowledge that publicly, because leading with compassion and understanding people's dignity is part of that. And I think that that is something that I think we can't lose sight of. And so I'm encouraged by the work that you're doing. Thank you.
Thank you, Councilor Mejia. Councilor Anderson?
Thank you, Mr. Chair. Good morning, everyone. Director Del Rio, Chief Dillon, well, I'm not going to go with the titles. That's too much to remember. But Dr. Jakutu, acknowledge you. Good morning, Commissioner. And thanks for being here. Thanks for your work. Let's get to the questions. Let's figure out exactly, relative to what has been done, how far we need to go, and what is a comprehensive plan to back up the aftermath of removal of the tents. I agree with it, but what is the plan? And that's what we're here for. I encourage my council colleagues to be patient with me, ourselves, and through this process, and actually come up with a resolution. I think that it speaks volumes to the democratic process. The mayor filed it, and now the council takes it on and workshops the ideas, workshops the plan. It's a good partnership. Looking forward to it. I thank you and have expressed this already. I feel that Boston has done tremendous work in this. I continue to bring up research that I feel that compares best to what Boston Public Health or the strategic outlook looks like right now. But I do see the consistency, I see the patterns, and I see that it's been executed beautifully. So congratulations to Dr. Jakutu, Tana Del Rio coming in just, less than 2 years, and doing tremendous work over there. It's not easy. Let's not pretend we have answers. Let's not pretend we're experts when we're not. Let's lean into the people for their expertise in areas where we don't know anything about. And also, we have leaned into those with experience. We do that. Boston does that. And so looking forward to the conversation. Thank you so much for being here. And again, it's going to be a long hearing. Hopefully we take a break, we come back, and let's not rush through it. Thank you, Mr. Chair.
Thank you, Councilor Anderson. Councilor Durkin?
Thank you so much to the chair, to my colleagues for being here, and for the administration panel. Thank you for convening this hearing. I'm grateful that you guys are here with us today. Homelessness, substance abuse, and untreated mental health is a major concern of my constituents, so I really appreciate all the activity that you guys and thought you guys have given to this issue. It's clear that healthcare workers and outreach teams feel unsafe in the area, and it's clear that we need to do something. So I'm really, I feel good that there is something that's being proposed and that we have something that we can work on. So I'm looking forward to reviewing this ordinance in depth, and grateful to the chance to ask questions today to learn more. I have some questions, but I'll save that for the question period. So thank you so much.
Thank you, Councilor Durkin. Councilor Braden?
Good morning, everyone. Thank you for being here. I'll keep it very brief. You know, the reality is that the Massancast situation is a human tragedy, an immensely difficult and complex situation. But you know, we as a city are struggling with and making progress on how to address this very complex issue. But I also feel that this is not just our problem. This is a state issue. We need to work and see what we don't have the infrastructure to support detox and recovery services at the scale that is needed. And, you know, we all know the challenges of short-term detox. You're in for a few days, and then you're back out on the street again. And if you don't have those wraparound services to support your recovery, or if you don't have access to a long-term detox bed, then you're very, very vulnerable to relapse and going back into a very disordered and difficult situation. So I'm really here to learn and listen this morning and see, to support any and all tools that we have in our box to try and support the folks who are in this situation, support our street workers and our law enforcement and all the folks who interact with this community on the street, and trying to come up with some good solutions. So I'm looking forward to the conversation, and thank you.
Thank you, Councillor Brayden. Councillor Louis-Jean.
Thank you, Mr. Chair, and I want to say thank you to the administration for being here and for all of your work. I want to start off by honoring those who are down in Mass and Cass, and I'm a little bit emotional because I was dealing with an overdose issue this morning, not here in Boston. And it's just really hard for a lot of the people who are down there, for the families of people who are down there. And it is hard to see people every day suffering from the disease of addiction, suffering from failed systems that have not met people where they are when it comes to acknowledging that mental health is as important as physical health. We have broken systems that have created broken people, and we have a really big problem. And we are not alone as a city in that problem. I want to acknowledge how big the problem is, and if there was a bullet, one solution, we would have probably already enacted it by now, but there's not, and it's complicated. It's public health, it's public safety, it's mental health. So I echo a lot of the comments of my colleagues. And I also want to acknowledge how difficult it must be every day to also live in that neighborhood, to try to have a business in that neighborhood. I've been down there many times and was down there very early yesterday morning with members of Wasana, and I hear them, and I hear you, and I hear the residents of the South End, and I hear how difficult this is for the entire city. This is a difficult problem. I think we have to find a way to work together, as everyone has stated. We realize that there's a lot of fear, too, when it comes to thinking about where we can place shelter, where we can place treatment facilities. So we need to acknowledge that we have to have that difficult conversation as well if we want people to get better. I think that this ordinance provides us an opportunity to get people out of inhumane situations, and at the same time, when we read language, a bed that is practically available, we need to make sure that there is a bed practically available for them. And we have to acknowledge that there are people who have suffered trauma in our shelter system. And so what are the options going to be for those who have experienced PTSD? When we realize that there are people out on the street for various reasons, our vulnerable population down there, LGBTQ+, people who are couples, and people who are suffering from the addiction of disease, we really do have to be thoughtful. So I'm looking forward to engaging in this conversation. I have questions about implementation and want to make sure that we are thinking about what I think are the two really big issues, which is treatment and housing at the same time. Thanks, everyone.
Thank you. Councillor Worrell.
Thank you, Chair, and thank you to the panel for being here and all the work that you have done at Mass and Cass. The current situation at Mass and Cass, as we all know, is a crisis. It's a public health crisis. It's a public safety crisis. The current approach needs more support. Residents of Lower Roxbury and the South End don't feel safe. The Mobile Sharp team picks up hundreds of thousands of needles from our streets, sidewalks, parks, and playgrounds each year. And yet our students still step over needles daily. The introduction of fentanyl has drastically increased overdoses, and the explosion of the use of meth has increased incidents of violence. On average, there are 1 to 2 stabbings at Mass and Cass every week. People living at Mass and Cass are not safe. Human trafficking, sexual violence, assault, people in their darkest moments are being brutally victimized. People struggling with substance abuse disorder are unable to find a safe place and calm place to get well, and the human toll is unimaginable. Additionally, first responders and public health workers fear for their safety. And as we have heard from all our colleagues, there's no easy solution here, but with the seriousness of this crisis, We need to make sure that everything is on the table. And as we participate in today's hearing, I want there to be a reset. I know this is an emotional topic. It's literally about life and death conversation for the people at Mass and Cass. And today's hearing isn't about blame. It's not about pointing fingers. It's about finding solutions. So I'm looking forward to the conversation. Thank you.
Thank you, Councilor Worrell. Councilor Baker.
Thank you, Mr. Chair. Good morning, everyone. Thank you for coming out. I'm opposed to this ordinance. We're here to talk about the ordinance here today. I'm opposed to this ordinance because I don't believe that we need the ordinance. I believe there's ways to go in there and go through the population without removal and then extreme displacement. I think this is a pathway a political pathway that this administration is trying to go down, or is going down, is doubling down on. It says it right in there on housing first. I think that's a treadmill that if we get on, we'll be here in 20 years, and same thing, just dumping people into low threshold, low bar housing, whatever you want to call it. It's a skirt on safe injections. Unfortunately, like most people in this room, drugs and alcohol have scarred my family, going back generations and continuing now. I think that for us to say that we need an ordinance to clear these things and to go after the problem is wasting our time, wasting all of our time. We can go in there right now with a real Section 35 program, a couple people out of there, a couple people that want to go into programming. There's people down there that instantly right now should be arrested and put in jail. There's a population down there that's like that. And then you have your population that probably isn't or doesn't want to go any place because they're so far gone on the drugs and meth now. We know that causes a lot of challenging behaviors. And I don't want to say that the work that's been done isn't good work. It's done in compassion, and we're trying to save people, but I believe in my heart of hearts that we're going down the wrong path. I think, and if anybody will ever answer how much we've spent on the roundhouse alone between BMC and every place else, is that good money spent? 300 people, millions of dollars? And like we talked about, that the kids are going crazy in South Bay, kids are going crazy downtown, kids are going crazy all over the place. We got emails today about the Murphy School, which is where my kids went to. A big riot at the Murphy School. The Murphy School, it was a place of learning. It was a good place. I just think that we're going to start spending good money after bad money. Meaning, I think the pathway that we're going down here is wrong. I think the millions and millions of dollars that we're spending on trying to open up, and by the way, force down the South End's throat, we've been talking to them. I inherited this problem about 10 years ago in my second term. The bridge closed, everything, it really got different after that bridge closed. But in April of 2021 was the first time that I saw in a railway tents pop up on our street. Right across on Southampton Street, it was, 1 second, I'm wrapping it up. Right across on Southampton Street, 40 tents pop up. They all matched. They were matching tents because the Housing First people said, here's your tent, go down Mass Ave and set up right out in front of the homeless shelter. That is how you will get into low threshold, low bar housing. And to be clear, that low threshold, low bar, we're allowing people to continue to use. If nothing changes, nothing changes. It should be treatment first all day long. Millions and millions of dollars we should be spending on beds that we can offer people for 6-9 months where they don't have to watch over their back. They're not going to get stabbed. And they also will be fed. They can be clean, but there's access to programming within a structure. And we're not chasing them around, meeting them where they're at. They're all in tents now. And if anybody that's been doing the homeless work, they'll tell you the people with the worst conditions in our entire country are those people that are on the streets there. And my original point, yeah, we don't need this ordinance. This ordinance is a way for this administration to spread the blame across this body right here. And if my voice were listened in this conversation, I wouldn't mind taking some of the blame. But my voice isn't listened to. Thank you.
Thank you, Councilor Baker. Councilor Lara?
Thank you, Chair, and thank you to the administration for being here and for all of your hard work. I think I echo all of my colleagues when I say that we know how difficult this process has been, and we know that we are, in fact, in an epidemic, as are many other places, not just in the state, but across the country. I think the difficult part for me in figuring out what is the best way to respond to mass and CAS, not just for the city of Boston, but for the state, has been in regards to how much of the burden of responding to the opioid epidemic has been put on Black and brown neighborhoods, and neighborhoods that are already struggling, neighborhoods that have been historically disinvested in. I think I share in a lot of the frustration of my council colleagues. I share in a lot of the frustration and lack of action from the state, or lack of appropriate right-sized response from the state. And I know that as elected officials, we are between a rock and a hard place, where we are trying to take care of people, and we're also trying to respond to an incredibly difficult moment, an incredibly difficult epidemic. We're here to talk about this ordinance today. I believe that it is drastic in what it's trying to do. I think that there are other ways that we can get the effect that we're aiming for here. And my hope is that we'll be able to have a conversation, not just as the city council, but with the administration, to figure out how we get this ordinance to a place that feels good, not just for us here, but for the community and the people who have had to live with what's happening down at Mass and Cass for this time. I'm obviously a big proponent of housing first model. I'm also a big proponent of harm reduction. In our interventions in the city, we've seen success with those. The problem is that the issue grows every time that we make a dent in it. People keep coming, and we have to figure out how the best to respond to that. And so, I am under no delusions about the difficult place that we are in right now, and I don't think that further criminalizing people who are struggling is the way to manage that. I agree with Councilor Baker in the sense that there are a lot of things in this ordinance that we don't need, that there are actions that the Boston Police Department can currently take that can help mitigate some of what's happening there, and there are actions that we can take that can help mitigate some of what's happening down there currently. So I look forward to continuing to have this conversation. Obviously, I'm a district councilor, and that is not my district, and so I want to, put more weight into the voices of the people who have lived there, the councilors who are representing this area, and show up in the best way that I can to get us to a solution. Thank you.
Thank you, Councilor Lara. Councilor Coletta.
Thank you, Chair. I will keep my opening remarks brief, but I want to thank you all so much for your work on this, and thank you so much for being here to answer our questions. I do look forward to diving deeper into the language of this ordinance, how this will adequately respond to the crisis and tragedy that we're seeing at Mass and Cass, but also in our districts. I heard somebody mention that earlier, but this is something we feel in District 1, and I know across the city. I'm interested to understand how, through this back and forth, we could strike the right balance between protecting people's safety but also their civil liberties. I am interested to learn more about the harm reduction aspect of all of this and the housing first approach, in addition to the public safety approach. Again, how we are striking that right balance. This is a solutions-oriented conversation. We're all leaning into this work. I'm here to support my colleagues who represent that area and my at-large colleagues, but I'm here for the negotiations and here just to figure out how we can all move forward and solve this crisis and this tragedy. Thank you.
Thank you, Councilor Coletta. And so I'll give my opening, and then we'll transition to the panel. I have serious concerns with this ordinance from a couple different avenues. The first is sort of its legality, the tenuousness between, essentially the Attorney General, I believe in 2022, offered an opinion that you can't just arrest homeless people without providing adequate shelter, which I think this ordinance attempts to remedy by saying that they have to make sure that there's shelter at the time, or an alternative shelter, but it's very light on the details in terms of what that rollout implementation looks like, whether or not we're talking about shelter that is actually available to that individual, and how we even check that. One of the things that I did prior to this was I was a public defender, and I believe I was the only person on this council who's actually represented individuals who called the Mass and Cass home in court and had them as clients and as people who I've actually worked with and spoken with. A lot of our systems fail them when we're talking about how we connect them to services. So many times what we had was this revolving door of criminal involvement because the drugs are illegal, The weapons that we talk about are illegal. The sex work is illegal, and so they're often being dragged in for different things. And the reality is, there's a lot of talk about, oh, they don't want treatment. Almost every individual that I met, I'm not going to say every single one, but almost every individual that I met was open to treatment. The issue was that the way in which we did treatment, there were huge gaps. And so in other words, you could Section 35 someone, which I highly oppose and hope that we no longer have a Section 35 system. But in that process, when it was done, the issue was that they would essentially be there for about 2 weeks, and then they would up their rates of overdose risk, up their rates of harm, without any serious connection to the next step, which was, let's get you into a bed for treatment, largely because that didn't exist. There was, the waiting list for that was long. And then you had incarceration played a role in the sense that we had detox facilities, and air quotes on the detox facilities at Middleton Jail and in other correctional facilities who got priority. And so what ended up happening is you would have individuals who were locked up on months on end waiting for a bed, and then if you were an individual who wasn't already in that carceral system, then you had to wait behind people who are already in the carceral system to get to a bed. And so we have all of these hang-ups, and what it comes back to is the state hasn't adequately funded or created the kind of pathways out of addiction and this sort of managing and treating this disease, and simultaneously also addressing the mental harm and the mental illnesses that folks are dealing with on a day-to-day basis. We don't have the adequate systems to do that. And so when you bring a ordinance to me that says it's doubling down on a public health approach, but what it does is it criminalizes tents, I have a hard time understanding what part of the criminal penalties for being homeless and having a tent has to do with the public health approach. We can say that it's related to public safety, and I'll have some questions on that front too. And so, you know, just so the panel's aware of what my questions will be about, I have questions about how we're making sure that this is legally compliant, how we're making sure that the rollout and implementation makes sense, who's responsible for the offering of a ride or all of these different things that are in this ordinance. And then the second one is, I agree with Councilor Baker that I'm not really certain that this is an ordinance that's even needed to do what you're saying it's needed to do, which is, when it's been presented to me, it's the tents are the cause of the sex trafficking, the tents are the cause of drug use, the tents are the cause of violence. And the reality is that all of those things are illegal. All of those things can be dealt with at this moment by the law. And we also have the reality that Marty Walsh did Operation Clean Sweep prior to any of the ordinances, or prior to any of the executive orders. That was already done. Mayor Menino, prior to him, did Occupy Boston and clean that out. I'm not really certain why this is necessary in that context. And frankly, this administration has done several sweeps and has torn down tents. And I believe even as part of the regular cleaning process, those tents get moved and done in different ways. And so I don't see this as a solution, because I don't see this as leading to the actual aspects of the aid that we're able to deliver that causes long-term change. Simply taking down tents, it doesn't resolve the issue of addiction, doesn't resolve the issue of mental health illness, and certainly doesn't resolve the issue of homelessness. And as we're trying to get these properties on board, one thing I would say is I support low threshold housing. I support a housing first initiative, and I know that we've struggled to get approvals in different neighborhoods to do that, but I do believe that we have to continue to push for those ways out, because what we saw often in my field as a public defender was that the more stable somebody's living situation was, the better success rate we had when they were in treatment and when we were trying to address their medical concerns on top of their addiction concerns. And so those are the kinds of issues that I have with this. At this time, I want to go ahead and transition it to the panel so that you can make opening statements, and then we'll open it up by order of arrival for questions. I don't know if the administration has a preferred order here. If you don't, then I would just start at the right and go all the way down for introductions and opening statements. Does that work? Then preferred order is fine, and then I'm assuming you hopefully all know it, so go in that order, and then when you're done, I'll turn it over to my council colleagues for questions.
Great. Good morning. For the record, my name is Dr. Basolo Jakutu, and I'm the Executive Director of the Boston Public Health Commission and the Commissioner of Public Health for the City of Boston. Thank you, Chair Arroyo, Councilor Murphy, Councilor Louis-Jean, Council President Flynn, as well as the other city councilors for the opportunity to testify today. I also want to thank everyone, including my colleagues across city agencies, our partner organizations, some of whom you will hear from today, and city councilors for your efforts and support as we as a city attempt to address this incredibly complex, ongoing humanitarian crisis, at the heart of which are people who are chronically ill, people who are suffering from substance use disorder, and oftentimes severe co-occurring mental illness. I believe that there's one goal that unifies us all, and I believe that that's our sincere desire to improve the health and well-being of this population who are very sick and in great need. I'm here today in support of this proposed ordinance because the current public safety conditions in the Mass and Cass area, particularly those on Atkinson Street, no longer allow us to meet the needs of this highly vulnerable population. The Boston Public Health Commission is charged with leading the public health approach that's critical to our city's response to substance use disorder and unsheltered status in the Mass and Cass area. The work that we do is a matter of life and death, and oftentimes determines whether or not someone will begin the road to recovery. In brief, the public health approach is comprised of the following. We provide pathways out of the area towards housing and shelter options, as well as individualized case management. We promote recovery by referring individuals to detox and to addiction medicine specialists. We prevent the tragic outcomes of substance use disorder by working with our clinical partners to reverse overdoses and distributing naloxone. And we provide street outreach, which is focused on harm reduction. Unfortunately, due to serious safety concerns, BPHC staff, including Boston EMS, Recovery Services Outreach, Homeless Services staff, and Campus Police, our other city staff from the Coordinated Response Team, and multiple agencies, and staff members from our partner agencies are hampered in their ability to do their work, and in some cases, just can't do it any longer. In recent months, staff members who have dedicated their lives to this work have been threatened, followed, and physically attacked. The people that we serve have also been victimized regularly and have very real fears for their safety. We need to stop the violent criminal activity and restore state safety and stability to the area. And that is why we need this ordinance to pass, so that we can achieve sustainable, lasting change at Atkinson Street, so that BPHC's public health workforce and our partners throughout the city can safely implement strategies to serve individuals who are in dire need. This ordinance, along with our coordinated plan for implementation, which you will hear about from the other members of the panel, is the right tool to get us there. I want to express our deep concern for the individuals who are truly unhoused and living on Atkinson Street. Because of our concern, we have developed a plan to continue to effectively serve these individuals as the ordinance implementation plan is rolled out. Currently, more than 200 people congregate on Mass and Cass during the day. But out of 200, approximately 75 to 80 are actually sleeping there on a regular basis, most of whom are known to us by name. Once the ordinance passes and is signed by the mayor, we will tell them about what change will occur in the area, and as soon as it goes into effect, our priority is to help those individuals who are truly unsheltered in the area get shelter in a humane way while protecting their individual rights. That means providing them with notice, offering them storage for their belongings, giving them transportation, and giving them somewhere safe to sleep at night. To meet this important responsibility, BPHC is working on several interventions. We're working with Chief Sheila Dillon and partners to identify and bring online additional shelter beds across the city. Chief Dillon is here on the panel to take questions regarding the strategy. We will also be opening and operating a temporary transitional space in our Northampton Square campus at 727 Mass Ave that will provide nighttime respite and supportive services for up to 30 unsheltered individuals who are currently living in the encampment. We are also expanding our storage program so that when tents are taken down, individuals don't lose their personal belongings. Together with our partners at BPD, we are also deploying mobile response teams to ensure that we continue to reach those in need of services. This is going to be a critical part of our work in the days ahead as we proactively seek out individuals who may have dispersed away from Atkinson Street. We are currently refining our plans together with BPD, and we anticipate that there will be a number of geographic routes that mobile outreach teams will cover in the surrounding areas. Finally, we are doubling down on the efforts that we know work. This includes continuing the work of referring people to detox using a mobile model continuing our mobile van service to day spaces across the city to reduce aggregation, and providing overdose prevention services to save lives. From an operations standpoint, I want to note that the Engagement Center on Atkinson Street will be temporarily closed during this public safety intervention. Our shelters, Woods Mullen and 112 Southampton, will remain open throughout, continuing to provide emergency shelter to hundreds of individuals in need each night. I also want to highlight the hard work of our teams who are out there on the street every single day. They have helped place hundreds of people into substance use treatment programs through our Recovery Services program over the course of the last year. They have also reversed hundreds of overdoses. I would like to take this opportunity to recognize their successes and support them in their continued work. In conclusion, this ordinance is the right tool to address our current concerns and will effectively mitigate the public safety issues as described. And it will allow us to continue to do the life-saving work of public health. I'd like to close with a final thank you to the staff who work in the area on a daily basis. They are the true first responders in this crisis, and they have been doing important jobs in very difficult circumstances. They deserve to be safe. I hope that you will support them, and I hope that you will realize that we need multifaceted solutions. It's not about one solution, it's about a number of solutions to deal with the complicated nature that we're dealing with currently in Massachusetts and then around the city of Boston. We need to create a safer environment for everyone, and it's important that we vote to approve this ordinance as soon as possible. Thank you.
Thank you.
Good morning. For the record, my name is Sheila Dillon. I'm Chief of Housing for the City of Boston. I'm the Director of the Mayor's Office of Housing. Chair Royo and the Council, thank you for holding this hearing and your ongoing and engaged interest in this very important issue and effort. I'm here to give very brief comments on the housing and sheltering efforts that have gone on in the Massachusetts area. The city, working with its nonprofit partners, has been working hard to house the homeless individuals residing in the Massachusetts area. You will all recall that in January 2022, the city, working alongside the state and many provider nonprofit partners, established 6 low-threshold emergency shelter sites. These sites provided shelter and appropriate services to those that had been residing in tents at the Massachusetts encampment. In addition to recovery and mental health services, these residents received the resources necessary to secure affordable housing. To date, 169 individuals have been permanently housed with ongoing support services. Of the 135 individuals that are currently living at these low-threshold sites, 85 of them, as of yesterday, have a housing resource in hand and are working with housing professionals to find housing that is appropriate for them. This work, of course, continues. When they are able to exit the low-threshold sites, this will also provide more availability for folks that need that type of shelter. In preparation for winter and the removal of the now existing tents, we are working to identify shelter beds for those that will need this accommodation. Dr. Oshikutu is correct that not everyone frequenting the area is homeless. However, we do know that there are individuals that will need assistance accessing shelter. Plans for this effort are well underway and being put into place. Of course, I'm available to answer questions you have today or will have as this effort continues. I now want to pass the floor to Tanya Del Rio. Thank you.
Thank you.
Thank you, Sheila. So thank you to the chair and to the members of the City Council for hosting this hearing, and also to the members of the community who are here to participate in the discussion. My name is Tanya Del Rio. I am a senior advisor to the mayor, and I lead the coordinated response team, where we address situations related to the intersection of unsheltered homelessness, untreated mental illness, and substance use disorder. And my team and I are based on Atkinson Street every day. In this role, I've had the opportunity to work with many of you and engage in really productive and substantive discussions. I've witnessed community members' tireless stewardship of our shared public spaces. I've watched and learned from those providing care to our unsheltered neighbors.
And most importantly, I've witnessed countless acts of human kindness, of resilience, and courage displayed by people who are attempting and succeeding, in many cases, in entering recovery. And it's a privilege and a blessing to be able to serve in this capacity. I want to thank and honor community members who today and in many other spaces have chosen to share their personal stories of struggle with substance use, with mental health or homelessness. I have tremendous admiration for you who do that, and the service you provide by generously and courageously allowing others into a part of your life that many would rather keep hidden, and for good reason. Because unfortunately, the stigma and lack of understanding still contribute to mistreatment of people who use drugs and people who do not have a steady place to live. So their testimonies today and every day that they share combat this by bringing understanding, empathy, and compassion into this conversation. Their testimonies help us understand that addiction touches all of us, and that in this city, all of us need to do everything in our power to be there for each other. So again, I extend all my gratitude to them because they have and they will continue to demand that we do right by our most vulnerable neighbors. Today, I'm going to outline the reasons behind the decision to file this ordinance and why ending the encampment on Atkinson Street is a moral imperative, and simply said, it's the right thing to do. We have gotten to know people who frequent this area. They have shared their struggles and their dreams with us. And in short, we care about the human beings that we have met and that we have served through this work. The closure of the Atkinson Street encampment is not a recommendation that's being made lightly. It's rather a call to action, and it's rooted in compassion, in safety, concerns for the safety and well-being of our unsheltered neighbors, as well as the public servants and other workers that are supporting them. The acts of violence on that street are happening all too often, and they are shielded by tents and structures that are endangering the general public and hurting our local businesses. But I think something that often gets lost in the conversation is that, in fact, the most frequent victims of these acts of violence are the people that are staying and living in this encampment. Acts of violence against unsheltered people are, I don't think I need to say it, but I will, a grave injustice. These individuals are already facing unimaginable hardships that they should not have to endure, in addition to the burden of violence, harassment, exploitation, or intimidation. The increasing danger in the neighborhood has also forced many of our service providers who work with these individuals to leave the area, undermining their best chance at stabilization and recovery. I'll say that our improved data collection process has given our teams the ability to target case management, transitional housing, and other service towards the people who are most in need and eager to engage. It's also allowed us to understand that at this point, the majority of people we are encountering on Atkinson Street on any given day are not in need of housing. Some people are not unhoused, but frequent the area to take advantage of others or simply to engage in the drug trade or other types of criminal activity. So we strongly believe that we have to take action at this point. And by approving this ordinance and making it possible for the coordinated teams here to close the Atkinson Street encampment, we will be taking a crucial step towards protecting our most vulnerable neighbors, the most vulnerable members of our society, ensuring that they have a chance at a safer and a more stable life. Also, in taking these actions, we can begin to restore the streets to normal rights of way. These measures present an opportunity to redirect resources and efforts towards more effective solutions. We should focus on increasing the availability of low-threshold shelters, transitional housing, supportive services that can help people find stability and regain their independence, rebuild their lives. Specifically, the new model introduced by this administration has shown tremendous promise. Since January of 2022, I think it's been said, 169 people have stabilized through the city's and state's low-threshold sites, and they've attained permanent housings. Plus 138 people are utilizing this resource right now. If you think about it, that's over 300 people that have turned or are turning their life around. They're closer to living the full life that they deserve. That's over 300 families who are no longer sitting by the phone and wondering if today's the day where they're going to learn that their son, their daughter, their husband, their mom, their friend is no longer with us. That's more than 300 families that today can just breathe a little easier. So before I turn it over to Commissioner Cox, I just want to say a few words about our coordinated response plan for the days and the weeks that are immediately following the passage of the ordinance, if it passes. As you heard from Dr. Ojikutu, the ordinance is passed. Our combined teams are going to immediately begin notifying people living and visiting the encampment that the tents and tarps are soon to be fully prohibited and that Atkinson Street as an encampment is closing, likely within 2 weeks of passage. My team and I are going to continue working closely with everyone on this panel and Public Works Department and other departments that are involved in sanitation, cleaning the street, while we also stand up the enhanced storage program targeted to individuals entering low threshold sites, as well as our shelter system. Within 2 weeks, we do expect to be working alongside Boston Police Department, Public Health Commission, supporting the active enforcement of the ordinance through a combination of stationary and mobile units deployed to ensure that tents and tarps remain down and that we prevent new encampments from forming, not only in that neighborhood, but in a larger catchment area. As we encounter any new campsites and unsheltered people, we will be there as a cross-departmental team alongside BPD to offer housing, access to services, storage of belongings, and transportation to any service needed. We do expect a staff-heavy and sustained engagement over many weeks while we restore normal operations on Atkinson Street, Southampton Street, and maintain active engagement in other areas of the city that are priorities, such as Clifford Park or surrounding schools. So in closing, I just want to invite us all to come together, all of us as a community, because it is necessary to support action and make a difference in the lives of our neighbors. So I ask for your support and for approval of this ordinance for the safety and for well-being of every Bostonian, no matter where they live or how. So I want to thank you now and turn it over to Commissioner Cox.
Thank you, Tanya. Good morning, Chairman Arroyo and all the members of the City Council. I'm Michael Cox, Police Commissioner, and I want to thank you for this opportunity to testify today here in support of this ordinance relating to the unlawful camping and public property, and discuss our plans to address the public safety concerns from Mass and Cass area in the city and how we plan to use the tools provided by this ordinance across Boston neighborhoods. With me today is my Chief of Staff, Nicole Taub, my Superintendent of Bureau of Investigations, Felipe Colon, my Deputy Superintendent of Bureau of Field Service, Daniel Humphreys, and my Sergeant Peter Moscantolio from the street outreach teams. Part of our role here at the police department, and it's certainly a primary role, is to enforce laws. In order for law enforcement to work, there needs to be a law that pertains to the most pressing issue of the day. In order to effectively serve our community, we also have to listen to all our stakeholders. The issues in the vicinity of Mass and Cass are becoming more of a public safety issue and call for a shift in how we're managing the area in general. The geographic area that Mass and Cass encompasses is about 2.5% of Boston's land area, yet it accounts for about 8% of the violent crime reports and about 5% of the property crime reports. The area also accounts for about 6% of all arrests in the city. The police calls for service have increased by about 10%, and the Priority 1 calls specifically have seen an increase of about 5% so far this year. Even though the data slightly shows a decrease in violent crime during the same period, we believe that this is a result of significant unreporting of crime in the area, not reflective of the true criminality that's actually occurring. July and August were our busiest 2 months in overall Part 1 crimes, with the number of incidents almost doubling the year before, 2022. Also, the weekly average of aggravated assaults increased by about 3 from January 1 to June to almost 7 per week from July to August. The increase in incidents has been met with an increase in arrests in the area, which are up by about 21%, which includes about 10 firearm-related arrests. As mentioned by my colleagues, one of our foremost concerns is that the neighborhood has become being visited on a daily basis by hundreds of individuals that are not unsheltered and not there to receive services. Instead, these individuals are coming to the area to prey on vulnerable populations, including those who are unsheltered and struggling with mental health and/or substance use disorder. This behavior creates an impediment to those who are actively trying to take advantage of the important public health and recovery services the city has been providing in the area. The result is a dangerous environment with an increase in violence so significant that the service providers, as you've heard earlier, working in that space have pulled some people out, and because they no longer engage, no longer can engage in this area in a safe and meaningful way, they need assistance from us. Tents and tarps have become a key barrier to making the area safer. Those who come to the area prey upon the vulnerable, using tents and tarps to shield illegal conduct from the police, and our ability to enforce other laws is significantly hindered by the inability to engage in the illegal conduct in the secrecy of the tents and tarps. The ordinance being considered today is an additional tool that will give the police department clear authority to impact the increasingly dangerous environment. If passed, the ordinance would allow the police officers to enforce prohibition against the establishment of campsites in the city. That includes removal of tents and tarps and other structures, as long as the shelter space is available in a location to store the individual properties as well. With clear enforcement authority, the area will be less attractive to those coming to exploit those individuals in need of services and create a clear path for officers to keep those who are struggling with homelessness and mental health and substance use disorders safe. Additionally, the ordinance plays an important role in allowing us to displace encampments by officers to proactively prevent encampments from reestablishing in other areas and locations throughout the city. Our officers must have clear authority to not only remove the structures, but also prevent them from reestablishing elsewhere. With the authority, we're prepared to prevent this from reoccurring in residential neighborhoods, parks, and other public ways through a plan that includes deployment of mobile response squads made up of officers from all over the city, as well as an assignment and deployment of street outreach unit in neighboring areas of concern. To make sure individuals continue to have access to all the available services, including shelter, our officers will be working closely with our partners from the Boston Public Health Commission, the Mayor's Office Coordinated Response Team, and the Office of Housing when doing any enforcement of this ordinance. The goal is not just to take the structures down, but we'll also continue to work with people who are experiencing homelessness and assist them in getting housing and services and provide a place for them to store their belongings. This will allow us to avoid a situation where tents and tarps and other structures are being used to provide illegal and dangerous behavior throughout the city, while continuing to provide recovery services for those who choose to participate in the city's programs. If once the offers of housing and storage are made, and the individual refuses to remove the campsite or attempts to reestablish the campsite in another location, we will enforce the prohibition against the camping and maintaining the campsite on public property or the public right-of-way as our last resort. The ordinance will allow those who need help a safe space to engage in meaningful services with providers, and will discourage bad actors from coming to other areas of the city looking to victimize the vulnerable while utilizing tents and other temporary structures to conceal their criminal activities. The ordinance will allow officers to continue to serve residents and businesses whose daily lives and safety have been disproportionately impacted by the current situation in Madison Cass. I urge members of council to support the ordinance, and I look forward to discussing the ordinance and the public safety strategy that I'm here to answer any questions you might have today. Thank you.
Thank you, Mr. Commissioner. Before I go to The council, I'm going to put a 5-minute timer on every individual. There's a full house here today, so that means that this first round will take over an hour if everybody sticks to just the 5 minutes. If people go over that, it'll take even longer. And so I am going to strictly enforce that. So what that means is when this timer goes off, if you are mid-sentence or mid-question, I will allow you to finish that question and receive an answer to that question. But I will not allow you to then follow that up with another question or to then make a statement after that. I'm going to ask that folks respect that because I want to give folks at least 2 rounds. And so if we have someone taking 10 minutes and someone else taking 11 minutes, then this is going to get out of hand. So I'm going to make sure that we follow this timer to the letter so folks have a better sense of how to plan their day right now. We're going to do 1 round followed by a 2nd round with this panel. We'll then take which if everybody participates in both rounds, that's about 2 hours. After that, we'll take a 5 to 10 minute break before the 2nd panel of community advocates joins us. And then there are only 2 panels. So after that panel presents, we will repeat that process and then we'll go to community comment. And so should be a long hearing. So I would just ask my council colleagues to sort of respect the timer. I don't want to interject when you're speaking, but if I have to, just in the sake of making sure everybody's time is respected, I will. With that said, I'm going to start, it's going to go in order of arrival, so I'm going to start with Councilor Murphy.
Thank you. Thank you to the panel. I do have some questions on what I heard you say, but I first wanted to clarify, and I'll speak kind of fast. I don't want to run out of my 5 minutes, and I do appreciate you being clear on that, Chair Arroyo. So my question is, are we in a state of emergency in the area? And I'm just going to go through a few dates and things I've heard to get a straight answer here, because I've gotten conflicting answers. I was told by the administration yesterday that when the COVID health emergency was lifted on April 1st, 2022, which was more than 1.5 years ago, that ended then Mayor Janey's state of emergency. So I'll go through a few dates and times. And I asked this specifically for a few reasons, but one is that myself, Council President Flynn, Councilor Baker, and Councilor Flaherty asked for a state of emergency in a letter written to the Board of Health on September 1st. We got no response. We wrote a follow-up letter to the Board of Health dated on September 10th, urging the board to take that matter up, which we knew they had their or I'm not sure if they meet monthly or bi-monthly, but on their September 13th meeting. We did receive an email on September 14th stating that the board declined to issue a public health state of emergency in the area of Mass and Cass. After reading a letter, I'm confused because now I feel as though we are in a state of emergency. And so if the council is asking, and then it's just conflicting to me. So on March 10th, 2020, Massachusetts went into a public health state of emergency due to COVID. On June 15th, 2021, Governor Baker ends the public health state of emergency. The city of Boston did not end it at that time. On October 19th, 2021, when several of the councilors here were on this board, then acting Mayor Janey signed an executive order declaring a public health and public safety emergency for the tent encampments at the epicenter of Mass and Cass. On April 1st, 2022, which was a year and a half ago, Mayor Wu and Dr. Ojikutu end the COVID-19 public health emergency. I'm only stating those dates because I was told yesterday from the administration that when April 1st, 2022, when you ended the COVID public health emergency, that it was considered that Mayor Janey's emergency, which was a mayoral executive order, was tucked into the COVID and that made her emergency go away. But there's a letter dated on April 6, 2023, just a few months ago, and you write, Dr. Ojikuto, in a letter to the state requesting an emergency waiver with DCAM, and I quote, in October 2021, a mayoral executive order was issued by then Mayor Kim Janey in response to the health and safety conditions, directing the City of Boston agencies to take all necessary steps to address the conditions in the area. This order still remains in effect. And you go on to state how this will give us the opportunity, which I agree, the powers for the service providers to respond to this emergency situation through several interventions, the most significant of which has been the creation of 6 low-threshold sites for temporary shelter. So if we're writing in a letter on April 6, 2023, that we're in a state of emergency, and the council is asking the board to declare a state of emergency, I feel it is either there's board members who don't understand if we're in one or not, or we're just being disrespected, because I would think or hope that if we're already in a state of emergency and what those powers would give, which in this letter, it did give us the power to ask for emergency waivers with DCAM for housing. So why would we not be told that this council doesn't need to ask for this because we're already using the executive power that Mayor Kim Janey declared? And I'm told, and I believe it's true, that they don't go away when new mayors are elected, that whatever mayor would have to rescind past mayor's emergency declarations. So please, and then I do have some questions, so hopefully it won't take too long about the work. Go ahead.
So I'll try to be brief. Thank you, Councilor Murphy. No, we have not declared a public health emergency in regards to the situation that we're facing at Mass and Cass. Declaring a public health emergency, as you know, is a legal determination. And I think I want to just be clear about what it actually means. So under Massachusetts state law, when a public health emergency is declared at the local level, which has happened only one time in the history of Boston Public Health Commission, it allows local public health officials like myself and the Board of Health to issue orders that otherwise would require a full regulatory process. In other words, it suspends public notice, public comment, hearing process, public discussion, and vote that is usually required when enacting Board of Health regulations. Because of that, because it suspends the role of the public, by case law, the suspension of this regulatory process is expected to be temporary.
Right.
And it's only expected to be utilized when other options are not viable.
But are we still using the powers of Mayor Kim Janey's public health and safety emergency?
That was a mayoral executive order. That was not a public order issued by the Boston Public Health Commission. They're different, and that's why I was trying to complete the statement about what exactly it is. I want to be clear that the declaration of a public health emergency does not in and of itself unlock any additional resources or trigger any additional support at the state or federal level. And in regards to this current issue, an emergency order will not add to the resources at our disposal or allow the Public Health Commission to do anything about public safety or any of the issues that have been described here. Okay. In fact, we are doing and using all of the resources that are available to us at this time to do the work that has been described. It has been an enormous lift, and it does not require the addition of a public health emergency, which, as I said, is a temporary and limited resource. And the timeline that you described was exactly correct. So the COVID emergency, the one time that this has ever happened in the history of Boston Public Health Commission, was issued in March of 2020 by my predecessor, Interim Director Rita Nieves, in conjunction with Mayor Marty Walsh and Department of Health and Human Services Chief Marty Martinez. And
I'm sorry,
that
the buzzer did go, though. I do want to be respectful to.
Okay, I didn't.
Because the time has the buzzer,
yeah,
and
so,
I'll have to wait for the next round for some of the questions I heard.
Yeah, and so what I will just say, I don't think this just happened, but I do want to be clear. Sometimes what happens is people ask questions and the answer is sort of filibuster, but I don't think that's what was happening here at all. Yeah. So no, you just had the bad luck of being the first person to answer before I got to say this. Mm-hmm. But basically, when I'm giving folks 5 minutes, if the answers, which this one called for a longer answer, but when we have answers that can be answered sort of briefly, please try to do that so that we can make space for more questions. In this case, where you're being asked to sort of outline a timeline and all these other things, that would require a longer answer. But in a situation where an answer can be just suffice with yes or no, please try to do that. Just try to be mindful of that, because if I'm giving them 5 minutes and then you're taking 7 or 10 minutes on an answer, then it's going to also get out of control there. That's not what happened here. This isn't a response to that response. It was something that I meant to say when I was telling everybody their time. And so I want to just make sure going forward, everybody's aware of the time constraints. What I will try to do is stop the timer on your questions. So when you stop speaking and stop giving a question, I'm going to actually pause that timer so that you can get a response back and then still preserve some of your time for follow-up questions. That's how I'm going to try and do this. So I'll do my very best to note when you stop asking a question so that I can pause the timer and save whatever time you have. And so that timer will go off when you're speaking rather than when they're speaking. And so we'll try to do that moving forward. Councilor Flynn, followed by Councilor Flaherty.
Thank you, Mr. Chair. Good to see you, Police Commissioner Cox. Commissioner, can you talk about when these tents will be taken down? There will be a presence of Boston Police there on site. I want to make sure, as I was talking to police over the last several weeks, I want to make sure that, and I was talking to the union as well, that we don't throw our police officers under the bus during this process. I want to make sure that when the tents are taken down, that there are no frivolous lawsuits against a police officer for doing his or her job. What are we doing also, Commissioner, to protect police officers that are trying to provide public safety during this critical time?
So I'll try to answer. Well, being a police officer over 34 years, I've seen that there's no protection against frivolous lawsuits. Anyone can sue for almost anything. We've certainly seen that over time. In regards to, protecting the officers, this gives clear instruction for us, a law for them to go by, and that's what they're very good at. We're very good at enforcing laws and understanding that, and that is exactly what this will absolutely help us with. The officers work hard, and we have no intentions of throwing them under the bus or anything of that sort. We just want to give them clear instructions so they can go about doing their jobs without having to overthink, right? They have instructions on how to go about doing it and who to do it with, and partner with all our city agencies to actually enforce this throughout the city.
Thank you. My main concern, and I think you answered the question, Commissioner, is I want to make sure that during this process that we don't place blame on police officers for doing their job and people that want these tents to remain up. I just don't want to see these frivolous lawsuits blaming the police for doing their job based on what we're deciding here, and people are upset, so who do you blame? The person that takes down the tent. I don't want to see that happen.
I don't either, but again, lawsuits are sometimes not in our control, and certainly, nothing I can speak to today. Commissioner,
C6 is kind of the lead jurisdiction, as you know, for Atkinson Street. A lot of our police officers from C6, and they do a tremendous job, supervised by Captain Boyle. But what are we doing to make sure that as we send so many police officers in from C6 into that area, that we also have presence throughout the C6 jurisdiction as well?
And so, we are going to have teams deployed, and it might not be just from C6. We'll have officers, specifically throughout the city to address this issue. It won't be just a burden of one area.
Thank you, Commissioner. Chief Dillon, it's good to be with you. Chief Dillon, are we prioritizing the homeless community that's currently living at Atkinson Street in these tents? Will they get any preference in terms of BHA housing?
So the effort to house or make sure that the folks in the tents right now are safe, we are identifying shelter spaces where they can go and be out of the elements and get services. Part of the people that are down there and part of the people that are in regular shelter and also just living in Boston, they're getting on BHA wait lists. So we do have resources from the federal government that we use to target housing our homeless. Those we're prioritizing certainly for homeless populations and populations that have been homeless for very long periods of time. So I think the short answer is no, but we are working with them to get their applications in everywhere and make sure that they're getting the resources that they need.
Well, the short answer is no, but if they get their application into BHA, they would be prioritized because based on certain disabilities.
Yes, they certainly under the BHA you get priority points for being disabled, priority points for being homeless, priority points for being a Boston resident. So all of those points certainly would give the folks living in Mass Cass or in some of the transitional sites priority, but it is a point system that we have to follow.
That point system where they're living in a tent, they would get Boston preference for living in a tent?
It depends on how long they've been here, Counselor. If folks have just arrived, no. But if folks have been in shelter or have been on the street for a long period of time, we have data showing how long people have been here for, where they're from. So we do have that data that we apply to applications.
Well, that's concerning to me is people living in Mass and Cass on Atkinson Street going into BHA housing. And the reason I say that, the people living on Atkinson Street, they need detox. They need medical care. They need mental health care. They need a drug treatment program. They don't need to be in a building where there's elderly people, persons with disabilities. When that person from Mass and Cass is coming in from Atkinson Street, still dealing with a significant substance use issue. I've dealt with these issues my whole life as a probation officer. That's a recipe for disaster. It's unhealthy for that person from Atkinson Street going into BHA, but it's also unhealthy for the impacted community in BHA, our seniors, our persons with disabilities, and veterans. I don't think that's a fair process, and people on that waiting list that could wait 10 years, I don't think it's fair to them as well.
Right. Just one quick follow-up. It is less likely that the individuals at Mass Cass or those living in the transitional sites are going to get BHA apartments. Like I said, we use more frequently the resources from the federal government that directly serve the homeless populations.
My final point or comment, as we discuss this matter, I always believed in decentralizing services in the South End. I represent the South End, along with Councilor Tanya Fernandez-Anderson and Councilor Frank Baker. I also represent Andrew Square, that's significantly impacted. I guess my final point is, having mentioned that, these are also quality of life issues, public safety issues, and we also have to make sure that the voices of residents in those communities are respected and heard. How will this ordinance help them? Will this improve their quality of life while we add more homeless communities, homeless centers in the South End area? Will this help the neighborhood? Tanya?
Thank you. Just want to make clear, I think the question's referring to 727, which is going to be temporary. The mobile teams are the answer to the question of what the city teams can do about some expected dispersion of activity that we expect to happen. We aren't naive, and so we don't think that everyone is going to take us up on the offer of shelter or transitional housing or the different options that we're offering. So for those folks, the mobile outreach teams will be deployed. They've been described. And what we have heard from outreach workers, both from Street Outreach Unit at BPD and on the Public Health Commission side, is that when they're engaging with people who are living unsheltered in smaller groups, the uptake of the services that we're offering goes up. There's not that element of peer pressure of a large group kind of exerting pressure for them not to take us up on those offers. So the hope is that with this mobile outreach, with that new format, that yes, the quality of life in the surrounding neighborhoods will improve. We're going to be in real time analyzing daily how the previous day went and whether our expectations are coming true, and I'll adjust as needed. It's hard for us to predict exactly where human beings are going to go and what decisions they're going to make, but we're trying to foresee every possible circumstance that could come about and adjust as needed.
Thank you. Thank you, Councilor Flaherty.
Thank you, Mr. Chair. Just some data I have is over a 2-year period, the Commonwealth spent $160 million on Suboxone, $160 million, and the overdose deaths went up. To Dr. Ojikudo, do we have any data on the number of people over at Mass and Cass that have been prescribed Suboxone or methadone?
Mm-hmm. I don't have that data on me currently, but we can certainly look into it and get it back to you.
That'd be great. Through the chair, I'd like that. Do you have any data on the overdoses at Mass and Cass over the last 2 to 3 years, fatal and non-fatal.
Okay, so I'll give you the data regarding fatal overdoses
Yep.
just in general across the city. I think it's important to say that Boston has experienced an increase, as you mentioned, about a 7% increase in fatal opioid-related overdoses. And within Boston, 352 people died in 2022 from opioid-related overdoses. Over the course of the period from 2019 to 2021, there's been about a 36% increase in overdoses. Those data are basically telling us that we have a huge problem. It's not saying that we're not doing anything to address the problem. And if you compare us to other similarly sized cities where there aren't strategies that we put in place, we're actually doing better than those cities. So just to provide that data.
What's BPHC's, Boston Public Health Commission, what's your position on detox?
We highly support detox, and as I mentioned—
Voluntary or involuntary?
So our preference is to refer people and allow them to choose detox. If you just look at the evidence base, that tends to be more successful if people are choosing to go into detox. However, there are cases in which involuntary mandates, Section 35 is appropriate, and when those cases are identified, we assist in that process. So again, it's a multifaceted approach.
Right.
It's not one thing.
Right, and given the crisis over there, would BPHC be supportive of more Section 35s? And I say that because I said it in my opening. Folks over there are not capable of making good, sound decisions, right? Their brains and their bodies arguably have been destroyed and or hijacked because of substances. So we have to do it for them.
So what I would say to that is that we've actually referred thousands of people to detox just in the course of the last year plus.
Do we track those? Do we track the success of that?
I was just going to say that you're absolutely right. It's very difficult. We do look at the data and see who's actually going, and a much smaller number of individuals is actually going. This is a major concern. As you said, addiction is a very difficult chronic disease. And we're working on a lot of this, and we continue to work on it. However, I don't believe that involuntary, commitment, Section 35s works in most cases. I mean, that's not what the data is showing us, but it is appropriate in some. And when it is appropriate, we do participate in that process and help the other entities move that along.
Well, the data is showing us is that Mass and Cass is a disaster, and that the fatal and non-fatal overdoses are going through the roof, and that we need more detox beds available. BPHC, Boston City of Boston, should be looking at a partnership with our Suffolk County House of Correction Sheriff to try to use some of the resources that he's offered that was shunned right out of the gate. He had a great novel idea to be a partner, and it was dismissed almost immediately, where he has the space and the beds, and we need detox beds to try to save lives. Shifting gears to our commission, good morning, commission. How is this ordinance different from the trespass laws that we currently have on the books? To echo some of the comments that my colleagues have stated, the chair and others, that we don't really feel that this is even necessary, that if like, for example, I go home to my house after this hearing, and there's someone that's pitched a tent in front of my house. I got to think I can call 911, and you guys are going to be able to remove the trespasser from in front of my house. So how is this different, Commish?
One of the things that makes a difference, you can enforce trespass throughout the city, but it prevents them from, thinking that you can just go from your street to a street over when we're not there. The fact is, it's going to be enforced everywhere. The fact is that it gives us an opportunity to, again, work with all our city partners and making sure they get the services they need, but yet not having these structures in little mini Mass and Cass popping up all over the city. It also gives us, our offices, clear instructions on how to go about, doing this and working with our partners. We're coming off a period in time where enforcement for law enforcement, particularly in engaging folks that deal with mental health issues, substance abuse issues, there certainly has not been a lot of clarity about how do we go about, doing our job. This actually provides some clarity for our officers, so we know that we can actually both enforce, but yet also work with all the city services to make sure that the people who want to avail themselves of services actually get it.
Right. And obviously, one of the issues, obviously, I served in this body during Occupy Boston, the strategy that the city and the police department use with Occupy Boston. I assume that some of those strategies are prevalent, at least in this situation. And one of the concerns I also have is the fines. I will go on record, friendly wager with the panel. steak dinner. If anyone in Madison Cass actually comes forward and pays a $25 fine, I think it's onerous. I think it's unrealistic, and I think the courts are going to end up getting caught up in the middle of folks getting stopped unless it's going to convert to an arrestable offense or allow in an instance of a warrant. So my ask through the chair would be let's not kid ourselves here, folks, right? Let's eliminate the $25 fine because it's not going to get paid, period. And if it does, steak dinner on me for anyone there, or seafood, or vegetarian, whatever suits your fancy. I'm a steak guy, but thank you, Mr. Chair.
Thank you, Councilor Flaherty. We next have Councilor Mejia.
Thank you, Chair, and thank you all for your presentation. I only have 3 questions, and I'm going to go through them really quickly in the hopes of getting through them all. I'm just curious if someone can just talk to me a little bit about some of the plans or any opportunities for collaboration with some of our neighboring towns. This is, I believe, a statewide issue, and Boston bears the brunt. So I'm just curious, as you all continue to deal with Madison Cass, can you just talk to us a little bit about what conversations are being had around this issue?
Thank you for that question. I think it's really important. This is obviously not something that Boston should bear the weight of. So we meet with the state in general on a weekly basis, and that's our entire team is meeting with them to talk about the options, talk about the availability of services across the state. And we have been able to move some initiatives forward through that open communication. We've also, through Boston Public Health Commission, also been meeting with the other large cities around the state, and we do that on a regular basis. We have a group of people who meet, and we've talked about these issues and talked about strategies. We've looked at resources in their towns, and we, provided, guidance, and they provided guidance for us.
Yeah.
So it's absolutely collaboration is number one.
I'm happy to hear that. Chief Dillon, in regards to the housing crisis that we happen to find ourselves in, just curious about what your what the landscape looks like in terms of our surrounding neighbors.
Sure. So specifically, I don't know if, yeah, there you go. So specifically, and Tanya can speak to this if there's more questions, but we are working with we're working with the individuals down there every single day. And as it's been stated, and as we all know, a lot of those individuals are not from Boston. They have arrived here for services or for other reasons. And so Tanya and her team and a lot of nonprofits are working, trying to get those residents back to their homes where they have more supports, and a lot of their families are looking for them. We're also working with the state as we plan for the upcoming tent removal in winter, looking at what shelters do we have in the greater Boston region that may have availability. And we are identifying beds for this population and just our populations generally, because it is a regional issue and people come to Boston. So on the ground, there's a lot of coordination with our state partners.
I'm excited to hear that. So I want to focus the rest of my time on a path forward, maybe a third rail, right? Because I remain hopeful, right, that we are now in a critical moment in the political climate, not just here in the city of Boston, but nationally, where people are just so on their side, and that's it. They dig their heels in it. But I'm just curious if each of you can really seize this moment to grapple with the fact that not everyone's going to win. What would a third path forward look like to address this particular issue in a way that is compassionate, in a way that helps people feel safer? Just would love to, each of you, if you were challenged to give us the third way forth, what would that look like? Because for me, I feel like we have to rise up to the moment and seize this moment to find a path that everyone feels like they've either won something or lost. So I want each of you to define for us what a third path forward would look like in this particular moment.
I can start. I think it's before us right now, and I'm not saying that because we're here, looking for support, but I do believe it is here. I believe in Boston, and I believe in our partners with the nonprofits that are down there every day, the mission and the drive that our city agencies have to fix this issue. And it's been really hard to work with the individuals that are down there, given the chaos, given the danger, given how unsafe the condition is. And I believe if we can take care of that, then all of these well-meaning and very talented organizations can get results.
Right, so I'm just gonna say again, right, I always say that Boston is resource rich, but coordination poor, right? And if we really wanted to open ourselves up to what is possible, I think about the work that we did with with Mayor Wu, and now Senator Edwards around the alternative to 911. Right? When I'm inviting you to be innovative, I'm inviting you to think about what are some of the things that we can do, right, that help support people in ways that is going to get us in a place where no one feels that we're leaving anyone behind. So I'm just giving you that as a prompt.
Okay, I guess I'll go next. I appreciate your question. I think that there are many aspects of our system that are just broken. I think that addiction is a chronic disease, not so different from other chronic diseases. It is relapsing and recurring, and we need to understand it as such. All of us need to understand it as such and treat it as such. I think we need better resources. We need a continuum of care for people. We have people going into detox and then having absolutely nowhere to go when after they've entered detox. We have people who relapse and then they're treated poorly when they re-enter the system. I think that we need the public health campus type options like Long Island will provide, and we need it as fast as possible, because without that, I don't see a significant change. You know, I'm not saying that what we're doing right now is not important. We need to do what we're doing right now. It's absolutely imperative. The public safety needs are overwhelming. But in terms of actually treating the individual and managing individuals and ensuring that they return to lives they deserve, to lives that are productive, we need more comprehensive care and services.
Yeah, it's a difficult one to answer, and I want to say everything my colleagues have said, I strongly agree with and support. Hard to engage with this question because, at least in my experience, we and our team are very much always talking about the need to focus on the work and ignore that type of back and forth or the conversation that's sometimes distracting us from where our focus needs to be. So I'm encouraged with being invited to participate in a solution-focused conversation. I agree with Dr. Ojikutu. We really need a true, real recovery campus where people can engage and feel safe and go through their journey in a safe setting. And I will say that there are approaches, Councilor Fernandez-Anderson often points at Portugal, and I think that's correct, that employ the full range of interventions that need to be made. So a place like that has overdose prevention centers, but they also have enforcement of open use. They have, safety is important and crucial, as is health. And sometimes people see those as opposed, they shouldn't be, and they're not. And that's why we all are working together, the Commissioner of Public Health, Commissioner of Public Safety, like housing, we're all here and coordinating because there is no one single answer, and we need all of those components to be part of our approach, simply said. And I don't know if I've answered your question, but that's my observation in the short time that I've been here.
This is a fairly complex issue, and it's certainly been going on a long time. Law enforcement has been involved with actually very inventive ways of dealing with issues and problems, but I don't think this is a public safety issue that should be driven by law enforcement. I think history has kind of shown that, particularly dealing with people with mental health and substance use disorder. And so, I'm not ducking your question. I just don't think that we should be the lead. We should be here to support all the services that are here today around that, and that's what we're here to do. Unfortunately, the biggest tool in our toolbox is, enforcement of laws. And the reality is, against this population of people, I don't know if that's the best answer regardless, except for the people that are preying on those folks.
No, so the clock, just to remind everybody, the clock only runs when you are talking.
Okay, am I done?
No, you got a minute.
Oh, wow. Okay, let me find out. So I just wanted to just really thank you all for your answers. And I think, Commissioner, particularly you, really leading with the fact that, and acknowledging that we're not going to, arrest our way out of the situation, and to really lead with that sense of empathy is really important. And I think that oftentimes so many of us do not trust law enforcement. We've had traumatizing experiences with law enforcement, And I think that there's something to be said about the amount of work that the city needs to do to repair the harm around how we have experienced the ways things work. And I think as we continue to have these conversations, it's about trust building, right? And I think people really need to see law enforcement showing up in ways that are more compassionate and really looking at people, not just their behavior. And I think that that is also going to be a part of the conversation in terms of the training, right? And the people who are out in these streets. That's why I mentioned alternatives to 911, right? Is that there are ways for us to handle this issue in ways that could probably strike a balance, because we do need both. And I acknowledge the fact that we're in a crisis on both sides of the fence here, right? People don't feel safe. And so I want to acknowledge that, and I appreciate your answers. Thank you.
Thank you. Tanya Fernandez-Anderson, Councilor Anderson.
Tea money bags. Thank you, Councilor Chair Arroyo. I'll just go through all of my questions and leave the time for you guys to answer, please. And then just a comment, quick comment. District 7, or most of these issues, or all of the issues are in District 7, my district. I don't share them across any district. So I am the only councilor with Mass and Cass, and I'm the only councilor with Nubian Square, and I'm the only councilor with Northampton, Albany, and everything else. So where Woods Mullen is, all District 7. I keep hearing, and yes, I know that Council Baker, with all due respect, has done a lot of tremendous advocacy, and this is near and dear to a lot of people's hearts. So I say this with respectfully and as delicate as possible. But I just wanted you guys to keep that in mind, and when you say you are leaning into the councilor whose district it is, then please know that. And then in terms of harm reduction work, or my experience with harm reduction, I understand entirely why you've gotten to this point. Because I got to a point where when I lost my clients, or would get a call 2 in the morning to come and collect belongings, because social workers or intensive care coordinators, we get those calls. And so when you get calls that your client or someone's passed, or you're the only phone number in that person's bag. So you come and collect you go to BMC, you collect information, or that, your client could just not report it and tell you, yesterday I was raped. And this is like the 10th time, and I'm tired of this. And so I totally understand how you got to the safety first. And in terms of harm reduction and social workers on the call and stuff like that, a HEART program, we're not there. We are where we have to do safety, and then social work, and then treatment, and then everything else. So my questions are, in terms of success rate, with housing and treatment, just wanted to know them by percentage and timeline. If you can give me a timeline from the notice of sheltering to transitioning from temporary shelter to permanent housing to treatment. So is there a timeline that you foresee? What services are those permanent housed receiving post-treatment? And what does wraparound look like? What resources do you have to implement wraparound for those populations? How many permanent and low threshold shelters and treatment facilities exist in District 7? Roxbury South End, Grove Hall, and Fenway, if you can think of that. Do you have records of the numbers of those relapsing, not just overdose? I already got those numbers. As well as, would you consider an independent task force that would provide oversight? So some sort of partnership or collaboration between, DA, police, Boston Public Health Commission, city, and community that would actually provide some oversight to update metrics to the community, synthesize it so that it's more user-friendly and digestible, but also so that alleviating you from constant meetings and repeating yourselves over and over and over, where it just feels like you're repeating the same thing and people are not listening, but it's just a really complex topic. So I wonder then, measuring metrics or monitoring progress means that you have to report it out, you have to revisit, you have to re-strategize. And what would that look like? Should it be an independent task force that brings everybody together? And then there are mini mass and casses in Nubian Square, in different seeping into into South End, as well as Grove Hall. I know Councilor Rell shares the same issue as well in his district. And so what are we doing to clean that up now? And then can we do that, can we enforce the same? Can we prioritize Nubian Square as well to clean it up as well? And again, I come from a background of working with this population for a very long time. I never mentioned what exactly I did, but I work for WCAC, which is Women Connecting Affecting Change, working with women in sex industry work, doing HIV counseling and testing. I worked for DMIC with infectious disease. I worked for Roxbury, Children's Services of Roxbury, doing intensive care coordination, and I work for Department of Mental Health, working with dual diagnosed there as well. And so and so I have a very dynamic background. You know, I say this all the time, like over a decade of this work, and I'm still not an expert. I'm not even close to what Dr. Jakutu knows. Hey.
Timer went off.
Hey, did it?
Yeah, do you have a question?
So I'm leaning into you as experts to give me.
You asked a few questions, right?
You trying to play me?
No, your timer went off.
Oh,
I'm just
did
trying
it?
to figure out
Alright.
if you ask questions so that they can answer them, and then we can go to the
I
next.
asked a few questions.
All
Can
right,
Can I wrap up my sentence?
Yes.
Thank you. I want to say that I still feel like I'm not an expert, not even halfway, not even half of what you guys know and have experienced. And I really support the work that you've done and have studied it back and forth and compared it, and know that you've done a tremendous job. Thank you.
Thank you, Councilor Anderson. Was there a question that you posted, a standing question?
What, 7 of them?
Like all of them in a row, right?
I asked, it doesn't matter who answers, I asked 7 questions.
Okay, I can say so. Okay, we'll figure this out. Okay.
Happy to do another 5 minutes.
Okay, I can give some of the information that was requested relating to the low threshold sites and how people are doing in them, and then can give you the locations of those sites, the broader types of housing or shelters that are available citywide. I don't have that data, but I could just kind of concentrate on the 5.
Just D7, yeah.
Thank you. Okay. So the used to be 6 with the roundhouse closure. Now we have 5 low threshold sites. I'll just name them. There's the Friends Floor in 112 Southampton Shelter. There is the Willows program on the 5th floor of Woodlawn Shelter. There is Envision Hotel in Mission Hill. There was the Roundhouse, no longer. And we have the Shattuck campus hosting the Cottages program, and the Pine Street at Shattuck Low Threshold Shelter. So those are within Franklin Park. Those are the locations. In those programs, we do have a 1-year report up on the website that has the data that I'm gonna read off. People in there, since moving into the low threshold site or permanent housing, guests have been surveyed and have shared the following. 79% of them were accessing a medical provider. 22% are maintaining access that they already had, and then 57% gained access once they went into the low threshold site. Mental health providers, same. We have 64% reporting that they have access, 43% already had it, and then we gained an additional 21% once they entered the site. And 93% are telling us they have access to housing counseling, 29% maintained access, 64% newly had access. And then improvement, we have people reporting improved access to regular meals, sleep quality, give me a second, connection to other people, just social networks in general, and self-report, increasing their ability to think about the future and kind of engage in, planning around their future. As far as substance use treatment services in the sites, we have 53% at the 1 year mark engaged in medication for opioid use disorder, another 35% engaged in other substance use treatment services or mental health services.
Thank you.
I don't know if there's more housing. Yeah.
The only thing I was going to add, and it's we can certainly do an inventory sweep of all the programs in D7, both supportive housing, affordable housing, and any shelter facilities, and we can get that to you in a matter of days, Counselor.
Thank you.
Was that all the questions?
No,
Which questions did they not answer?
the timeline for their plan.
Oh, I could do that. Sure. So if the ordinance gets approved, when
You said 2
under
weeks
the
notice.
ordinance, huh?
After the 2 weeks notice.
Correct, yeah. So under the ordinance, when the city offers housing, transportation, and storage of belongings to individuals, tents and tarps won't be permitted. That'll be enforced through a combination of stationary mobile units, both from BPD, BPHC. Actually, hold on, this doesn't have the time. Let me back up. Work that is currently happening kind of in preparation of this ordinance maybe passing. Outreach teams coordinated are refining the by name list of people attached to what types of needs they have. So we're trying to find out if person A, B, or C, are they amenable to shelter? Do they have family ties that they would be amenable to going back to? Are they actually seeking treatment? So we're trying to kind of compile that list of what possible avenues we expect people to take. Obviously, this is going to be an ongoing conversation with them as people change their mind every day, but we're trying to have in mind kind of those conversations that have been had and keep them in mind as we triage them out of the area in that 2-week period after the ordinance is passing. Currently, teams are also gaining commitments of resources dedicated to the effort. That's mostly being led by Chief Dillon and Dr. Ujikutu. Where are we accessing additional shelter beds, additional beds for DMH patients, additional treatment and detox beds? All of those conversations are currently happening in preparation. Some of those sites are in Boston, some of those sites are not. That's a good thing. If the ordinance is approved, what our plan would be is the day right after being ready to provide notice to people. So we'll say, this ordinance has been passed. In a couple of weeks, in 2 weeks, we are going to be enforcing the ordinance. And then we're gonna do intensive outreach with city outreach workers and additional outreach workers that we are kind of asking from our partner agencies. We've made those asks, so expect to have like a larger team of outreach workers for this 2-week period where we're providing notice and talking with people one-on-one about their plan. Are they planning on going back to a family member? Are they planning on going to treatment, et cetera? So we'll be doing that intensive outreach, street-based, for 2 weeks, trying to depopulate the area as much as we can before an enforcement action. We're gonna be training those outreach staff. We're gonna obviously prepare all the notifications that need to be provided in writing. They're gonna be translated to all the languages that people use down there. The city storage policy should be implemented by the time we start that notice period, where we're expanding that service. 727 Massachusetts Avenue space will be opening also in that 2-week time frame. If the ordinance is approved, and then lastly, the enforcement action we would expect would come 2 weeks or so after ordinance passage. After that, the city teams would reformat outreach so that it would be mobile, expecting that we will encounter people in different parts of the city. So that is a reformatting of the outreach, and the current response that we're providing to encampments that do pop up citywide every day that our team heads up will continue just under the ordinance instead of the existing encampment protocol.
Thank you. There were 2 more questions. The other one was about actively preventing free encampments in terms of Nubian and...
And what was the second one?
And the other one is the community, the task force concept of oversight.
So the plan is that to actively, to be in all parts of the city, but more importantly, we're prioritizing Nubian Square and Grove Hall, 2 of the places you made mention. And I don't understand the purpose of oversight when we're trying to actually do something first, because we don't know what it is that we would need oversight for. So I wouldn't probably be for oversight right now. We're just trying to get the job done.
With any, may I? With any plan, any action plan of this type, especially in public health, you certainly have to make it tangible. And so therefore timeline, that's crucial, and oversight reassures implementation. And if you're doing it wrong, then we come back here. If we're voting on something, that's how accountability, in my opinion, should work. But it's an idea.
Thank you. Did they answer the other question too?
I'll yield.
All right.
I'll come back.
Thank you. Councilor Durkin, and then it'll be Councilor Louis Jen.
So I support the administration's commitment to lead with the public health approach and housing first model. We know that policing will not end homelessness or our housing crisis, substance abuse, and the need for mental health care in our city, but I appreciate that there are multiple prongs, and I respect the administration and commissioner's recommendation that this is needed to make the area safer. I want to make sure those at Mass and Cass are treated with compassion and that their rights are protected in this process. And I appreciate Tanya and the street outreach team for everything you're doing to work on the ground. I know those are really hard jobs, and I appreciate everything that's going into that. So I just have a couple of questions along that vein. And this first one's for Chief Dillon. What does the emergency shelter capacity to accommodate any influx caused by this policy, and how would that work, and sort of any recommendations or thoughts there?
Sure, and I think it's a very valid question, especially as we head into winter. It is no secret that the city shelters right now for individuals and families are very close to capacity. So we've been working very hard with our shelter providers and partners to, 1, bring on additional beds, and 2, make sure that we're reserving beds for when the tents do come down, that these folks, that the individuals that are staying and living in Mass Cass will have something offered to them. We will certainly try to accommodate their needs and where they want to be, but we really do want to ensure that we've got enough space for them.
Thank you. Regarding storage of property and belongings, I obviously know that I read that in the policy. I thought it was a really important thing to add to the policy, but just wanted to ask, it's referred to in the ordinance as the city storage program policy, and I know that is an existing policy. So Tanya, could you answer more about sort of what it's doing to prep, because obviously there's additional needs for storage, and there's obviously more people than when this policy was initially created.
Yeah, I'm happy to address that. So currently the city has an existing storage program under the Public Health Commission. It doesn't have an existing storage policy. That's what we've crafted, and kind of as a companion to the ordinance that has been filed.
And is there like a checklist, or is it in the form of a checklist?
It's in the form, let me just kind of describe what it's like. Yeah. So the current program, what it does is it was set up to take people's belongings who were going into low threshold transitional housing or other placements during the January 12th intervention. So people are allowed to store their belongings. The program is keeping them for up to 90 days. It's actually kept them for a lot longer as people go through their journey. And then they retrieve their belongings once they enter permanent housing. Sometimes they don't retrieve them, etc. But it's kind of a one-time deal. The change with the new storage policy is that it's going to be expanded to provide regular access to their items. One thing we've seen in the encampment happening often is that people will be prevented or choose not to go to a doctor's appointment, and housing navigation appointment, a court date, like important things that they should be going to because they're afraid that their belongings will get stolen or damaged or whatever if they leave them, which is a valid concern. It's the only thing they have in life. And so what we want to provide is a way for people to store their belongings, but have regular access to personal documents, just daily items that they need to live their lives. And so that would be the change. It would be accompanied with a policy that describes all this, that will provide to the individuals along with the written notice of the encampment closure.
Thank you. So there is a concern, and I guess this is for everyone, including the police commissioner, and appreciate my private conversations with the police commissioner around this ordinance and the need for it, which you repeated today in your opening statement. There is a concern that once this policy is in effect, it could create a distribution effect, little versions of mass and cast throughout the area. But obviously, we know that with the Housing First model, trying to get folks in supportive, low threshold, and temporary housing is, part of this model. So I just wanted to speak to sort of the public safety, what you've been seeing, Commissioner, throughout the city. And because obviously while I really appreciated Councilor Tanya Fernandez's comments about mass and cast being in our district, but we're all experiencing various levels of homelessness. I know Council President Flynn and I share the Copley area, and so we've been seeing an influx over there. So just wanted to speak to how this ordinance might impact the entire city, and maybe how some of these, the ordinance may impact the city.
Well, I think the goal of the ordinance, as far as public safety is concerned, I mean, certainly law enforcement is concerned, is our ability to enforce it everywhere. So it will have less of an impact because the fact is that we're ready, willing, and able to actually reach out to the folks in different areas that might have moved, avail them for services and the ability to move their property or what have you, and then see if they can seek help or move on, so to speak. That's the goal of it. The goal is not to create many places all over the city. It's actually to stop that from going all over the city, and also making sure that people who want services and need services get the services.
Thank you so much, Commissioner Cox. And then Dr. Jakutu, thank you so much. Very nice to meet you again in this setting now as a new counselor. Obviously, mental health has been a huge priority of mine, and spoken to a lot of people who deal with outreach at Mass and Cass. And obviously, not everyone is looking or able, mental health-wise, to do all the steps necessary even to meet with outreach workers. So just wanted you to speak a little bit to the mental health struggles that folks are dealing with at Mass and Cass. And obviously we need to overcome them to make sure people really have the wraparound services they need. So if you could speak a little more to that.
Absolutely. I think that's a really important point that you're making. If you look at the data that we collected very early on in this process, what we found is that most people had some co-occurring mental illness. Now, whether that was at baseline or if it was caused by substance use, it's neither here nor there necessarily. Certainly, most of them also didn't have a mental health provider, though we have spent a lot of time engaging with providers, and we have people who are on the street from the Department of Mental Health, from the state, who work with us very closely. But there's an enormous need, and I think it's imperative, particularly as we think about mobile teams and engaging with people who have severe co-occurring mental illness, that we have the skill set and the knowledge base to engage them appropriately. And I think that's one of the things that we're working with our street outreach teams. And we have a Recovery Services Bureau with Boston Public Health Commission that is skilled in engaging people and developing the kind of connections with people so that we can hopefully move them closer to getting some access to services. But there are not enough services that are available. We know that that's the case, and that's certainly something that we need to work on.
And I know we've heard politically calls for urgency in this body around mass and CAS, and I really appreciate those calls. But I think what the administration is providing is a tangible solution to some of the issues. It's not going to fix everything. So Chief Dillon, I was honored to join you last night at the NAB Homelessness Forum, just as someone watching. So could you speak a little bit more to the overall strategy of the city's housing and both low threshold but also affordable housing, which is one of the ways that we prevent homelessness in the city?
Sure, and we are certainly, firing on all fronts to increase the amount of income-restricted housing throughout the city. I will say that we have been going after every resource to house our homeless populations, getting new money from the federal government, putting that into vouchers and actual new bricks and mortar permanent supportive housing. What we were talking about last night at the library, and it was a really good conversation, was really increasing the city's permanent supportive housing inventory. And this year alone, we have already finished, or they're in construction, over 700 new units of permanent supportive housing, mostly for individuals, but some family. And we do have a very robust pipeline of about another 500 units that's going to serve our homeless population more generally. And for folks that are watching, this provides affordable housing that individuals and families can afford, and very robust services on site and 24/7 oversight. We have about 10,000 units in the city, but certainly I think you've heard today that we need more.
Thank you so much, Chief Dillon. And I just want to say, heard from many people at the NAB Homelessness Forum, just your commitment to housing in the city is something that people really look as like aspirational. And so I really appreciate the administration and everything you've done over so many years to promote housing, because these issues, as you know, are they're all interconnected. And so when there are housing opportunities in our districts to support housing, I really want to connect that back to, I think a lot of people are talking about these issues as if they're in a vacuum, and truthfully, we need to approve housing and supportive housing everywhere in Boston to make sure that this crisis and others are avoided. Thank you so much.
Thank you. Councillor Louis Jen, it'll then be Councillor Worrell, then Councillor Baker, then Councillor Lara, then Councillor Coletta, and then myself. Councillor Louis Jen, the floor is now yours.
Thank you, Mr. Chair, and thank you to my colleagues for asking a lot of really great questions, and to the administration for answering them. I just wanted to point out that if someone comes on your private property, that's private property and trespass. The difference here, and the difference why there's need for action here, is we're talking about people who are in public spaces and who have constitutional rights to be in public spaces. And so I just wanted to clarify the difference there. My questions really are three for this round. One is with respect to the language of the ordinance. I know that it's not a working session, but I alluded to this in my opening remarks. When we say making emergency shelter space means a city authorized location or alternative sleeping space practically available to persons experiencing homelessness because of the trauma that I identified in the beginning, that you've identified, Director Del Rio, and everyone has identified, that people who may not feel comfortable in shelters, or where shelters present barriers for people who are coupled. What does practically available mean, and what will it look like in practice and in implementation?
It sometimes turns on when you talk.
Oh, okay. Thank you. I think there is a debate to be had, mostly, I hope, amongst lawyers about what practically actually means. But I can talk about the kind of how we are operationalizing it.
And I actually, that wasn't that wasn't meant to be like a legal. That's not how I'm approaching this at all. Like, I actually just want to know what it's going to mean in practice, what it looks like. It's not about like the legal language.
Gotcha. Okay, I'm more comfortably answering that, because I do know
that was not like
people will debate what
it
practically means.
No.
Okay, but I think the recognition for us that traditional shelter spaces have been difficult to access for the populations that you've talked about.
And that you've identified in our conversations as being
correct.
Like the most difficult.
Specifically, people who are couples. In a system where there's the men's shelter and there's the women's shelter, asking people to separate sometimes it is something that they decline to do because of safety concerns and because of if you may be married, you have the right to be with your partner. So there's barriers for couples, barriers for people who are trans or non-binary. Again, we have a shelter system that's divided up by a gender binary that doesn't fit with people's identities. We have people who, due to mental health concerns or other concerns, have been barred from shelters. We have people that have been barred from every shelter. And so those folks also have barriers to access. So the space that BPHC is bringing on 727 is thought about to prioritize exactly those folks that might have, I think PTSD is another concern, people who have trouble being in a congregate setting with a lot of people. So for those folks will be prioritized both for the low threshold shelter sites that we've been talking about. They are set up to accommodate especially those concerns, as well as 727 is thought about to be a space that can accommodate those folks and make a safe space practically available.
Okay, thank you, Director Del Rio. Related to that question is why that location, and the related question to that is like, what did community input and process look like sort of when thinking about location or where to expand or to close the Welcome Center? Like, what did that look like, and why? My understanding is, like, you know, it's the inventory of BPHC land and what's available, but if there's more to it as to why that's the location, I think I'd like to know, and members of the community would like to know as well. And I say, you know, we were out there yesterday and, you know, putting in those 311 requests because of found needles and caps and the fear about it getting closer to where you know, where people reside. And so I just want to put on the record, like we mentioned 727, the reasoning behind that.
Sure. I'm gonna, if it's okay, I'm gonna defer that question to my colleagues.
Okay. No, yeah, sorry, I've been looking at you, but.
Okay, so thank you. I think it's an important question. It's something we've spent a lot of time thinking about. We know that we needed a space. We know that we needed a space for just the population that is not going to work. Congregate shelter is not going to be appropriate for them. So we essentially went through the inventory of spaces that are available to the Boston Public Health Commission, given that we operate the two largest shelters with 112 and Woods Mullen. This is what we do as part of, sort of our city mandate. We looked at the spaces and we had a limited set of options. And so the 727 space is a space where there have been clinical services to meet the needs of this population in the past, not most recently. Most recently, it housed our programming for child adolescent health. And they were, concerned about being in the area anyway. We moved them out of that space and we plan to set up in that area. I think there's been a lot of concern about locating the space on 727 Mass Ave, which I completely understand. We've spent an enormous amount of time thinking through the operations of the space and the fact that these will be 30 individuals that have been identified that we know that are already on a housing pathway, and that we will try to hurry through that housing pathway because most likely they don't want to be there either. So that's one thing. The second thing is that we have a security plan that is more robust than what is present or currently present on Atkinson Street, which includes metal detectors, amnesty lockers, multiple security forces, both outside and inside the building, as well as a check-in process, check-out process that we have sort of worked out with our security forces. And we have the backup of the Boston Police Department if there are issues in regards to the space. So we've taken this very seriously, and we've met with community members and heard their concerns and made some adjustments based on their concerns, and we will continue to do so, and happy to talk more about the space.
Thank you. Dr. Jakutu, what were those adjustments, like just some of those adjustments?
So I would say the biggest adjustment that we made, we initially were going to have clinical space available there for not just the 30 individuals, but for others. As we've expressed in our opening statements, we've had partners who've had to pull out of the Atkinson Street area and are no longer able to provide clinical services
like
at the engagement
healthcare
center.
For the homeless.
Yes, exactly.
Yeah.
Healthcare for the homeless at the engagement center. We were going to move them into that space. We heard that is a concern, having people come in and out of that area. We're no longer going to have that be available. We're going to focus in on having a temporary space for those 30 individuals.
Thank you, Dr. Ojikotu. And then my last question for now is one that, again, talking to residents all the time, but specifically yesterday, this idea that we need to be putting a lot more of our effort into treatment and what that looks like for folks down there, which I agree. I wish that we had a way of ensuring that everyone was able to enter treatment, and that would lead to their successful curing of the disease of addiction. But we know that there are a lot of even failures within our treatment system. So if you could talk about, I'd love for folks to get like an example of what happens when someone is able to access treatment. What does that look like? Who are the providers? Is it coming from us, BPHC? Is it coming from the state? What does it look like? And where are the biggest holes that we can identify, even if it's not us that are the ones executing? What are the biggest holes that we can identify in the process of detoxing treatment that we can sort of help mitigate or at least start to think about?
Sure.
Mm-hmm. Thank you for that question. I'll just speak to mine and my team's experience in kind of street engagement and trying to observing how that process works. I've shared with many that I'm willing to place a stake in our bet that 99% of the people that are frequenting the Atkinson Street encampment, whether they're living there or just visiting, they've tried detox at not once, not twice, but 5, 6, 7, 8 times. And for me personally, and I think I speak for my team, I hope that that's a painful process to watch. It was described earlier. If someone's going to detox, if there's not a treatment bed or at the end, a longer term treatment bed available to them at the end of that process, too often they come back to the street, and that's certainly very painful to watch. The Public Health Commission, ourselves, take care of referring people to the treatment system. The treatment system is operated in kind of, the state is the entity that provides oversight for that system. They license a number of treatment providers that are independent of each other. They're independent organizations that provide this service, and for many reasons, privacy amongst them, it's hard for them to share information with each other, much less with ourselves about, when someone is being discharged. Like, can we set up the next step for them? And so sometimes that happens, and it's great, and you see someone following a path. But unfortunately, that's not what I see most often happen. What I see most often happen is that crack between you went to detox and you need to go to the 30-day bed or the longer term bed. People fall through the crack as they're making that transition, and it's I think that's something that needs to be worked on. Again, I'm not kind of an expert on that system, but that's what I've observed. I don't know if my colleague can add a little more.
Sure. I'll just briefly add a couple of things. I think there are a number of problems within the detox system, and it's not to say that there aren't beds available. Oftentimes, the services that are provided are just not long enough in duration for people to come out of them and sort of enter into any sort of longer-term recovery. I think
is there an ideal time? Do we know?
So some people just have speculated that what we really need to do is think like 90 days as opposed to shorter periods of time. They have 30 days acute, and there's shorter periods of time that people are in detox. I say this to say that we're in a new era in terms of substances and synthetic opioids, as opposed to when these sort of treatment programs were actually established. And that's not to say that people are not trying to be innovative, but it is about financing. It is about, the systems, the operational management of these services. So I do think that there's some adjustment that needs to be made just in terms of, detox in and of itself. Secondly, the point that my colleague just made about having nowhere to go. This is incredibly problematic. Not having a wraparound system that not only provides people with a place to go and rest their head, because sending them back to 112 and Woods Mullen, that is not appropriate for anyone who has just immediately entered into recovery. They need a pathway. They need not only housing, we're talking about workforce development, if it's educational services, if it's financial assistance, we need better systems of care for people. It just doesn't make sense, and it's not set up to be successful. I would also say, and I think one of the counselors said this earlier, that we have a system here in the United States where there are whole groups of people who are reluctant to even enter into the system. And a lot of this is due to structural racism. And I understand I'm probably on a timeline here, but I would say that if you look at some of the data in terms of opioid-related overdoses, there's a disproportionate number of Black and brown people who have suffered from opioid-related overdoses over the course of time here in Boston. And a lot of that is due to decreased access to treatment, to services, decreased willingness to enter into, and how they are possibly treated when they actually get there. So there are some serious things that we need to think about as we continue to develop better services and more comprehensive services moving forward.
Thank you, Dr. Ejikutu. I think, yeah, I appreciate that answer, and also Director Dario. I did say that was my last question, but I do have more time, so I'm just gonna ask one quick question to Commissioner Cox. It's not a quick question, but what the role of BPD in the Madison Cass area over the last 6 years has seemed to change a little in terms of quite a bit actually in terms of interactions with people who are down there. This is from conversations with officers who used to be in the Madison Cass area. So what has the role of how has the role of BPD changed in the Madison Cass area, and why? I believe there was a time when there was more proactive engagement with folks who are residing and living on Atkinson Street, and now that engagement, we don't see it as much.
And so I can't speak to the entire time, so I was away for a few of those years, there's no doubt about that, but I mean, the world kind of changed. You had a pandemic in between that period of time where people just went around, people in general, including our officers, just worried about, you know, sickness and illness and things of that nature. So, and then when it's time to actually re-engage with people again, I think people have been reluctant to do that a little bit. And, you know,
But why is that? What is that reluctance rooted in or related to?
It could be related to a host of reasons. I can't attribute it to one thing, but I certainly, you know, the public police relations over a period of time during the protest period was, you know, not the best in the world. And so probably, you know, maybe some officers didn't think that it was appropriate, and rightly so, to engage with you know, people who are suffering from, you know, both mental illness and substance use disorders. You know, they thought maybe it's not our role because, you know, the public was actually saying that. I think there's a whole host. It's not a simple answer, but I do know it's something that, you know, whether it's Madison Cass or just the community in general, we need to do more of it. I think we've been very good at it in the past, and we're going to work on not only getting back to where we were, but actually being better for it. But it's not just a Boston issue. I think it's a nationwide issue around people and relations and talking in general. There's a lot of things going involved. Add in the fact that our numbers are a little bit, you know, deflated as what they were before, and probably a clear direction. Again, that's why the importance of the ordinance is there. Clear direction on what are we there for? Are we there to enforce? Are we there to, you know, why are we there? And I think this ordinance, at least the way we're, you know, presenting it to them, it's a law on how we're going to enforce and who we're going to partner and enforce with, to give them that direction so engagement will be a lot easier so that they can actually do their job without overthinking.
Okay, thank you, Commissioner. But there's been no policy change that you know of or that you're aware
of? Regarding Madison Cass? Written policy change?
Yeah. No. Thank you.
Thank you. Councilor Worrell, then it'll be Councilor Baker.
Thank you, Chair, and thank you to the panel, and thank you to my colleagues for all their great questions. They've asked a lot of my questions that I had, but, you know, Dr. Ejikutu, you just said, you know, the system doesn't have, like, you know, comprehensive services, and, you know, sometimes leading, you know, structural racism might stop people from entering into the system, right? And, you know, in 2 weeks, right, we're gonna give the notice, and then 2 weeks later, what do we expect? Right, knowing, you know, that some people might not go, and what do we expect Madison Cass to look like? Do we expect like every tent to be down in 4 weeks after this passes?
So I could briefly just say, I would expect that people who are down there to sell drugs, people who are down there to pillage, the people who live there will leave, start before it ever gets there. That's the hope and goal, and if not, we'll address that, once we get there. But that's the biggest expectation that I would have around this.
To add, there's a group of people that are descending on the area to prey on others. I think the hope is to discourage them from coming down. There's a group of people who are not unhoused but are coming down to engage in the drug trade. The hope is that they'll be encouraged out just by the fact that the encampment and the dynamic is closing. And then there's a group of people that are engaging with case management teams strongly and looking for support. And the goal is to place those people in the most appropriate setting for them. And that's going to be a mix. Some people are going to be going into treatment, and we have seen even now, like just with this being in the news, an uptake of people thinking about it or talking about it or saying, yeah, I think my plan is going to be to go to detox. So there will be some people that are triaged out into treatment. Some people will be triaged out into shelters settings if appropriate for them. Some people, as I mentioned, may not be willing or able to use shelter, so they'll be prioritized for the low threshold side beds that we're trying to kind of make available for this effort, as well as the 727 space. Those are people mostly that are already known to us and have been engaging. Unfortunately, there's not been the space, like the opening for them to go, but they are engaged and we know them. And then I think there's going to be, and my hope is that this is a small group of people. It's hard to predict, but the smaller group of people that choose to not engage in any service, or they'll want to continue in their active use, they might move along and set up in different parts of the area, and that's where the mobile outreach teams from BPD, from Public Health Commission, and ourselves as the coordinated response team that kind of orchestrate the different teams that respond to an encampment. It's not just them two, Public Works, parks, schools, different departments, and even other outreach agencies participate in those setups, depending on where the encampment is, who the individual is in the encampment, if they're already engaged with someone. So our team kind of air traffic controls a specific response to a specific encampment. We're learning those of those locations currently via elected officials who reach out to us, such as yourselves, 311 reports, or resident direct information, so they'll call us, or that type of thing. So we expect that work to become much more of our day-to-day than what it is now, because we're so consumed with responding to this large encampment.
All right, and then speaking to that, if a resident saw, a tent pop up, in their neighborhood, are they calling 911, or are they putting in a request for 311?
Yes, I can answer that, and thank you in advance for your help, counselors, in spreading the word about how best to kind of respond to this as just a member of the community, a neighbor. If someone is witnessing an emergency situation or criminal activity, or if an encampment is in their private property, so if it's trespassing, they should be calling 911. So if they see someone in medical distress, maybe they suspect they're overdosing. If they see open air drug use, if they see, again, an encampment being set up in private property. So anything that's an emergency or a criminal matter, or matter of enforcement, 911 is the right tool. If someone is setting up an encampment, or just someone looks like they're unsheltered and in need of outreach or support or a conversation about triage, the best way to report that to our team would be via 311 or directly to me, my colleagues at the coordinated response team. And then that's when we put together kind of a specialized approach for each encampment. So we are familiar with the hotspots, Copley, Ziegler Street, Nubian in general, and are already responding to encampments in, I would say, almost every neighborhood in Boston.
All right, my last question is, have there been any studies regarding the health effects to involuntary displacements that you guys are aware of?
Okay, I appreciate your question, Councilor Worrell. I think one of our biggest concerns is that when we displace people from this aggregation on Atkinson Street, where we systematically and routinely reverse overdoses, once people aggregate, they may be overdosing in places where we can't reach them and we don't know what's happening. Okay, so that is our biggest health-related concern. And that is why we put forth this concerted effort to develop these mobile teams. Does this solve the problem? No. I mean, honestly, we are going to do our best to get out there, to be present with BPD, with the coordinated response team, our team at Boston Public Health Commission, and to engage as many people as possible. I think in addition, we will probably just in the proximal area, just around Mass and Cass, certainly around the area of Finland, Albany, 727 Mass Ave, where we're having this temporary space, we're gonna just have additional eyes on the area. And that includes, in fact, our security services who have become very familiar with and understand how we operate and have been assisting in reversing overdoses. So what you will see, hopefully, when this is implemented is a change in just the appearance of the area and the number of people you see out on the street, which is because we want to make sure that people remain safe and that we don't have a spike in overdoses during this process.
And are we increasing the capacity of the mobile outreach
Absolutely.
team? Okay.
Absolutely.
And what do we, where are we at and where are we going to? And then also just like a proposed, budget on the whole initiative. I know where, the warehouse, the increase of staffing. We'll have to get an idea of like the proposed budget.
Mm-hmm. So once we have the complete mobile outreach operations plan finalized, because there are still some pieces that need to come together, we can make that available to you and all the other city councilors. The plan right now is that there will be 4 teams. Of those teams, we're going to have several people from recovery services who are, equipped and able to, help with harm reduction and addressing, overdose prevention sort of needs. And the plan is for them, these 4 teams, to basically look at the abutting areas. So certainly a team in the South End, a team in Clifford Park, Nubian Square, Orchard Gardens, a Newmarket team, of course, the South Bay Mall area, and then a team for Moakley Park, Andrews Square, and other associated.
This is 24 hours?
So the idea is that overall the process is going to be 24 hours, but part of this is that we are also limited and we're trying to work on our overall staffing, and I'm just trying to be as transparent as possible. We are working very closely with BPD. They're increasing their role and their staffing for this effort, in addition to us increasing our staffing and pulling in. We have jobs that are available. We are pulling in, reeling in. We're task shifting, bringing people from our other areas at the commission to do this work, to train and do this work. So we're bringing in a lot of people to make this happen, and our hope is that we will be as available as possible so that hopefully we will be able to provide services 24/7.
I could just add one other component. Right now, the city, the Mayor's Office of Housing funds Pine Street's outreach van, and they have vans going out, as you know, all day, and then they have vans at night. And they're very, very effective at meeting with people that have set up encampments and helping them get into shelter, or getting creating all different alternatives for them. We have been in dialogue with them. They're going to be making some of that resource available for this effort because of their skills.
Awesome. And then lastly, the $25, is that tied to a license, what is that tied to? Is it just a regular citation? Because I then agree with, Councilor Flaherty, might as well just nix it. Yeah. All right. Well, thank you.
Councilor Baker, and just a reminder for folks, the 5 minutes is on your speaking time, not on theirs. On the second round, we'll deviate from that to try and move it, but on this one, your speaking times what counts, not theirs.
Thank you, Mr. Chair. Do you feel okay today, Mr. Chair? You agreed with me earlier.
Oh, no, I agree. I agree with
yeah,
Michael.
And so
I
did
agree
Council
with you.
Lara. I just want to put that out there. If everybody, reporters, you heard that.
Yeah, I don't know that we agree. It's a weird day.
There was a,
right.
We're working
through.
Good. I'm going to throw out some questions first that'll just be like sort of data things, numbers, sorts of things. How much is our financial obligation, from whenever I think Roundhouse opened in 21, financial obligation for those couple of years, for all 6 of our low threshold, how much should we spend on them? Especially if you can section out how much we've spent on just the roundhouses. Doctor, you gave us the overdoses for 22 fatal. There were 352, so basically 1 a day in 22. What were the overall overdoses, so reversals there, and also can we get those 2 numbers for the 3/4 of the year up to now? Is it just the Finlandia building? Not the Finlandia building, 727, that's the Miranda Kramer building. I heard something about the Finlandia building also. Is that on the table also? How many beds total? Miranda Kramer, right. Commissioner Cox, what does this ordinance do for you that you cannot do right now?
One, it's an enforceable, law that we can, actually give to our officers citywide because this impacts the whole city. It gives them direction about dealing with it. There's no time limit, so you don't have to wait 48 hours for people to up and move. It helps prevent this from happening all over the city. But for the most part, we have over 1,000 different officers that are going to be responding. They need clear direction on how they're going to respond to these things to make sure that we enforce in a way that both the public and the city demands and this issue demands. And so an ordinance for this day and time about all the issues that we have going on, it's really, really important for us to be able to do that. They need clear direction, and I think this goes a long way in helping us do that around this.
Okay, thank you. And in the cover letter for the ordinance, it talks about doubling down on low threshold housing, and it talks about doubling down a lot on coordinated approach. So this ordinance goes into effect 60 days anyway, so if we don't take any action, correct me if I'm wrong, it goes into effect anyway. So we're listening to this to get an understanding of it. If we were to vote it down, does that mean we still just stand on the outside and watch everything happen? We can't do coordinated responses, and we can't engage people, because in Tanya, in your line of question, you were talking about people that are down there to engage in the drug. Maybe they'll just go away. Well, when them going away means they're going to Andrew Square. They're going to Andrew Square, Dot Ave, all basically into my district. And so that really concerns me. I think we know who the people are. I'm sure there's 100 people down there now that are bad actors that we could go in today, right now, and arrest. I'm sure there's multiple people in there, and you hear a lot of people talk about how they're incompatible with the shelter system, because they don't want to even go by the rules in the shelter system. We're looking for that person to put them next into a neighborhood someplace, into housing. It's a little baffling for me. We're going to take individuals, well, they refuse to go into housing, all right, let's put them in an apartment building someplace. Tell me where those apartments are. I don't want to live there, I think. You know what I'm saying? Maybe I'll be wrong, maybe you're all right, but I don't think so. I think we're going about this the entire wrong way. I think we have empty assets all over the place. Nashua Street, Nashua Jail is a place that I think we could probably get 500 beds in there that could be long-term. Dr. Odukuchu talked about, we have to change about the way we're talking, and I totally agree with you about that detox. We look at the detox as, okay, 7 days, that detox kicked them out because they have the drugs out of the system. Well, their problems are just starting now that they realize that they're not numbing themselves. So, my issue with the money going into all the low threshold housing, probably hundreds of millions of dollars, I don't know, or hundreds of millions in everything we're doing. We're going around cleaning up after 1,000 people. The bid, Public Works, literally cleaning up. Okay, move out, we're going to clean you out, and then you can all come back. like, when does it feel like we should be building programs and really being open to all things being available? And if we built a program at Nashua Street that was basically a Section 35, Section 12 type program, where I would venture to say if you had 90 days for people down there in a space where they knew they were going to be able to just be for 90 days. Do you want to say something, Doctor?
Oh, I didn't want to interrupt you.
Oh,
Please
okay,
finish.
okay. I thought you had something to say.
I'm going to say something, but.
Well, so those 90 days, why aren't we looking at building the programmings that it's treatment first? Treatment first. When we're down there and clearing everybody out and say, okay, who needs a house? Who needs a house? The 40 people that call me nearly every day for housing, should I send them down there too? Sheila, you know what I'm talking about. The people that have lived here forever and can't get them housing. But yet the guy that won't go into a shelter because he doesn't want to pay attention to the rules, it's crazy. Thank you.
So if I could jump in, were you going to? No, go. Okay, I just want to jump in and just talk about treatment for a second, because I want to clarify a point that I made earlier in terms of treatment and treatment pathways. I absolutely agree with you. It needs to be reformed. I don't want to give it a specific timeline, though, because what I think is part of the reformation is that we're really looking at a continuum of services that need to be provided for somebody who's suffering from addiction, and addiction from very powerful substances that it's not going to be cured in a couple of weeks. And so it's the whole idea of changing it from acute to really just a whole system of truly chronic services. So I wouldn't put an exact time on that. I want to be careful about saying that. I also just wanted to say that a system that incorporates this issue of mental health services and truly incorporates it so that people are linked to services when they leave, not just housing, as I said, and I didn't mention the mental health services piece. And I just want to provide the data that you asked for. Yeah. So you asked about opioid reversals. And what I can tell you is that in 2022, Street Outreach plus Boston Healthcare for the Homeless reversed 399 overdoses. That's 399 individuals who did not die. So far in 2023, this year, Street Outreach has reversed 220 overdoses. I think these data need to be more clear.
Do you have the fatals up to now? And is that only in the Massachusetts area?
I don't have there's always, the death data is always lags. Okay, that's why we only have data for the state that only goes up to the end of 2022. So that's why I gave you that data. What I think needs to happen and what we're working on is that we're actually working on a dashboard that will provide these data more openly, more clearly accessible for the public, because I understand that there are a lot of questions about exactly what's going on. So we're working on that.
Okay, and money, do we get back to me in money, or can we by the end of this hearing, can we have it here and stated publicly?
I don't think I'm going to have those numbers tabulated, Counselor. We have provided that data to you before, but we can certainly update it over the last several months. But your office has received that several times, but glad to update it. It might be day's end or tomorrow, but be glad to get it as quickly as we can.
Yeah, and just a point of clarification, Atkinson Street, which is the epicenter of this problem, is in my district.
Yes.
The 727 was in my district. Through redistricting, I've lost that piece.
Counselor, if I may. Counselor, I just wanted to address a couple of things briefly. What would happen if the ordinance doesn't pass? We're going to continue with the coordinated approach. We're going to continue providing case management and referrals to treatment and everything that's currently being done, as well as the enforcement that's currently being done. We are here because we think it's not enough, and we want to be able to step up that response. And just to speak on the low threshold sites themselves, I want to clarify for folks that they are providing housing and treatment first. That's the information I shared before about what's happening at those sites is that people are entering recovery through different pathways once they enter those sites, and they enter into recovery or treatment at higher rates.
But you give us percentages of numbers that we don't know, and you talk about conversions on getting people into housing. There's not enough talk about treatment and how many people are actually getting treatment, completing treatment, healthy today. You're telling us about how many houses you got people into. Which is good if they're sober in that house and they're not wreaking havoc on the people that are living around them.
Correct. That's the information I was providing a little bit earlier about in those sites, how many people are engaging in primary care, mental health counseling, as well as substance use treatment. That work is happening in the sites, so they're receiving both housing and treatment and mental health support.
And I'll just jump in here just to say that if, I know my colleagues, I know Councilor Flaherty had questions for data that they don't have present today. Councilor Baker, if any of my colleagues have questions like that, please send them to my office in an email, and then I'll make sure to follow up as the chair and distribute that to all of my colleagues.
Thank you.
Thank you. I believe next we have Councilor Lara, then Councilor Coletta, then myself, and then we'll take a quick stock of it and keep going. So, Councilor Lara.
Thank you, Chair. I want to start off by just asking us to get rid of this notion that the opioid epidemic is only at Mass and Cass, and that people who are struggling with addiction are only living down at Mass and Cass, and that we are taking the people from Mass and Cass who are struggling with addiction and putting them in places where they are with people who are not struggling with addiction or where they're doing X, Y, and Z. The opioid epidemic is absolutely everywhere. It is in every single one of our neighborhoods. It is in it's at BHA, it's at work, it's here at City Hall. There is absolutely no way that you can look at the opioid epidemic and say that there are not people who you are working with who are not struggling with addiction. It is absolutely everywhere. It's not an issue that is at Mass and Cass. And so to say that people who are struggling with addiction are not functioning or are, not in certain cases productive members of our society, I think I just want to make sure that we're kind of like not holding that belief here, because what we're talking about is, are people who are struggling with addiction fine if they have housing and family and a job, versus people who don't have family, housing, and a job who are down at Mass and Cass, what they get versus what we're offering to other people. So can you tell me how many people are currently living on Mass and Cass that need shelter? You made a comment earlier that there were some people who didn't need housing there. How many of those people are there, and how many of them need shelter, and how many of them don't?
When you start talking, it picks up.
Yeah. With the caveat that the number fluctuates here and there, between 70 and 80 people are unsheltered.
Okay.
There's a number of people that do utilize the shelters, but kind of are in the area during the day. And then the total average number of people that we count each day right now is around 150. It got to above 200 during the summer. Mm-hmm. There is a seasonal kind of component.
So about half
to
and
it.
half, you would say, maybe 60-40 in terms of people who you believe need shelter. How do you determine that people don't need shelter?
We talk to them, we ask them.
Mm-hmm. Great. How many available shelter beds do we currently have now?
I will get you that. It changes every single day based on weather, so I will get you that number.
Okay, and how many shelter beds are we anticipating making available if this ordinance passes?
So right now, I've identified 80 beds that we would set aside, and I'm working on a significant additional number, including those outside of Boston.
And for the purpose of this ordinance, how are you defining shelter?
Plus the 30.
Plus 30.
Yeah, it's in, it's
plus
80s in the 30.
Got it.
Yeah.
So 110.
Excuse me, I'm sorry, Counselor.
Sheila, to add to the low threshold sites right now are trying to make beds available, so as people are moving out into permanent housing, we expect to have some beds available there.
Okay, and for the purpose of the ordinance, how are you defining shelter? Are you talking cots, shared space? Are people
It's a
restrooms?
combination of all the resources we have available. Certainly a bed/cot, but the shelters have beds. They don't have cots necessarily. Some availability in the low threshold sites.
What does that look like?
What's that?
What does a low threshold site look like?
So the 6 sites that we set up, which is now 5, we are, as I mentioned earlier, we have 135 beds in those 5 locations. 85 individuals have a housing resource, so we're working with them to move out of the low threshold sites, and that will provide additional availability as this initiative moves forward.
In the ordinance, you talk about alternative sleeping space. What is the difference between a shelter and alternative sleeping space?
So I can just speak to the sleeping space that we've established. It is a space that's 727 Mass Ave, which we've talked about. It is a space where there will be no more than 30 individuals who will be in that space on a daily basis. There will be beds that are available there. There will be services, so there'll be food, there'll be bathrooms, there will be case management that will be available. The reason that we did not necessarily call it a shelter. Really, we were just looking to differentiate the fact that it's not, this is meant to be temporary. You know, this is not meant to be an ongoing shelter, new shelter that's been established in the area. We are utilizing this as a way to be compassionate and cognizant of the needs of individuals who are already on a pathway, who are on the way towards getting a housing resource, and who we would like to provide and keep in the area so that we can continue to work with them to get them on this sort of road to recovery. So
And
that's
what
why
do
we
they do during
called
the
it
day?
that. During the day, they are allowed to stay there. So there, it is a day space. It's not just a sleeping space. I just want to clarify. It is a space where they could sit. They
Same
could be
thing in
there.
the shelter.
No, well, so I think it depends on the shelter. Sheila, would you like to talk about the different shelters?
So most shelters are 24/7, the larger shelters, people can stay there all day. There are some that are just at night, just night spaces. And then there's shelters like St. Francis House that is available just for the day, and individuals go back and forth. But the vast majority of shelters are 24/7.
And part of the reason why I'm asking the question about the shelter specifically in terms of how you're defining shelter and where people are actually going is that there have to be some sort of extenuating circumstances for people who are living on the street right before the winter under threat of violence, as you are describing it, to say that they are not going to go into a shelter and stay on the street. What do you think those reasons are? Why are people who need housing not taking shelter spaces?
I can speak to that based on my conversations with the people that are staying on the street and not in shelter. It's a little bit what my answer to Councillor Louis-Jean was. There are people who, disproportionately, if you're part of a couple, there are people who want to stay together, again, for their own safety or because they are a couple and they want to be together. There are people whose gender identity doesn't fit the binary system in the shelters. There are people who feel like, who've experienced their items being stolen or other fights or sometimes.
So for these people, the shelter does not feel like a safer space.
Yes,
than
there
being
are people
outside.
that are telling us that, yeah.
Okay. There's an incredible amount of violence, of stealing, of sexual assault that happens within our shelter system. Has anybody on this panel ever lived in a shelter?
No.
How often do you visit the city shelters?
Daily.
You visit
In
the
my
city
case,
shelters
yeah.
daily. Do you ever surprise visits to the shelters?
Here and
We do surprise visits as the director of the Boston Public Health Commission. You know, we go there
You
frequently.
go there to visit. You're there often. I'm assuming that folks are not here. If you are asking the city council to pass an ordinance that is going to take people's homes, remove them from where they are right now, and under the guise of that, which is you're ultimately criminalizing having a home on the outdoors, and the veil of it is that we are doing this in a humane way because we are providing them a place to sleep. And you cannot actually guarantee that there is going to be safety, and for the most part, most people do not feel like they are going to be safe inside of the shelter system. Then we are not actually doing what we say we're going to do. We're creating the availability of these things, but if the shelters are not actually serving their function, which is to create a safe space for people to get out from again, living on the street in what is soon to be a cold winter under the threat of violence and sex trafficking and X, Y, and Z. And people are saying, no, actually, that is not safe for me. So I am not going to choose to do that. And by then, Councilor Anderson is there? There isn't a solution for that. There's that I'm hearing, at least from the conversation that we're having, none of that has been presented to us as saying, yes, we're actually going to do this and we can provide safe housing for the people who are down at Massacas in addition to that. I have a set of other questions that I can do in the second round, particularly around the safety of the workers who are down there and the coordination for providing services with the Boston Police Department. How is the Boston Police Department playing a role with the people who are down there providing services? I've talked to, we got a letter from AFSCME. We've talked to SEIU 888, the workers that are down there. How is the Boston Police Department coordinating with the people who are providing services? if they are also being victimized, what is the role of the Boston Police Department in coordinating to make sure that the people who are down there providing services are safe?
Okay, I'll take the one about shelter being safe or not safe. Like I said, we have had individual conversations and know the likely pathway that each person wants to take. They're all different. There are some people that say to us, yes, if this closes, I will avail myself of a shelter offer. Some people are going to choose treatment. Some people will reunify with family, and a lot of people have been waiting for the low threshold sites. Like those, that's kind of what a lot of people like to do. And unfortunately, in fewer cases, there are people that are being pressured to stay outside, you know, due to someone that's out there kind of exploiting them, a dealer or whatever else. So we are hoping to solve for all of those issues through the offerings, by opening 727, by stockpiling and making available the low threshold site beds that hopefully solve for the people that don't want to enter shelter, and there are people that are going to enter shelter or treatment. I'll let Commissioner answer the question about BPD.
Yeah, so the environment down there is so many people, you know, in that space between the tarps and the tents and all the things that go on that, you know, the environment has a culture that is just not safe, period. Right? And we can't see it, we can't get to it. You know, we have officers that are attacked down in that space, down in Mass and Cass. Yeah, you know, we are there to support certainly everybody in the city, you know, and keep them safe. But the environment created, you know, where folks from outside the city, folks from all over who have no intent on, you know, getting services, have no intent on actually really abiding by any laws, rules, are allowed to be around a lot of other people. It just creates a culture that it's an unsafe culture, flat out, which is far different than I think in a shelter. I don't know if I've heard anybody say, I'd rather be in Mass and Cass than a shelter because it's safer. Right? I mean, there might be reasons why they don't want to be in a shelter, and I don't want to speak for that, you know, personally, but it's not because it's not safer than Mass and Cass. Right now, the stuff that's going on down there, it is, you know, it's become a public safety issue, and the reason why we want to engage is because we want to, you know, we want to help protect. I mean, they don't have anything, but the fact is they do need our services just like everybody else, and we can't do that with those tents and tarps up. That's the reason why we're engaging. We want to help everybody who works down in that area stay safe. We want to make sure that, you know, the public is served in that way, but we can't do under these conditions right now. We need law to enforce that, right? And that's what this ordinance is helping us do.
There, but that didn't answer my question, but
We'll do it on the second round. You can get that around. Councilor Coletta, and then myself.
Thank you all. First, thank you, Chair. Thank you all again for your testimony and your hard work and dedication to solving this crisis. I do appreciate the humanity-centered approach that you all are providing, in addition to your staff, so just thank you. I do want to just say that hearing about the unsheltered victims and the gender-based violence that's happening, the sexual violence and human trafficking is gut-wrenching, and it is compelling for this ordinance, I have to say. I think it is our collective and shared responsibility, no matter whose district it is, to do everything we can to stop some of these heinous crimes and acts from happening. And so I just wanted to put that out there and say that I recognize that. I do want to get specific with the timelines in the immediacy if this ordinance does pass. We talked about the 2 weeks that folks will be notified and then placed into a centralized system where they're given a series of options. And from what I'm hearing, it's an and option. It's housing and treatment or services. I'm wondering what the metrics of success in terms of timeline is, if that's been identified or established, to finding these individuals truly stable housing. I'm not talking about the shelter system that Councilor Lara just referenced, but what is the timeline of finding these folks housing? And I ask that because right now, you, Chief Dillon, it is incredibly difficult to find housing for folks who are going through eviction, or finding housing for folks who are going through an emergency situation like a fire or a building collapse. And so I'm wondering if that has been established and if you can speak to that, please.
I can respond to that, and I think it's a very, very valid question. You know, it is, and I wish I had a precise answer. It is hard to predict exactly how long it's going to take to get someone housed, and once they go into shelter. We are targeting resources to this population and to all of our shelters more generally. We did, as you know, receive a very significant grant from the federal government several months ago, and which is going to provide spaces for people that are unsheltered, well over, I think there's 300 opportunities. So we certainly plan on using some of that resource for people that are leaving the Mass-Cass area and having to go into shelter. I will say, from what we've heard from Elliot and some of our very important partners down there, trying to engage with residents or people that are living on Mass-Cass now and dealing with all that they're dealing with in a very unsafe condition, it's hard to engage. It's hard to engage on potential relocation to host communities. It's hard to engage on housing. It's hard to engage on recovery and other services. So even though shelter isn't ideal, it is a way, it's going to be easier to engage with people as they put their paperwork and their lives together to move on to housing. So we are going to use some of this federal money to house these folks. After that, it all depends on what resources we have, right? And we are building a lot of permanent supportive housing, and so that's coming online in the next 6 months, and we have others in construction. So really, it is sort of feast or famine in the housing research world, where we go after everything we can, and then once we accumulate, sometimes it's federal, sometimes it's state, sometimes it's construction projects that we're overseeing, then we deploy those resources as quickly as possible. But our goal always is to work with people to get them out of shelter as quickly as we can.
And Chief Dillon, if I may add, my expectation is that this work is going to be ongoing. Back in January 12th, when the encampment, when there was an intervention at that encampment, everyone was placed in low threshold sites. And within a few months, people started coming. I will say I'm probably on the 3rd or 4th kind of different cohort of people that I see frequenting the area. When I first started, the group of people that were there, completely different group that I see today. Many of them have been placed, many of them have entered treatment, many of them have left on their own. So, you know, there is a constant flow of people. There's been a need to serve unsheltered folks since, I mean, the Pine Street van started, in the 80s or 90s? And they've been doing that work. It was a need before, and it will continue being a need because people, you know, it's a larger question than, or larger challenges that Councillor Durkin talked about. So I am inspired and excited that more permanent supportive housing is being worked on. Dorchester, in Charlestown, and in other places around the city that is crucially important. And yeah, but I do expect this to be ongoing work.
Thank you so much. How many units in the city of Boston do we recognize that we need to build for permanent supportive housing? And then what do those conversations look like with other cities and towns?
Yeah, I think, so as I mentioned earlier, we have about 10,000 units that are set aside for the majority homeless individuals, some homeless seniors, and some family supportive housing. We have another 1,200 units either just completed or in the pipeline. So we have about 1,000 individuals right now in shelter at any given time. And then we have, at the last point in time count, we had roughly 150 or 160 individuals on the street. It is worth noting, and one person is too many, but Boston does have the lowest unsheltered rate in the country. And it is because we work very, very hard at building and making sure that our folks are not living on the street. So I want to get these 1,200 units completed and then really look to our next 1,000. I think that's a pretty good answer. Let's get the 1,200 completed, and then let's look for locations for another 1,000 units of permanent supportive housing.
Thank you. My last question has to do with jurisdictional issues that we've already encountered. We talked about the statewide coordination at a macro level, and this question's really focused in on the day-to-day on-the-ground response. It's very clear that the mobile unit is very effective in getting folks into the treatment and services that they need. And we know that the proliferation of encampments will pop up in various neighborhoods. We've already seen it in the North End, near Lovejoy Wharf and behind a DCR rink. And this is where that jurisdictional issue comes into play, where BPD has said in the past, that's not our area, we're not going to go. And then DCR says we're not going to go. The Parks Department is looped in, and I find myself frustrated and just trying to get these folks the services that they need. So can you talk about what that sort of coordination has looked like with state agencies and how this ordinance might affect those relationships with both state agencies as well as Massport, because District 1 has a large coastal area where folks congregate. So would love to learn more from you on that.
Yeah, absolutely. It's our team that heads up the response to all of those encampments. We're intimately familiar with the folks who have been frequenting Long Wharf in the area that you're talking about. And people are very smart and they understand the jurisdictional issues, so they know that when there is a little more coordination to be done, our response will be slower. So they do tend to set up in places where we have that kind of jurisdictional issue. I do want to just clarify, and this is for kind of an issue that is, or I guess a narrative that happens citywide. Good example is those folks in the North End. They're not people who have ever been seen, or at least in my time here, frequenting the Mass and Cass area. They choose to set up here because it's an area where they're familiar, et cetera. So we work with those folks individually, and I know kind of housing agencies are engaged to get those folks through the long process of getting into treatment, permanent housing, or whatever it is. So we'll continue doing that work. And we do it in collaboration with state police, DCR, MassDOT, where whoever the property owner is kind of who's in charge of doing the cleanup. However, Sergeant Muscaratola from the Street Outreach Unit won't let me lie. Street Outreach Unit does provide outreach, as well as BPHC, Pine Street. The outreach piece is done no matter who the property owner is. So BPD is present, BPHC is present, Pine Street is present, no matter those jurisdictional issues. But when it comes to cleaning up the debris remaining from an encampment that's been resolved, that does always fall on the property owner, and that's where we can sometimes hit a hiccup, and it's happened in Long Wharf and other spaces.
Thank you.
Yeah, back of the Shaws and Eastie as well.
Thank you, Tom.
Yeah.
Thank you. So it's been said over and over again, public safety, public safety, public safety. The problem is this is bad for public safety. That's just the short, and for me, I don't know, we'll get to this part for you, but I'm just gonna quote from this article from the Journal of the American Medical Association that was published April 10th of this year. Says that today the Journal of the American Medical Association published a study that shows encampment sweeps, bans, move-along orders, and cleanups that forcibly relocate individuals away from essential services will lead to substantial increases in overdose deaths, hospitalizations, and life-threatening infections, as well as hinder access to medications for opioid use disorder, along with other detrimental impacts. It says specifically in hundreds of different projections, the model showed no feasible scenario in any city where continual involuntary displacement has a neutral impact or improves health outcomes. Instead, the practice would likely result in a significant increase in morbidity, mortality, and a shortened life expectancy, the study found. The model suggests encampment sweeps, bans, and move-along orders could contribute to 15 to 25% more deaths among the unsheltered population if you do it over a course of 10 years. Specifically, quoted here is David Peary, who is a co-chair in one of the lead studies. He says this is a seminal study that demonstrates how the criminalization of homelessness harms the health and shortens the lives of vulnerable population of people condemned by poverty to sleep on our city streets, particularly for African Americans and people of color. We now show that homeless encampment sweeps, which displace and scatter unhoused people, compound their trauma and suffering and lead to increased hospitalizations, overdose, and deaths. It sounds like a public safety issue to me. In this study, they found that modeling from all 20 cities that currently do this revealed the following: 151% increase in overdose mortality, 11% reduction in life expectancy, a 50% increase in hospitalizations, a 6% increase in serious injection-related infections mortality, and a 30% decrease in medication for opiate use disorder initiations. So that's one study, but let's see what it looks like in real practice. Bloomberg, not known for being a very liberal paper, in 2023, June, a couple months ago, under title NYC Homeless Encampment Sweeps Failed Audit Finds, said that Lander's office, who did this audit, said that added that DHS was not adequately tracking or following up with people caught in the sweeps, especially those who refused immediate shelter. Public spaces didn't remain cleared. A spot check of 99 sites that were swept found that people had returned by nearly a third of them by April. A spokesperson for the Adams administration now responded to request to comment, probably because it wasn't a very good finding for him. Landers finds square with research commissioned by the federal government that shows it is both expensive and ineffective to clear encampments. Municipalities across the U.S. spend millions of dollars annually managing and sweeping encampments only to shuffle homeless people from one location to another while eroding their trust in the government. Then we have another finding, still Bloomberg, where they go into the cost of this. Bloomberg, the high cost of clearing tent cities. A first ever study of homeless encampments finds that cities are paying millions in clearance costs only to shuffle unhoused people from one camp to another. Which is why we're talking about mobile teams. None of this is new. This isn't some new novel idea. We've cleared camps in Boston several times while I was a counselor and while I wasn't one. I know that it hasn't worked in Denver. I just read over the weekend about it not working in Portland, Maine, or last week. I know it hasn't worked in San Francisco, hasn't worked in Los Angeles, hasn't worked in San Jose, hasn't worked in Sacramento. I have a study here saying that it doesn't work anywhere. Do you have anywhere that you're using as an example of clearing encampments and sweeping encampments that has worked? And what data are you using and evidence are you using to declare that a successful model? Do you have any model anywhere in the country?
To clarify, Counselor, we're not conducting a sweep.
Whatever. I don't care about the language. I asked you a specific question. Do you have an example or a model of a successful clearing or encampment policy in the entire country? Do you have a single place? And what metrics are you using that? I have dozens that have failed. I have studies from the Journal of American Medicine that say this fails. I know that when we say public safety, we're not really talking about their public safety, because when we're talking about their public safety, you would instantly say if you're jumping up their mortality rates by that kind of percentage, that's pretty terrible. So I just want to be clear, is there an example anywhere in this country of an encampment sweeping policy that has been deemed successful, and what metrics are being used to deem that successful?
Counselor, we are not conducting a sweep because we agree
what
with the data you
model?
just talked about,
So
which
what do
is
you
why
call
we're
it?
not doing
What do you
that.
call it? A move along order? What do you call it? Because I've heard over and over again that you're dispersing Atkinson Street. So you don't like the word sweep. I get that. What word do you like for that?
The people who are unhoused and needing services, we're going to place in.
I didn't
places
ask you
where
that question. I asked you specifically, is there a model, an example anywhere in the country? Is the answer no?
That's why we're not doing that.
Oh, okay. Is there an example of making it illegal for people to live in tents in public spaces and temporary shelters that has worked anywhere in the country? Show me that. What are you using? What's your evidence-based backing for this policy? Do you have any evidence at all that this works anywhere in the country, and what evidence are you using?
Again, that's not a policy we're doing.
I'm not asking about the policy. I'm asking about, do you have any evidence on the policy that you're proposing, which is literally the criminalization of tents, where you've literally said, I've been here for 2 hours, I've heard over and over again, you're going to disperse Atkinson Street, you're going to try and make it smaller and more focused, you have mobile outreach teams, that's called dispersal. You can say you don't want to call it a sweep, you can call it dispersal, you can call it an eviction, you could call it whatever you want to call it. I don't really care. Do you have a single example in the entire country where that kind of policy has been successful? Do you have one, just one?
The policy of placing people in low threshold housing or shelter
Okay, so I'm going to take that as a no, because I don't have all day for this. So
which
no.
is why there's no studies on it.
It
It's a
hasn't been
novel
done?
and
Are you
innovative
trying to
approach.
tell me that hasn't been done in any
It's
other city? Because that's what New York
The low
said
threshold
they
housing
did.
model where we're triaging people into is innovative and started
So
here,
what you're
there's no
saying,
other
so what
examples.
you're saying is that in no other city where they have outlawed tents and outlawed encampments, have they also said that they would connect them to services and shelters? Is that what you're saying
not
right
in the
now?
exact same way and not with the model that we have.
Okay, so is there any example of this model that you are using that has worked anywhere in the country?
They've not done it this way anywhere else in the country.
Okay, so this is a novel idea is what you're
Yes.
saying. Okay, that's all I needed there. Sure, go ahead.
It's not on the public health side, but I would certainly say that there's ample examples of when you disperse large groups of people that are engaging in criminal activity, that crime goes down and that environment gets better. I would say that there's tons and tons of examples.
So I'm just going to add, because you jumped in on this. When you're talking about dispersal of areas where criminal activity, I don't even know what examples you're going to use for that, like
you
nationally.
just said that. I was just making reference to
Yeah, I get that. But what I'm also saying is that there's nothing that stops you from going in and arresting sex traffickers, from arresting drug dealers, from arresting people who are using. There's literally nothing that stops you from doing that. If you put a tent in front of Michael Flaherty's house, there's nothing stopping you from going to get that tent off that public way. I got a phone call just as a constituent about a basketball court hoop that was on a sidewalk that they made take them. They made them take that down.
So yeah.
So what I'm saying, just because I want to respect time, but I also get really worked up about people trying to tell me that something is a public safety or public health approach when there's no evidence anywhere in the country that this has ever worked. And so we can keep saying these words because they sound good, but words have meanings. And this, by the definition of those meanings, if we're trying to do evidence-based approaches to this, nobody here has presented any evidence that this has worked anywhere or why they think this would even work here. We're talking about having to have mobile teams of thousands of police officers patrolling the city because we're going to disperse them from one location. Ultimately, for me, I look at a couple of different things. One is the proposal worth looking at as it's in the way that it's formed from a public health, public safety standpoint? To me, it fails on that metric. And I'm just going to, because of the interest of time, I'm going to jump into the second metric where I think it fails. I'm going to read from a February 2023, also this year, Massachusetts Attorney General rules criminal law enforcement against those sleeping outside is unconstitutional. Boston Bar Journal, February 9th, 2023. Here's the quotes from that. Specifically, they cite in the decision, this was a case against Situate, and we'll get into how this tries to avoid that problem. They cite in this Eighth Amendment decision, the decision carefully reviewed and summarized federal court decisions from around the country, including a recent opinion from the U.S. Court of Appeals for the Ninth Circuit, holding that the government, and I'm quoting, cannot, consistent with the Eighth Amendment, enforce anti-camping ordinances against homeless persons for the mere act of sleeping outside with rudimentary protection from the elements or for sleeping in their car at night when there is no other place in the city for them to go. We'll get to that in a second. The Supreme Judicial Court of Massachusetts has also repeatedly affirmed that the law of Massachusetts, quote, does not permit punishment of the homeless simply for being homeless. Now, what you're talking about in front of me, what I have in front of me, doesn't talk about your mobile sharps plan, doesn't talk about any, like a mobile plan, none of that. What it talks about specifically is outlawing tents. That's what it talks about. And then it has a couple of things that I'll probably have to get into in my second round that are vaguely defined. The city shall temporarily store unattended eligible property. What's temporarily? It never tells me what that is. It says that one of the ways in which we will do this under the section for offer of shelter, in the event of a violation of this ordinance, the city shall provide or cause to be provided an offer of available emergency shelter space to an individual experiencing homelessness and, when requested, transportation to the available emergency space. It doesn't say who's supposed to do the transportation. It doesn't say who's supposed to make the offer. It actually puts the burden on the homeless person to ask for it. That's ridiculously difficult to put on folks. I know people who don't ask for their own rights who aren't dealing with the issues that they're dealing with. And on top of that, it doesn't say that they have to be notified of that transportation. Only upon request do they have to be notified that they would transport them there. The other issue I have with this is, when are we doing our tally of emergency shelter? Is there a daily output that goes out? This is an actual question that I want to answer. Is this a situation where we do a early morning check-in, hey, we got 70 beds, and then you have people out arresting folks or putting folks in shelters, but there's actually no space for them because we've already reached that capacity? Are we doing up-to-the-minute check-ins? Who's responsible for doing that? How are we monitoring that? From a legal standpoint, if somebody is arrested for this, the first question I would ask is, what proof do you have that there was available shelter at that time, and what proof do you have that that was actually made available to them? And this doesn't give me any mechanism for literally securing that information. So what I'm hearing is, frankly, this is a policy based on all of the research I have done and based on the lack of evidence that has been presented to me by this body of a successful version of this, because this is some novel new thing making it illegal to have tents. Essentially, what you're telling me is this process probably doesn't work from a health standpoint for the individuals that we're talking about. From a legal standpoint, there's a number of questions that I still have from an implementation and legal standpoint. And then when we're talking about, so for instance, first step is this even worth it? Second step is, can you even do this? Both of those things have question marks. And then there's nothing stopping you from arresting someone who's dealing drugs, arresting someone who's committing acts of violence, arresting someone who's doing sex trafficking. Nothing stops you from doing that, and to say that the tents is like the end-all be-all of sex trafficking is kind of wild to me, and I will say that it hasn't been so much said on this panel, but I have had the administration in their conversations with me about why I should support this, essentially fear-monger that. What I'm saying here is that my number one concern are the people who are on Mass-and-Cass. My secondary concern is how do we make it clear simultaneously to them and in other ways effectively protect them from those who prey on them, but also provide services to them. This disbursement, to me, doesn't really offer that up. And I'll just give one example of something that you stated earlier, which is for some cases, people are actually banned from every shelter in the city. For someone who's banned from every shelter in the city, then there is no temporarily available shelter for them. And so I don't know how we would solve that problem legally. And so when we're talking about all of these things, I want to first off applaud the efforts to create more temporary low threshold housing and turn that into something to be done. I've repeatedly asked for that to be in my district over the course of time. I've actually asked people to look at that because I understand that there have been real fights against that kind of housing. Ultimately, I support the administration's efforts to do this. I see this as a reversal. I see this as a return to bad policy. I have no doubt, based on all of the studies and all of the models and metrics and things that we can use in other cities across the country, that this won't work. And I haven't been provided any evidence that it will work. Nobody here has provided any evidence that they can say, hey, this is why we know this will work. I've heard it's a long-term plan, we don't have the housing. And so I'm gonna end it there so I can go into the second round. I think most of the questions were answered. I want to give you an opportunity to answer the question. I don't know if it's better from Tanya or from you, to answer the question about how that check-in happens, about how much space is available and how often is it happening at the point of contact? Is it happening earlier in the day? Is it happening repeatedly through the day? How is that being overseen? How are we making sure that's actually happening? And then I'll go to a second round with folks. I'll take a quick break, or I'll check in with folks. I think some of our panelists want to take a break. I'll take like a 5-minute break, but let me send that over to you.
Sure. So the 2 weeks prior to when the ordinance goes into effect, and we are going to ask people to remove their tents, I'm working very hard with my colleagues to identify places, a variety of places and a variety of conditions where people will have access to go. Once those are full, and we do this every morning routinely anyways, we gather, every shelter in the city does a census, we know what's available, what's not, and then problem solving begins. And that happens every single day. A census is done every single day. But to your question, we're going to be very, very intentional every single morning to know what's in real time, what's available. One comment about some of the research, and I would like to study it. I've read some of those studies. Boston is a right to shelter, Massachusetts is a right to shelter state. And a lot of the areas where they're doing sweeps and people have no place to go. So I think the conditions are slightly different. And there's one very good article that came out last year from the U.S. Interagency Council on Homelessness, and they lifted up Boston's approach in 2022 as being novel and the one that other cities can learn from. So I just want to maybe direct your attention to that article. Thank you.
And I
to
just
be
want to
clear,
add
it's
on-
about this policy.
On documentation, our current practice is, and we would assume that we're going to continue that, anytime that there's an encampment that we are engaging with, resolving, every documentation, every outreach effort, offer of medical assistance, offer of treatment and shelter space is documented, as well as any enforcement actions, which they, in my time here, have not happened really, because people do end up moving voluntarily or accepting the service. But we will continue documenting every single action.
And I think the question, just to that point before we go to a break, the question isn't so much about how the BPHC is monitoring that, but rather who you're asking to enforce this move along order to, or this tear down of a shelter to, is likely going to be the Boston Police Department. And if the Boston Police Department is getting their information once daily, that doesn't account for whether or not these spaces are already full by the time they are now making this move, or whether or not other officers in other parts of the city are actually also arresting or moving people, hopefully not arresting them, but moving them to these shelters, and if they're moving them to shelters that are actually at that moment already occupied because other officers in other parts of the city have already filled those beds. That real-time tracking system, that's not in here, and I don't know how you're going to provide evidence that you can do that or what the plan is to do that, but that is what I was speaking to more so there. With that, I know that we are now somewhere around an hour and a half. Sorry, 1:30. Look at that, time has turned into hours and halves for me. We have a second panel. Our first panel's been here for quite some time. I want to give you a chance to take a quick break, give my colleagues a chance to take a quick break. When we come back, in the interest of time, what I'm going to do is 3 minutes on a second round, and that will include their answers and your questions, so we will move that around faster. And so if you don't have questions for the second round, that's fine. If you do, it'll be 3 minutes in there, and then we'll get to our secondary panel, and then we will get to community comment. With that, I'm going to take a 5-minute recess. we can get back in session. Councilor Anderson. If we can get back in session. We have a second panel, and we still have people who want to give community comment. And so I want to make it clear that in this next panel, this next second round, not everybody has to use it. It is optional if you have second round questions. And then what we will do is 3 minutes that will include not just your speaking time, but also the administration speaking time to try and make this faster. At that point, I will give the administration a chance to give brief closing remarks if you want to make a closing argument or any closing remarks. Otherwise, we'll release you for the day. You're obviously welcome to stay to watch the community advocates or the community speak on this, but you're free to go about your day when we get to that part. I'm going to start order of arrival. As people show back up, I'll give them an opportunity based on order of arrival. If we skip them, I'll go to them. But I want to begin with Councilor Murphy, and I'm going to give her 1 extra minute from the last round because the rule sort of got shifted around before you spoke. So you have 4 minutes, and if you're ready, you can start.
Ready. Thank you. So I just want to go on record to say that this hearing, it feels more like an opportunity to sell the ordinance for the administration to get the votes to pass this, and not a hearing where we're able to actually ask these hard questions and really work through. And I was hoping, and maybe we need to do that in a different setting, but I just want to put that on the record. A few things, it was over 3 hours ago now, but I was typing when you all spoke, and there were a few things, 3 things that I heard earlier when the panel shared out. One was, we need to stop the criminal behavior, and that is why this ordinance needs to pass. And my statement is not really a question, but we have laws on the books already that we can stop the criminal behavior, and it's been said by many of my colleagues in their rounds of questioning and statements. Another one was, I hope you will support the street workers by passing this ordinance. And I just need to say, a vote in favor or not of this ordinance shouldn't determine whether or not a councilor is in support of the workers. If there are any illegal or unsafe behavior going on down in that area, we already have the power to stop that, and we should be doing everything in our power every day to make sure our workers are safe. And we know it's true that some of our nonprofits have pulled out because they weren't safe, and we weren't doing everything we can, even though we don't need this ordinance to make sure that people are not being raped, stabbed, mistreated. So I would hope that there isn't this feeling that if for different reasons a vote against an ordinance meant that we don't care about the safety or well-being of the workers down there. Is just not true. The third thing was, once this ordinance passes, then those unsheltered on Atkins Street will be offered a safe sleeping opportunity. So my statement really is, what does that actually mean? Because aren't you already offering safe sleeping opportunities every day? Isn't that what your team, Tanya, does on a daily basis already? And going through that encampment every day, or at least Monday through Friday, where that's the purpose of the outreach team, to offer housing, recovery services, and to help those who are living out there. So that's already being offered, and we're already spending millions of dollars, right, over these past 2 years when your cabinet came into effect. So I just want to be clear that a lot of the things I'm hearing are things I feel like we're already doing or we can do better. And also, when I asked the administration, I know many of us had conversations before this with the administration, and my question was why do we need this ordinance? And is a vote in favor of the ordinance tied to adding more low-threshold housing in the South End? I know others, but I can only speak for myself, was told more than once that it absolutely won't be tied, that a vote in favor of taking down the tents is not tied to more low-threshold housing in the South End. But that's not what we're talking about today. We are talking about more housing, which is a totally different conversation. I'm 100% in favor of the tents coming down. I have been since the tents went up. It's not a new feeling I have, because I do know the unsafe conditions, and I've said it before, that if you're down sleeping on Atkins Street, you're not in a good place to get anywhere in your life. Like, you need to be somewhere else. Also, the ordinance is titled, "An Ordinance Relating to Unlawful Camping on Public Property." But then when you get to the third whereas, it only states, "To allow access for individuals of all abilities and unobstructed path of travel as required by law." So it contradicts where the title says it's on camping on all public property, but the wording only states on public pathways so that ADA and other people can safely get past the sidewalk, cars can drive on the street. And I'm already hearing from the Parks Department and neighbors across the city that there's already more tents, because we do know that tents are already in many of our parks, but more tents are popping up in parks across the city. So there's a concern that the ordinance is going to tie our hands to say, okay, just on this one small spot on Atkins Street, there can't be tents, but then there'll be tents on other open spaces across the city. And one last thing is, you mentioned a few times, Tanya, that the roundhouse you're not counting as one of the low threshold housing. I thought it was did it close before? It wasn't. And how many were there, and where did we place those who were living there?
There were 60 people living at the Roundhouse. They've all been transferred to different low threshold sites.
Or permanently housed.
Or permanently housed.
And one more quick thing. I mean, I know on a very personal level that a person who has a family member who loves them, a home for them to stay, financial, emotional, and medical support for them, still are choosing to stay on the street. And that's why we see family members down there every day. And I know you've increased your opportunities there for families to find loved ones down there and hoping to bring them home. I also hear a lot about the majority of those living on Mass and Cass are from Boston, and cities and towns should do more. But is there going to be a process where the first people we call are their families, and that families have some responsibility here before we're just offering them housing? That we're making sure that families are called and reached out? And I know legally after 18, maybe they don't have to take them back, but I mean, they're your children. I mean, I'm saying this on a personal level, that at 34, at 44, you're still helping your children struggling. And I'm not saying everyone will have a family member who can, and I don't need to be told about the alienation and all the times they've let their family down and they don't have that number anymore to call. But is there going to be a responsibility on these family members first before we then use Boston resources to house them? And it's where we would ultimately want them, right? Back into a family structure, because we know isolation is the #1 thing that kills. So if you could touch on those.
I could just start by saying that both the street outreach employees and Elliot, who's doing a lot of very fine work down there, the first thing they do when they start, talking to an individual that is staying down there repeatedly is like, can we problem solve? Can we get you home? Is there a place you can go to? Is there a community that can provide you supports? Because that would, I agree with you, Counselor, that would be the preferred scenario, that individuals are going back to communities where they've got supports. Those conversations are hard given how, I've mentioned before, how chaotic Mass Cass has become. And those conversations are harder because of the tents too, because people are in the tents. There's a lot of unsafety in the tents. As you know, there are quite a few women down there being trafficked. So the idea is to always start with those conversations. Can we get you home? We have everyone has transportation money. Every nonprofit down there has transportation money, cell phones. We'd like to provide those supports. When those connections can't happen or don't happen, at least initially, then the idea is that they need to be sheltered.
And just to add that via the new Friends and Family reunification process, we are also receiving incoming requests from the family members and have been able to make some of those connections possible.
Thank you.
Thank you. Thank you, Councilor Murphy. Councilor Flynn.
Thank you, Mr. Chair. My question is to the Commissioner. Commissioner, as we debate this subject and the implementation of this, are we able to prioritize, and I know the Boston Police are doing the best they can, and I have the most respect for them, but are we able to prioritize human trafficking down there, even as we debate this, to make sure that if there are women that are trafficked down in this area, that we are addressing it immediately? We're not waiting. And I know you're not waiting, but I just want to stress how urgent it is down there to deal with that critical issue.
And we are not waiting. I just want to make that clear. We're doing cases down there as we speak, but the reality is it's much more difficult with tents up, and so that's why the ordinance is so important. Human trafficking, certainly some of the gun violations. We're prioritizing all the violent crime that's occurring right there. But the fact is, if we can't see it, we can't observe it, it's hard for us to charge people. And that's part of the issue, is being able to do that. I hear that, you say that we can't, we can enforce right now. The reality is that the Constitution prevents us from, doing a lot of things, and rightly so, in the sense that we're not in the days where we stop and frisk. We're not in the days where we just go in and just searching people's belongings and things of that nature around the tents, around some of that stuff. So having an ordinance that we can enforce the law around it and making them take it down, it becomes a lot easier for us to pursue those charges against people, to observe the behavior, the criminal behavior involved.
Commissioner, during this period, if it's implemented, you and your team, probably a superintendent or a captain, are you going to provide police officers with the training in how to take down a tent, what the process is, what they physically need to do, what they need to do if they are harassed by someone? Again, just want to make sure that everyone is protected down there, including the Boston police officers that do provide this critical work. Are we going to provide them with the training, but also to include their union as well?
Every police officer it belongs to a union, so when we provide training, it's for our entire department in general, particularly around this ordinance, if it's passed, making sure they understand that. We always care about officers being injured and things of that sort, so we'll do all we can to make sure that workplace injuries don't happen. As far as resistance in dealing with people that don't necessarily like the police or want to resist, that is something that we have to deal with on this job on many different levels. And so we're going to do all we can before they actually do any work to make sure that they understand both the law and how to go about doing it and their role as far as the ordinance is concerned.
Thank you, Commissioner. In my final question, I want to address it to Sheila. I think I highlighted highlighted this issue, but I am still troubled, though, about what BHA, Boston Housing Authority, will do or will not do in terms of prioritizing people coming in from Mass and Cass based on their disability, having them have preference into an apartment as other seniors and persons with disabilities wait, knowing that the people coming from Mass and Cass have not been in a detox program, are not engaged in mental health counseling, are not engaged in drug treatment programs. I am concerned about that. That is one of the issues that would be holding me up to vote in favor of this. I need a commitment that that is not going to be the case.
If I could, Counselor, the idea or the fact that individuals living in Mass Cass, it does not give them prioritization or priority for a public housing unit. Staff are looking at because they're watching this, and very few actually individuals from Mass Cass have gone into BHA housing. Now, as I mentioned before, the BHA does have priority points for disability, and they do have priority points for length of homelessness and homelessness, but there's no prioritization for those in Mass Cass going into public housing. the vast majority of resources we have used have come from the federal government for folks that are unsheltered. So I will give you numbers later today or tomorrow to really back up some of these statements. But there's not a direct link from MassCast to our public housing units. Also, too, in all of our developments, including public housing, proper screening is done for folks to make sure that they are going to be safe and that residents and living in public housing are going to be safe. So there's a lot of work that goes into making sure that people have the right housing resource. But I'll get you the exact numbers. Thank you.
Yeah, thank you. And I just want to end by saying I also represent with Councilor Baker, Councilor Fernandez-Anderson, but the impacted community, South Bay Mall, it sits right in my neighborhood. Andrew Square, it's in my neighborhood. I live down the road from Andrew Square. Represent a good portion of the South End. It's these quality of life issues, these neighborhood services, public safety issues. Those are the issues that we also have to factor in and make sure that people living in and around there are also treated with respect, because they've had a difficult time during this period of time, and they deserve a level of respect. They need to have their voices heard during this discussion. Thank you, Mr. Chair, for giving me an extra few seconds.
Thank you, Councilor Flynn. Councilor Anderson?
Thank you, Chairman Arroyo. This may sound a bit repetitive, but walk me through this. So first, we're going to start with a 2-week notice, and by the deadline, is it October 1st? Is that when we're going to start intensive outreach?
We would start the next day after the ordinance passed.
The next day after the ordinance passed, then we'll go into intensive outreach. I want to know I want to understand exactly what happened. So 2 weeks notice, and is that flyering and notifying people? And if you have contacts, you're sending text messages, you're sending emails, how are we putting it online? How are we doing that?
Yes, so the next day after the ordinance is passed, there are two ways that we're gonna notify people. First, Recovery Services outreach and our own team coordinated response will be out there providing flyers. The Inspectional Services Department will also come down and post all tents with what's called a notice of removal in English and Spanish, and they'll also provide copies of the city storage program policy. They're going to be providing the posting in like weather-resistant materials.
Sorry.
After that, I could just go through kind of the plan hour by hour.
No, it's okay.
Yeah, that's
because I'm going to get it better with clarifying questions. And then intensive outreach, once you give the 2-week notice, and it's just in 2 languages, I know for a fact that there are Somali and Cape Verdeans and other populations there.
Yes, actually, let me clarify that because I'm not sure. I have it in my current plans, English and Spanish, but I do know that we've asked LCA to just kind of do them all. So I don't have the answer to you. I'll get that to you as soon as I check.
Thank you. And then with intensive outreach, what does that look like exactly? Yeah, I know that you have the stationary and mobile units, and I can imagine that for the purposes, all intents and purposes, if stationary, obviously, if you want to reach it at any time, at any point, but then also mobile because it offers more resources or services on the van. But then what else does it entail? Will the stationary then do some sort of intake to be able to say, these are the options and you're going this way, you're going that way? How does that work?
Yes. So we have a group of outreach workers, existing group of outreach workers from BPHC ourselves that we are hoping to supplement with kind of volunteers from other agencies that have been letting us know they're able to provide support for this 2-week kind of notice period. They'll be trained and will be assigned a client, or so assigned a number of, depending on how many outreach workers we end up having, they'll be assigned between 3 to 5 people that they're responsible to work with and have the conversation around what it is that they're planning to do once the encampment closes. So once we know each person's triage destination, we'll kind of be working with those outreach workers that own the case to make sure that happens. Does that make sense? And it'll take a couple of weeks for us to kind of triage everybody out that needs to be triaged out.
Yes, thank you. Chair, I'm trying to wrap up a point here so I can understand the full plan. Thank you for indulging me, and thank you to my colleagues for being patient. And so then I understand that there's some sleep spaces, shelters, or low threshold housing, or actual permanent housing, and those would happen in different phases depending on readiness. And people are going either into one of those spaces or they're going directly to wherever they are on their level of treatment.
Correct.
And so when it comes to public safety, then the removals specifically, will those take place with case managers on site?
Yes, I can kind of walk through what that day would be. So after 2 weeks, after we've done all the triage the day before, there is the plan of BPD kind of enforcing the closure. We would go through and let people know, today's your last day to be placed, tomorrow there will be a closure of the encampment. So they'll know when the day is happening. And then that day, when the enforcement piece does happen, there will be the same outreach workers, all of us on street, along with BPD, letting people know, hey, it's time. And they'll either, if they're still remaining and chose not to, chose not to avail themselves of any service, then the goal is that they would pack up their belongings and just kind of go wherever they want to go. Our hope is that they'll take us up on the service, but I don't expect that 100% of the people will. So the hope then is that they'll pack up their belongings and relocate on their own. If they refuse, that's the last resort where enforcement would happen on the tent itself.
And so you're looking at 152 people that need to be housed, but then you only have about between 80 and 110 between beds and housing, right?
Yes, I would not say 150 need to be housed. I would say the number's closer to 70 or 80.
Okay, so, but there are different levels, shelters or beds or treatment, and so
Right.
it depends. And so can I get a number of the people that are going back into District 7 in terms of like where you have the beds? I know that you've listed different locations, but I need to understand exactly where they're gonna go, because the concern in South End is obviously the people on the sidewalks and people creeping into the backyards and stuff like that. And so once that takes place, though, to Dr. Jakutu's point in terms of the enforcement plan not being complete yet, and you're still workshopping that, understanding then the long-term between the 30-day or the long-term treatment. And I understand that that's still challenging and should be multifaceted with the whole treatment and services and wraparound or whatever. But it is harm reducing. That's what we're talking about here, right? So can we go into a work, through the chair, if we go into a working session and we plan out with time, could we talk further into the enforcement plan?
Absolutely.
Thank you. I'll wrap up now. I feel that, sorry, it's not easy to ask all these questions and actually get an answer and then remember everything and then actually listen and not be repetitive, right? And I'm trying to make sure that my constituents, that everybody watching really sees the full plan so that it's, it's digestible. So I'm interested in looking at this visually, and I think it's helpful for some people. Not everyone can just hear it auditorially and just, pick it up. And then so I can communicate it to my constituents so that people feel comfortable. So hopefully a working session prior to a vote can help us do that. Thank you. Thank you, Mr. Chair.
Thank you. Now it's, let me just go through the list. Councilor Durkin.
Hi, thank you so much, Chair. So we know, at least I share with the administration, that housing and the public health approach is the right approach in this scenario. And I know you've mentioned that hundreds are coming to the area to prey on this very vulnerable population. And you also mentioned that, of sort of the success stories is that 169 people have found housing and 139 remain, and 85 are going to access some, or in the process to access housing services. So I just wanted to repeat those back because that's all very helpful information. Do we know how long the average person has been at the encampment, or just any sort of information sort of about like what kind of trends we're seeing there, because I think one thing that I've heard, countless times about Mass and Cass is that a lot of these folks are new. So Tanya, do you have some information or some thoughts to that?
I'm looking for it. I think we actually do have numbers on that from the last survey that BPHC conducted. I have to look for it. I don't have it top of my head.
That was a while ago.
Let me look for it.
And then I'll just, I obviously find the fact that people would see Boston as a place where they could come in and pray is something that's very concerning. So when the police commissioner says this is something that's needed to protect the public safety and to give our officers the ability to go into the area, that's something I take very seriously, because as someone who has seen substance abuse and a lot of these things up close, I know that it's not just substance abuse, it's not just mental health, there's a criminal element to this, so I really appreciate that, Commissioner Cox, and thanks for your comments there. Should I ask another question while you're looking for that, Tanya?
Please.
Oh, okay. So I know we talked a little bit about the storage policy program. Is that something that we'd be able to see? Or is that something that already exists that we have access to?
It's in draft format. I'm pretty sure it's finished, so I just have to get the final version, and I'm sure we could make that available.
Awesome.
via
Thank you.
IGR.
Yeah, I think that would be something that would be helpful for our working session, just so we sort of, because it's mentioned in the ordinance. And then I'll just add, sorry, one more question. So I know it's mentioned a couple times in the ordinance, equitable shelter for people with disabilities in keeping with the Americans with Disabilities Act. Wanted to sort of highlight, obviously we talked a little bit about mental health. That is, can be considered a disability. So obviously I feel like Dr. Ojikutu is probably the right person to respond to this question, but does the Public Health Commission see mental health care as like a disability, and how does that interact with, because I know there's a lot of mentions of complying with the Americans with Disabilities Act in the ordinance.
Mm-hmm. And the question is
equitable housing for those with disabilities. I know that's mentioned in the ordinance, so just wanted to ask sort of the question of.
So if you're referring to whether or not individuals with mental health will have equitable access to housing, absolutely. I think that that's certainly part of our goal. At the Boston Public Health Commission, we certainly see mental health as a public health and a healthcare crisis, and we have like a Center for Behavioral Health and Wellness that's focused in on these issues, so it's certainly a priority. But we're looking at equity just across all of these areas, so across demographic groups, across needs. And Sheila, I don't know if you wanted to speak a little bit more to disabilities, or just probably.
I mean, just the vast majority of shelters that we're working with are certainly they're ADA compliant, and we are putting we're putting beds in a variety of shelter types, hopefully to address people that would have a difficult time in a crowded condition or couldn't access a top bunk, would need a lower bunk, those type of. So we do need a variety of shelter beds available and spaces available to meet the need. So yes, it's at the top of, it's.
Thank you. And I know the city has a very thoughtful approach to this. I just wanted to.
We're at time.
Oh, sorry. Go ahead. But would Tanya be able to provide, or did you find that, or maybe through the chair I can get that information later?
Yes. We are keeping track of all
Okay.
requests for info.
Oh, thank you.
Do you have it like immediately available? Otherwise, that's fine. Just send it over after and we'll be fine.
Thank you.
Thank you, Councilor Durkin. Councilor Louis Jen.
Thank you, Chair. Thank you, Chair. And just to clarify, I think what Dr. Ojikotu and Chief Dillon, like people with mental health disabilities, if it qualifies as a disability under the ADA, they have to comply with that, whether it's a physical or a mental disability. But I just wanted to have three comments, one of which is teased out from some of the colleague statements that hopefully we'll be able to talk at greater length at another time, but it's really important when we're alerting folks about the ordinance, that there's also like plain language being used in giving folks information, because anytime there's something that sections and looks like it's legalese, like people won't understand what the plain language of that is and what their rights are. So that needs to be clear. So there should be like a TLDR version or like human speak version so that folks actually understand what it says. And then I just wanted to tease out something that we had discussed previously, and I want to, show a lot of respect to the residents who live there. Yesterday we were having this sort of binary conversation about treatment versus housing, and how it's really not binary in that sense, and they really do have to go hand in hand. And the reason why housing is such an important part of this solution, not for everyone, but for those who are unhoused, is because it increases the likelihood that they will actually use these services, that they'll actually take on appointments, that they can actually see a path forward with treatment. So I just wanted to put that out. Even if housing isn't the ultimate cure, it is part of the process towards treatment. It's not a straight path. It's not an uncomplicated one, but it is a necessary component of getting towards treatment and really being able to access it. And then lastly, I just wanted to acknowledge and started by acknowledging the trauma of those who are living in the area and their family, children, parents, who see their family members down there and how difficult it is. But I also just wanted to, for a moment, and we see this in all spaces with service providers right now, just an incredible level of burnout. So just wanted to say again, thank you to the folks at BPHC and all of our different agencies really working down there, because Director Del Rio, when you talk about what you do every day and where you go every day and engaging with folks every day, it is also taking on that trauma as well. And so just wanted to create space to say thank you and acknowledge the difficulty in that. Thank you.
Thank you, Councilor Louis-Jen. Let me just see who is still here. Councilor Mejia.
Thank you. 3 minutes, right?
Yep.
Okay. You guys been here all day, so I'm not gonna hold you hostage any longer. Other than I want to just uplift how difficult it is to have this conversation in this moment in time, because everyone who's paying attention, everyone is thinking this is just like a political theater show right now, and everybody's grabbing their popcorn and seeing who's going to be saying what, right? And it's unfortunate because we have people's lives that are at risk, and I think oftentimes when we get into these spaces and places, we don't know how to act and don't know how to treat each other and don't know how to show up for one another. And I think since I walked into this chamber in regards to Mass and Cass, it has always been a people first approach for me, right? And all people, right? The people who are living the realities, the people who work in the area, the people who live in the area, like everyone here is a stakeholder. But what I have not seen is that level of working together across all of those different key groups to get to a solution. I mean, there's been bits and pieces here and there, but here we are asking for an approach, but it still feels like one or the other. It's either public safety or public health. To me, even being here for an hour or 3 hours, I just don't still feel like we've gotten to the place where we are seeing and affirming all stakeholders. So do you all agree with me on that one?
I think that what I agree with in terms of what you're saying is that we need to be working together, and these approaches need to be integrated. It's not one before the other. It's not, one instead of the other. It's certainly, this is multifaceted, and I think we all need to just acknowledge there isn't one answer, and there probably isn't an answer, So I agree with that component of your comment.
I mean, because I'm assuming we're pivoting for a reason, right? Mayor Wu was really adamant around housing first and being more compassionate. And based on your opening remarks, because of the safety issues and the uptick, you guys are pivoting, right? So for people who are paying attention so that they understand, right? It's not just that you doing the bait and switch and like, oh, we care about people, and oh, no, we don't, not anymore. We were just joking, right? That's not what's happening here, right?
Absolutely.
Because you have to understand, people don't trust government. They don't trust us, and with good reason. I wouldn't trust us either, right? So I think that there is something to be said about this particular moment, and when the ordinance has been introduced, and that's why people who are paying attention are questioning kind of the pivot, because you did not lead with that when you walked into this chamber a year and a half ago. So can you just talk to me about your thought process and how this journey getting to this place, what has that been like for you?
I mean, I can start, but certainly we've all been in this work for a while now. I think it's important to clarify what we said in our opening statements, that Boston is a leader in caring about people living with substance use disorder and who are unsheltered. Mayor Wu's administration has emphasized this people-first, public health-led, housing-first approach to how we address this issue. We've done some great things that have been noticed throughout the country. You know, when I go to meetings, they're saying Boston is leading. Boston's doing this great work. But now we're at a juncture where we cannot do that work anymore. It's gotten to that place. It's a dire situation where there's an open-air drug market, there's violence, there's crime, there's human trafficking. You've heard it from everybody. Something's got to give at this point. And so we are proposing this ordinance as a strategy that we think may work to address.
I know, but what I'm struggling with, and I know it went, okay, this is the last thing that I'll say, is what I'm struggling with is that, you know, we have had conversations around alternative to 911s. Like, there are other models that don't feel like such a, you know, law enforcement heavy, but there's like a hybrid. And that's kind of really what I'm trying to find, is some sort of solution where people don't feel criminalized, even though it's criminal activity, and I understand that and I appreciate that, but there has to be some level of kind of way to figure out how we can get to maybe an alternative to 911, and maybe if there's a way for us to look at what that looks like.
These things are also happening, though. A lot of things are happening in terms of how we're approaching, you know, mental health disorder and calls to EMS, in terms of alternative responses, in terms of the community-led design group that I know you've heard about and are very interested in learning more about. We are moving many pieces forward. We're listening, you know, we're not just saying we're going to criminalize anyone. Instead, we're saying that we're going to put all of the public health tools on the table, but we also need enhanced public safety tools, and that's why we're here.
Went off. Thank you.
Thank you, Chair. I feel like all of my questions have been asked by some of my other colleagues, and so I'm going to use my 3 minutes to make more of a closing statement, as I have to excuse myself. There are a couple of things that we're trying to do here. We're trying to respond to the opioid epidemic. We're trying to use a public health lens. We're doing a housing first model. In that aspect, everything that I have seen the Boston Public Health Commission, Mayor's Office of Housing implement, at least from what we're seeing in the data that we have, has moved the needle. You are doing an incredible amount of work. Like you said, Boston is being looked at as a leader. My invitation to you is to stay the course. This is not an issue that's going to be solved overnight, and we know that. And given how successful you're being on the public health end, and the lack of evidence and the information that's been given to me today shows me absolutely no barriers to implementing and enforcing the laws of the city in order to enhance public safety in that area. I haven't seen anything that shows me that you need this at all. There's crime happening, then we have a police department, and the police department should take it. I have nothing that you have said today has shown me that you, in order to increase public safety, you need this ordinance. What I have seen is that there's something that needs to shift to the Boston Police Department in order to begin responding to these in a way that people feel is going to be effective. I don't know what the problem is. And I have to be honest, police community relations and people not feeling like this is our job, it misses the mark for me. These are sworn, trained, armed officers. It is their job. And to hear that there is sex trafficking happening, but oh my God, the Boston Police Department has their hands tied behind their back to do anything about sex trafficking because there's a tent, it's unconscionable. Especially not with the amount of money that we're spending on policing in the city. It's just not. And I don't think anybody in this chamber would disagree that if you wanted to send us a very large overtime bill for ensuring that the people who are providing services at Mass and Cass were doing so safely and that crime was being taken care of at Mass and Cass, instead of sending us a really massive overtime bill for police officers standing over manholes while people are doing construction details, that anybody here would say no to that. So I understand the story of the understaffing, of the not having the capacity, fine. But nothing that is here is showing any inability is showing that the Boston Police Department cannot do their job when it comes to crime and public safety down at Mass and Cass. There are two things that I'm seeing are not happening here. The public health approach, we're doubling down on it. Every single thing that you said you're doing today, I'm proud of the work that you're doing even. I keep going. There is an issue that we're not listening to community. The people, small businesses, people who live there, children who go to school in that area are feeling unheard. They're feeling like resources are not being put towards ensuring that while we are solving this issue that is going to be a long-term issue, they also feel safe and cared for in their community. There's a lot of work to do there. Whether it be more cleanups, investing in, whatever that looks like, there's a lot more work to make sure that the people in the community and the residents feel safe. If somebody is experiencing sexual assault, if somebody is selling drugs, the Boston Police Department is arresting them. If somebody's reporting it, it is happening. It doesn't matter if it's happening inside of a tent. If somebody's being raped in a home and they're screaming help out of a window, and a Boston Police Department officer is walking by, they are not going to court to go to a warrant to stop what is happening in that house. It's an assertion that I don't think anybody can believe that those things are happening. And so yes, please do so while protecting people's civil liberties. But there is a job to do. You have the ability to do that job. And if there are resources that are necessary to do that job, yes, this ordinance is not that resource. I have nothing here, no information given to me has shown that this is necessary at all. I know that my time is up.
Thank you, Councilor
Thank
Lara.
you, Councilor.
I'll just say, because it's now my turn, there is no more vulnerable population. I've represented folks as a public defender in court. There is no more vulnerable population than someone who is struggling to deal with mental health illness and is both dealing with disease or addiction, because there's a struggle between how you stabilize that individual, and everything I've ever seen work requires the stabilization of that person. That's why I'm such a committed advocate of housing first. That's why I've been a voice against this in the past. This isn't the first time that I've spoken out about these kinds of processes. I think the concern that I have is that all of the evidence that I have of similar policies throughout the country, whether we call them a sweep or not, is that this just furthers destabilization of those individuals. It puts them out of communication. I believe you, Doctor, basically specifically stated that one of the concerns is folks having overdoses outside of your ability to be aware of it. That's something that the data and the studies say is going to happen. And so when we talk about this policy, I understand and I hear from community members who don't want to live near this, who have issues with this, and I fully understand that. I understand that. I also have to understand and deal with the reality that the individuals who live on that street are also under the care and custody of us, and they're not just vulnerable to the people who prey on them. They're vulnerable to bad policy. They're vulnerable to reactionary policy. They're vulnerable to it because they're not in these spaces. They don't have the advocacy level. They don't have the ability to put the kind of political pressure on there for their own protections, and so it falls upon us to do that. What I would say on this is, and I just want to kind of direct this to the commissioner, the ordinance before us doesn't actually deal with housing. It really doesn't. It says there's an offer for shelter, and then it says removal. Once the city has engaged an individual as described in section 1665.5, offer of shelter in section 1665.6, storage of property, the individual has either accepted or declined the offers, the city shall remove any campsite and/or camp materials not removed by the individual. Done. There's no, this isn't, whatever y'all are talking about, what we're voting on is just giving the legal ability for someone to be arrested or fined for their tents, to have their properties put into storage, and to be told, hey, there's a shelter you can go to today, or not, whatever. And that's essentially what this program, as it's written down on this paperwork, does. It doesn't talk about advancing any of the other things that you're trying to do in unison with that, or where the funding or how that gets funded. We've spent millions on overtime costs for Mass and Cass with the Boston Police Department. I'm hearing about hundreds of folks showing up to prey on folks. What do our daily arrests look like at Mass and Cass? How many arrests are we doing at Mass and Cass?
I can get it to you. I don't have that right now, but
Is it hundreds?
Hundreds daily? No.
Is it hundreds weekly?
I can't. If I said I can't get it to you, I can't get it to you.
All right, great. I will get that number. Here's the reason why I say that. There's drug dealing in BHA housing. There's drug dealing in private residence. There's drug dealings out of vehicles. There's sex trafficking out of vehicles. There's sex trafficking out of houses. The idea that the end all be all of resolving this issue is simply the elimination of a tent doesn't make sense. It doesn't actually jive with anything we've heard. I heard earlier, Commissioner Cox, and you can actually answer it right now. I'll give you the opportunity. What does this give you, this ordinance, that you don't already have, that leads you to believe that this would be effective in addressing the issue of encampments?
It's actually a law to enforce right then and there, right? The tent and the hidden behavior that goes on behind those. For people who have intent to sell drugs or down there human trafficking people and stuff, they love this environment that exists right now because, they know that they can't hide behind those tents. The intent of this is to separate those people from the people who need service. The intent of this is to actually get the ones that are there to pillage the vulnerable away from them, right? And then give the people who are down there and need services the opportunity to get the services they need in an environment which is conducive for them to do that. It doesn't exist right now. I mean, I hear a whole bunch of things. So the police are blamed for when we over-enforce, when we go in on our own. We're blamed for when we actually absolutely make sure that there's a law to enforce, because that's what we're asking for, a law to enforce around this. But yet now it seems as though that we are the blame for the opioid.
I don't think, no, and I want to be clear. I don't think we can arrest our way out of this. I think you've said that as well. And I agree with and I commend your stance that it needs to be a public health-led approach. I think the issue I have is, for instance, when we're talking about sex trafficking or the selling of drugs, this idea that these tents are in vulnerable places and fortresses that we can't get into, when I'm watching, because of reasons, the Boston Herald sharing a body camera of an individual whose phone was stolen. And at the 4-minute and 26 mark, there's all these threats about, we'll go through every single tent, we'll tear down every single tent to find this iPhone. And you're telling me that they can make those kinds of, but they didn't have to because the iPhone was returned.
But they did not do that. Right?
No, but they had the power to do it, is my point. And so if you are trying to tell me that without the ability to criminalize this tent, you can't go into a tent to solve drug dealing or to solve sex trafficking, that doesn't hold. You could do it for an iPhone, but you can't do it for these things. Doesn't actually make sense. And I would just say, if the concern is that this area is so lawless that it requires stepped up police presence, why are we not having police officers patrolling within that area? In that video, the only police officer on scene is in a cruiser outside of that area. And so I hear all these concerns about the sex trafficking and the drugs and the drug dealing, but I don't see like any considerable effort towards arresting or towards making these kinds of cases. And I hear what you're saying, which is basically, does that fall on us? It doesn't. But if you're going to come to me and say the only thing stopping us from doing that is that you haven't passed this ordinance on making it so that there's another law to enforce, I don't see how they're connected.
Council, we arrest people. We arrest people down there all the time.
Are you arresting hundreds of people? Because that's what we're being told. There's hundreds of predators there. That's what I've heard.
As it was mentioned earlier, this is a tool that will absolutely help us separate those people who are down there preying on the vulnerable from the other ones that might need services.
Is it your stance?
That's what the intent
So I guess my question is it the stance that the tents total, all of these tents, are solely or mostly being used for criminal activity and not for shelter? Is that essentially the stance of this board or this panel? Is it that most of these
The public
tents?
safety issue has to do with the
I'm
crimes
just
that are being
asking,
committed.
because what I'm being told is the reason we need this is so that we could stop all these other things. This doesn't make sex trafficking illegal, it's already illegal. It doesn't make drug dealing illegal, it's already illegal. It doesn't make drug use illegal, it's already illegal. All of those things continue to happen. And so why this ordinance, which is what we're being asked to vote on, that would outlaw tents, would somehow make it so that the tents stop showing up, which I think is a fallacy, or would somehow make it so that that crime no longer exists, or that we can now enforce on that crime, I think is also a fallacy. And I haven't seen any evidence, like you guys haven't presented any evidence that the majority of the crime that you are speaking to is actually happening within these tented areas, and maybe there's data that you have that you can provide.
I would say the
that would be
evidence,
helpful.
you speak to the victims of the crimes. You speak to the people who are down there and ask them, you know, this is not a police issue where we're just making this up.
I don't think you are.
We're getting
What I'm saying is we haven't
information
presented
from
any of that
people who
evidence.
both live there, in and around there, right? Who are being victimized in those tents, being victimized in and around those areas, right? That is where we're getting the information from. And so the fact is, if you want the data, pass the ordinance and then actually let us see the impact that we have around this, as opposed to saying it's not going to work.
The issue is once you put a law on the books, they almost never get removed. And so if the impact is actually negative, that doesn't remove your ability to continue to enforce a negative law. And so the issue really is, if you're going to create a new law that has criminal penalties, there should be a good case made for why it's necessary and why without this law or with this law we have increases in public safety. And what I have issues with is that we're seeing, just from the studies and the data that are available to us, real risks of public health concerns. Nobody's trying to hide from those risks. The law itself puts police in direct involvement, whether you like it or not, puts police in direct involvement with some of our most vulnerable populations on a regular basis, and is actually asking of them to do a number of things that aren't even outlined in this ordinance. It says they have to be provided a ride. By who? The police officer? The police officer has to put them in the car and drive them there? Who's doing that? Somebody's going to come pick them up? Who's doing that? When we talk about the cost involved in this, and this is my final question because we went well over 3 minutes, do we have an estimate on how much this costs? Just the transferring, the creating shelters, the storage, the enforcement of this law on a daily basis. I've seen on that Bloomberg article numbers as high as about 3.6, 3.8 million for Chicago, about 8 point something for San Jose. Do we have any idea how many millions of dollars are going to go into the enforcement of this?
No, but we've transported people for years. This is not anything new. I mean, we work with people all the time around this. The transporting is not a new thing. The point of the matter is as far as public safety is concerned, the data is showing that it is certainly an issue. The people who work down there have asked for it because they're impacted and don't even want to work down there. The people who live down there don't even want to be there anymore because of their concerns, and this is in response to that, and only that.
And so it's your belief that this law would help with dispersal of Atkinson Street? Is that
It will help with the dispersal of the people who are impacting the vulnerable people there.
And
that's what the purpose of it is.
And a dispersal is different than a sweep?
It is not. So you go back to, you talk about sweeps, but yet
because that's what this is.
You advocate a sweep, saying, "Why don't we go in?"
I'm not advocating for a
10
sweep.
to 10.
I'm not advocating for a sweep, but I am advocating that if somebody is preying on individuals who are vulnerable, as we are being told they are, that they should be arrested. I don't disagree with that. But I'm hearing that this tent situation is what's keeping you from doing that, and that's where my problems are. And so I'm going to end it there because I haven't heard a price tag associated to this. I haven't heard any of this data. Maybe you guys can send it to me. Is there like some estimate that do you think you could put that together? Is that something reasonable?
I think we can put that together. We have the cost for like the space, and we can just put it all together for you.
And try to, and I'm not asking for like in perpetuity. I'm asking for
No.
what a 1 year
Exactly, our
what a 1 year
startup
number would look
costs
like.
and then annual costs.
Yes, that's the best way to break it up. What the initial, whatever the initial price tag is, but also what that revolving annual price, as you can estimate it, is. With that, I do want to say this. I've been told that my tone sometimes comes off wrong. I want to be clear on this. I think you all are doing work, and you're trying really hard to solve an issue. I think Councilor Louis Jen spoke to secondary trauma. As a public defender, I know what secondary trauma looks like. It is incredibly difficult. You have probably had a number of people who are close to you on these programs who have passed away. I understand that what y'all are trying to do is help folks. My critique here is that I don't feel like there's any evidence that this is actually helping in the same way in which I believe other programs and other efforts that you have made have led in a very specific kind of way. And my concern is, unlike other things that we can afford to get wrong, if you get this wrong, more people die, more people are harmed. That's a very different consequence. You don't get to unroll that. And so that is my concern as I speak to you today. I'm going to give you all, I know you've been here a long time. If you want a closing statement, I want to give you the ability to make a closing statement before you go.
I will certainly just start off by saying, even if we were to arrest people who don't voluntarily comply and don't meet any of the conditions of the ordinance, we have a DA who's already said that he's going to emphasize services over sentences. So it's already a thoughtful system that didn't exist before to cover some of this. So there is a safety net out there, where services over sentences, where they're going to give people the services they need, because if they're not voluntarily complying when we ask them, clearly there must be something else going on, right? That's number one. And then two, you described the area like we can't do it. We're down there doing a lot. We're arresting a lot of people. We're doing all kind of drug investigation. But the fact is, we have to do it in a constitutional way, right? We're not going to over-police down there where we're just going door to door, doing almost the equivalent of the sweeps that you just asked me about. Why don't we do? We have to do it appropriately, right? Because we're always going to be questioned, our police department, on how we do something. And so we are going to do it appropriately. This law gives us the ability to do that, right? We're not trying to criminalize homelessness or substance abuse disorders or mental illness. We are trying to criminalize the people who are down there to be vulnerable, taking advantage of the vulnerable folks there. And this tool helps us do that, along with the other tools that we have. It gives them the inability to not hide in the tents and do things. Someone runs into a tent with a gun, and there's 5 people in there, or what have you. Are all of them guilty of carrying that gun? Whose tent is it? There's so many things that we have to prove in addition that don't exist, because whose home is it? Remember, that's their home now, right? In some way, shape, or form. Does that bring any, you're an attorney, does that bring any constitutional issues?
I can answer this question. You guys give gun charges to every individual in a vehicle that has a gun in it. So it doesn't matter if they're on the passenger side, the rear side, they all get gun case charges. So when you say that, it's like, I guess you think that I think that they're just going to say, okay, well, everybody's in here with a gun, so no, we can't figure out who to charge. But what happens in those instances is that they charge everybody. So I've seen that. That's how that works. So
I'm talking about mass and cast, and I'm talking about what we're trying to do to assist certainly all the other city services, both help the people who live down there, and also enforce laws appropriately on the people who show that they don't want the services and actually want to engage in criminal behavior. That's what this law does. So thank you for giving me an opportunity.
Thank you for your time. I know that this was a big dedication to your time. I just want to give them the chance to close, because we do have a second panel that's been waiting incredibly patiently. They thought they were going to come up like an hour ago.
Sorry, can we just have a 1 minute, Mr. Chair, I'm sorry. Can we have just 1 minute before they go? 1 minute to close with them?
I actually
clarifying questions.
Yeah, so you guys saying that you're all set? All right, so you have 1 minute of a question that you want to ask here?
Yes.
I'll let you ask it, but then this is it, because I want to make sure the second panel can come up.
Yes, thank you. Thank you. Just two points that I wanted to make in terms of operation or plan for operation. Can we get the plan in writing in preparation to the working session? And also, in your strategic outlook, you mentioned that you will go eventually to, I think it's phase 2 or 3, where you'll start destigmatizing addiction and mental health. Are you looking into digital access, like videos, or say drug addiction, mental health, chronic homelessness for dummies video type, so that you can educate the public on?
So as part of our work within, as we've discussed probably before, the Center for Behavioral Health and Wellness, we're looking at doing an entire anti-stigma campaign that will reach out and be appropriately designed to meet the health literacy needs of the population. So that's work that's ongoing.
Thank you. And then, finally, then, in terms of service over sentencing, does that incorporate some sort of panel for intervention, or who does it?
It's through the district attorney's office, and I believe he just received a grant of over $1 million just to make sure that occurs.
Okay, thank you. And I guess, could you bring, through the chair, could you provide the numbers along with the budget? So we're going to get the budget, we're going to get the operation plan in writing, we're going to get the numbers of arrests on in and around Mass and Cass or drug-related.
We publish those right now, right? I think.
Sorry, I don't know where
Okay,
I
I'll
can
get it
research.
to you.
We
Yep,
can
yep,
research,
yep.
but can you please provide that through the chair so that we can have it? And then I think Chief Dillon, you owe me some information on housing in D7 as well, just so we can prepare and actually be more concrete about making this measurable and tangible. Like I can't see it right now. It's just what we're saying. So if we can document the plan and then come back to it. Thank you so much. Thank you, Mr. Chair.
It's just, there was an exchange that happened here that just gave me an aha moment, and because it's just for clarifying purposes.
All right.
Thank you. And I do this because there are a lot of people who aren't political that follow me, and it's important for us to help them understand the things that are at play. A lot of people take it for granted, their privilege of understanding how politics works, and I'm not one of those because I'm still figuring it out myself. But you said something, Commissioner, in your exchange with Councilor Arroyo, and I just want to understand this a little bit more. And it was really about the fact that the tent becomes like their home, right? So do you need like a search warrant to be able to go into somebody's home when they're doing something, right? So is that at play here in terms of the reasons why you're unable to handle the illegal activity that's happening?
Currently, as the law stands, if we ask people to take down their tents, they have to take 48 hours to do it, and so it becomes a game of whack-a-mole where they could just move every couple of days, what have you. So you really can't have an impact.
But do you need a warrant?
But the point is that there are people who are coming down there that that don't even live down there, but to spend a great amount of time putting pressure on the people that are there, having them do god-awful things in general, and behind those tents, and actually creating an environment where people don't even want to call the police, right? They're unreporting some of the crimes and things that occur there.
But do you need a warrant to enter the tents? That's what I guess is what, for those folks who don't know, it would just be important to know whether or not you need a warrant.
I would imagine, whatever the circumstance of it, that will dictate if that's the case. If it's a warrant on someone's property in the house, I would probably say yes. So I can't get into, whether or not you need it or not, because the circumstances are going to determine that. But the reality is that the people down there are, certainly impacted. They're saying that they need more. The people who work there certainly need more. We know the impediments for us to actually arrest and do more, what the impediments are, and certainly those are the tents around some of that stuff. So, to make the environment certainly not conducive for these outside folks to come in and actually not criminalize, but certainly victimize the people that are there. This ordinance will go a tremendous long way for us to be able to do our job around
No,
it.
I appreciate that. I guess
I just want to.
Yeah, I'm just saying, because, we have the ability to do the work, and I just want to make sure that you have the ability to do the work. And so that doesn't seem like the tent is the problem. It really is. There's something more than just the tent, right? That's.
Yeah, and I think
it
sounds to me like we are probably headed towards a working session, and we will discuss all of these kinds of issues with the lawyers. I don't know how many lawyers we got at the table right now, but yeah, I don't know if we have any, right? These are all the health experts in the, I didn't know if Sheila, if you had a law degree hidden. Yes, so with that, I'm just gonna say thank you very much so that we can get our second panel up here. Really appreciate your time and your attempt to answer these questions as in-depth and fully as you can. There will probably be some follow-up questions that were sent that in terms of for data and things like that, we'll try to make sure we send that to y'all or to Neil specifically.
If I could.
Yes.
I just wanted to say, in response to the chair, in response to Chair Arroyo's comments about whether this is needed or not, and whether some of the housing things that were talked about today are applicable to this conversation, I think the scope of this ordinance doesn't negate the other good work, and I actually found it really helpful as a new counselor to hear the entire strategy, because what we're talking about is this is not a silver bullet, it's actually part of an entire strategy. So I just wanted to say I appreciated hearing the whole thing, because it is important for us to understand what the entire strategy is, even if it isn't within the scope of the ordinance. So thank you.
Thank you. I don't want to I just want to get to that second panel. So thank you very much. Get out of here while you can. Thank you so much. I'm going to go ahead and just let folks know who our second panel is while they set themselves up, and then I'll let y'all introduce yourself. I believe we have one virtual. Is it one or multiple virtual folks? I don't know if they're already online. Yeah. Can we make sure? How's it going? I'm going to declare a very brief recess while we get everything set up. We've been joined by our second panel here. Three of our panelists are remote. Two are here in person. I'm going to just go in the order that I have them here. Laura Germanis is a doctor of primary care physician and the co-founder of the Mass Coalition for Health Equity, currently an instructor at Harvard Medical School. Avik Chatterjee is a doctor as well for the Mass Coalition for Health Equity, assistant professor at BU. Aneem Awe is remote licensed independent clinical social worker and also the co-owner of Awe Support Services. Cassie Hurd is the executive director of the Material Aid and Advocacy Program. And Mark Martinez is a housing attorney at the Massachusetts Law Reform Institute. I don't know if you all have a set order that you would like to speak in.
The order that's there, I think, is what?
Let me see what that order is.
Like the way that you just read them, I think.
Oh, okay, that order?
Yeah.
Well, all right, in that case, Laura, if you're, Mr. Manis, if you're ready to go, Dr. Germanis. There is a slide.
Unmuting myself. Hi, yes, hi. Thank you so much, Chair Arroyo, and to the councilors, and also to those of you, Dr. Ojikutu, and the police department, those of you leading this response, for allowing us to speak today. I'm going to be speaking on behalf of the Massachusetts Coalition for Health Equity. I'm a practicing family physician and have an affiliation at Harvard Medical School. And I'm just going to talk a little bit about what the evidence says about solutions to homelessness and substance abuse. And there are really three key points to be made. First, housing first is very effective. Harm reduction approach is critical. And then also we really need to treat drug use as a mental illness rather than a crime. There's growing evidence that shows that homeless sweeps are in fact harmful. And I know that my colleague, Dr. Chatterjee, will get into more detail about this, but a recent seminal study published in 2023 modeled the impacts of sweeps in 23 large US cities and showed a significant increase in overdose mortality, reduction in life expectancy, and a reduction in people getting treatment for opiate use, increase in hospitalizations, and an increase in mortality due to substance-related infections. There was another study in the Journal of General Internal Medicine which interviewed healthcare providers that confirmed these kinds of things. Also, a federal report found that sweeps are actually expensive and of limited long-term effectiveness. A December 22 report from the Department of Housing and Urban Development and Health and Human Services found that a sweep that doesn't include services to help homeless individuals transition to more permanent housing does little to address the underlying challenges that led to the encampment in the first place, and often finds that the encampments end up moving around. I really want to acknowledge that there's this desire both in the language and I know in the programming to connect people with housing. I think that a big question here ends up being whether we have the resources to connect people with permanent housing, because it's the permanent part that really makes a difference. Housing first programs have repeatedly demonstrated, and there's a growing body of literature that demonstrates this, but this was kind of the classic study in New York, that after 5 years, in comparison with these programs that wait until we think that a person is ready to be housed, that when you just offer housing first, regardless of their substance use, they're more likely to remain housed, 88% versus 47% in the more traditional treatment system. And this is just a graph of what happened over time with people in the Pathways program, which was housing first, staying housed much more likely than people in the more traditional program. I've been listening to the session today and have been hearing these questions about whether housing first programs successfully treat substance use and, saying, well, we want to make sure people are getting into treatment. Well, it turns out that there's even some research that shows that housing first programs successfully treat substance use more than treatment first programs. So this expectation or requirement that in order to earn your housing, you have to stick with the treatment program doesn't necessarily work. In this particular study by Paget et al. In New York City, again, people in the housing first programs were less likely to use substances during the study, 8% compared with 31% in the traditional treatment program. They were less likely to use detox or rehab, and they were actually also less likely to be lost to follow-up and go totally AWOL from the program. We know that homelessness is a huge problem in Massachusetts, and there's also been Housing First programming running, in our state. And nearly 1,500 people have been housed with the Home and Healthy Good for Good program, and these programs actually save on costs. I just want to race to the end of my slides here, but just also let you know, there are other models out there in LA, these tiny home initiatives where we give people in these kinds of settings, offer them tiny homes to replace encampments that include wraparound services. Not much time to get to all of these pieces, but just a reminder that decriminalization as opposed to criminalization can make a really big difference. And I just want to jump at one last thing to wrap up, is that overdose prevention centers are, an intervention that's been growing in following, and something that, hopefully we will have one soon in Rhode Island. There's evidence actually that they save lives and money, and there was actually a large modeling study done that looked at a number of cities and even actually estimated cost savings for this kind of a model, a decriminalizing model where people are actually having, using drugs in a supervised fashion, using cost estimates based on costs in local cities. And that actually showed that, there was an estimate that an overdose prevention center, in comparison with only the needle exchange program that we have now in Boston, would actually save $4 million a year, and would actually save, millions in emergency room visits, hospitalizations, and even save overdose deaths. So in sum, I'll allow my panelists, my co-panelists to continue on this, but a public health approach to the intersecting crises of homelessness and opiate use disorder really needs to be putting, permanent stable housing first, and along with evidence-based and voluntary drug treatment, overdose prevention centers, increased access to naloxone, drug checking, syringe exchange, and then of course, no evictions and no criminalization from drug use disorder. Thank you so much.
Are we completed?
Yes.
All right, perfect. Thank you. I believe you're next.
Yes, my name is Avik Chatterjee. I'm a physician, and I practice in homeless shelters across Boston, as well as residential treatment programs. Actually, Councilor Louis-Jean and Councilor Murphy, I see your sign every Monday when I turn into Inter Familia, the BPHC campus out there, and see women at the residential treatment program there. So thank you all for your leadership on this, and certainly thank you, Councilman Arroyo. But I had some slides. I'm going to read off them. I know the counselors have the slides printed out. But I've been seeing patients in shelter-based clinics in Boston since 2013. I was seeing patients out on Long Island while it was still there, and I personally watched some of my patients fall out of long-term sobriety once that bridge was closed, and it was really difficult. But since then, I've been seeing patients at Southampton Street Shelter, which is right at MassCass, since 2015 when it opened. I'm addiction medicine board certified, certified in internal medicine pediatrics. I've also done a lot of research on substance use and homelessness as well. So the first thing I wanted to do was define public safety, because I think this ordinance is being done in the name of public safety. I will say that the biggest threat to public safety, I would argue, is overdose deaths. And I think it's important to be clear about that. As you can see in the graph that's in front of me, the number of overdose deaths in Massachusetts has increased over the past few years. And in particular, Black and brown individuals were hit the hardest. And so I think it's really difficult to talk about criminalization, putting people in jail, fining people, mandating treatment, when now we're talking about an opioid epidemic that's hitting Black and brown folks. I think what's difficult is that, in my mind, the biggest public safety issue is overdose deaths, but what people think of when they think of public safety is seeing people using drugs in public. But I want to take those two things apart. This image that some of you can see, I think, is really helpful to me. It shows two people next to each other. One of them is injecting. This might be something you see at MassCass. But what a lot of people say, and what we tell people to do if they are going to use, is to never use alone. The saddest overdose stories I hear about are when people are using alone in their grandmother's basement or whatever it happens to be and overdose and die alone. Actually, a community like Mass-Cass keeps people safe, keeps people alive, and prevents death, overdose death, which is what we're trying to do. So I don't stay at Mass-Cass. I do wish there was someone from the community here, but we had the privilege of interviewing 30 folks who stay at Mass-Cass and get their stories. And this is what one of them said: you just feel a lot safer in the encampment. You had friends around to help you keep an eye on your stuff, you know what I'm saying? And people that are around you help keep an eye on your stuff as well. It's like a little bit of community out there if you're around people that you're friendly with. 2, sweeps don't work to improve public safety. This is a picture from back in Operation Clean Sweep 1.0, but it's that wheelchair that's being crushed in a trash can compactor. And those are the stories that I heard in my shelter-based practice back then, that people's belongings were taken and crushed, their medications were stolen. We did a lot of extra clinical work to try to get those medications replaced. Another story I want to share is coming into clinic after Operation Clean Sweep, number 1, and having an ambulance driver there talking to our front desk staff. And he was seeing how before, when there was an overdose, they knew exactly where to go and they could respond immediately because they would come to Mass-Cass to respond. But after the dispersal, after everyone was using in different alleys, different corners of the city, they would get calls about overdoses and not know where to go. And that's what we're worried about. And there's actually a study that's been alluded to now several times. Councilman Arroyo and Dr. Germanis mentioned it, but there's a modeling study looking at sweeps and what happens to overdose deaths after that. And the modeling study showed several thousand increases in overdose deaths after dispersal, because just like the ambulance driver I talked to was saying, they don't know where to go to respond. Our outreach workers wouldn't know where to go. There may not be someone around them who knows how to use Narcan or keep an eye on them. Finally, we know other strategies that can improve public safety. Here's another quote from one of our participants: but 3 months and I haven't shot no dope. This is from someone at Roundhouse. I've been cleaned up on the methadone clinic now. I just don't fall back into it due to the help with the Roundhouse clinic, because they started me up on methadone from downstairs. So it's like I owe a lot to Roundhouse. And this in the context of, funding for a place like Roundhouse going away, which is very, very frustrating to see. The other thing I'd like to talk about is overdose prevention centers. The reason I bring it up, I know that it's maybe not on the table, but I think this graph is really powerful because, like I talked about, for me, overdose deaths are the biggest thing we're trying to prevent, and this sweep will make it worse. But the thing that I think people worried about is watching people use drugs, seeing needles and syringes around. And the biggest study we have out of Canada in Vancouver, when they did this, is that all those things went away. So I think dispersing the tents, there's no evidence that makes needles go away and makes people stop using drugs. But if you do put a building, out there with a public health focus where people can use drugs and not overdose and die, the publicly discarded syringes and the injection-related litter goes down dramatically. So if that's your goal, overdose prevention center, not a sweep. Finally, it's difficult to see in the news other cities trying these other models. Dr. Germanis mentioned Los Angeles, but most recently Denver has done away with some encampments by offering this permanent supportive housing, which would be the goal, because that's the only way, treating people with dignity, that you really solve this process, this problem. Investing in housing, investing in treatment, sweeping it away is not going to make it go away, as we learned in 2019 with the previous sweeps we've done in Boston. Finally, I want to say that, some of the attitudes that I've heard around people use drugs and stigmatizing language might have been applied, right, throwing people in jail, all these things, to people who use cannabis or marijuana, even as recently as 10 years ago. But now, cannabis has been transformed into this multi-million-dollar industry. Just to say that when we're done stigmatizing people for using substances, we can actually envision a new and better way, which is potentially better for us all. So let's not throw people in jail for drug use. That's never worked before. Thank you.
Thank you. I believe next we have Aneem Awe, who's remote.
Hi, good afternoon, everyone. Thank you for having me. My name is Aneem Awe. I'm a licensed independent clinical social worker and the owner of Awe Support, which is a mental health and case management organization helping people in the community. I just wanted to express my concern to the opposition in regards to this ordinance that seeks to criminalize homelessness in our city. I believe such a measure fails to address the root causes of homelessness. It will only further exacerbate the already dire circumstances that have been faced by individuals experiencing homelessness. I just want to highlight a couple of things. We know individuals who are homeless are already been impacted by trauma. I believe that, exposing them to sort of sweeps and, arresting them potentially only causes further trauma for those individuals. And so I just want to recognize that. I also just want to call out the fact that establishing that record of going in and out of jail is going to further cause more barriers in them accessing appropriate housing. And so they get caught up in that cycle. So I think it's just important to call that out. Also just want to just call out the fact that these individuals need support. They need access to quality mental health and substance abuse treatment. And we know right now the mental health system is fragmented. And so with the inability to access those services, those individuals will further continue to decompensate and further continue to using. And so I just want to call out a couple more effective sort of tools that one could possibly use. So I think community engagement is really important. I think actually first and foremost, affordable housing is the most important thing. And so Housing First has been talked about all day long. And so Housing First model has been proven to be effective in addressing this situation in various cities across the country. So creating affordable housing units, supportive housing programs that can be really super helpful in helping these individuals. Mental health and substance use services. We got to address the root causes to why people aren't getting the support that they need or the current barriers to getting the help that they need as it relates to mental health and substance abuse treatment. I believe employment and education opportunities, designing and investing in these opportunities for these individuals can be really helpful, as well as wraparound services, right? It's not just enough to, give these people these services, but also supporting them and walking them along and, integrating those services into their everyday lives. And community engagement, so making sure that the community is they're involved in these conversations and making sure that they get the support that they need. And pretty much that is kind of all I have to say. I also just want to call attention to, Maslow hierarchy of needs, which is a model that we use in our field. So if an individual can't, meet their basic needs, there's no way they can sort of continue to climb up and focus on other areas of their life. So it's really important that we call attention to making sure that their basic needs of housing, food, and support are met before we can expect any other individual to sort of progress in any other direction.
Thank you. Next is Cassie Hurd, the Executive Director of Material Aid and Advocacy Program, also remote.
Thank you so much for having me, Councilor Arroyo. My name's Cassie. I work at MAP. I've worked with folks who are unhoused in the greater Boston area for the past 17 years. Similarly to Dr. Chatterjee, I remember what it was like following the closure of Long Island during Operation Clean Sweep and around the encampment, the tent bans, and these are all city-created crises that have exacerbated houselessness and have had significant negative health consequences that providers noted earlier. This is not a public health proposal. It is a doubling down on the inhumane and ineffective police actions and will result in increased harm and potentially preventable death. That's even been noted by the Health Commission of unhoused people and people who use drugs in Boston, all as a means to simply erase people from public space. And I think like a quick illusion of a resolution to a problem that the city has attempted to address in the same way for many years. And I want to respond to assertions that the Health Commission made earlier, the Wu administration, that you have created a coordinated campaign that would just further codify and expand the practice of sweeps. Like your ban is absolutely sweeping human beings and treating them as disposable, like trash. And that coercing people into detoxes and spaces that meet the expanded definition of shelter that you all have created in the ban could potentially meet the precedent for Martin v. Boise. But it is still coercion, displacement, and warehousing of people. And that by deputizing not only the Boston police, and I'll quote the ordinance, any sworn law enforcement agency empowered to make an arrest within the jurisdictional boundaries of the city of Boston and fining poor people who could be prosecuted criminally if unable to pay the fine. It's clear this criminalization is core to the plan. The inclusion of outside police also makes the claim that was made earlier that there will be like training fairly questionable to me. It's also been noted in the hearing that the ordinance offers police with clear instructions on enforcement. but there are several places where enforcement would be at the discretion of police, including during any period when shelter is unavailable. It also enables for additional restrictions to be created by other city departments that is very broad and vague in partnership with the Boston Police. And with no notice required, police can evict people at their whim. And as we've already heard today, they would be resistant to any sort of oversight or accountability. We've also heard the police note today how they'll be out in the community looking for people. And in public meetings, they've previously solicited community members to surveil and report unhoused people in their neighborhoods, especially in those immediately abutting the area of Mass and Cass. And we know an expansion of police presence in Black and brown communities increases surveillance, warrant checks, arrests, and incarceration, not only of unhoused people, but of Black and brown residents who are housed. To be clear, the current conditions, an interconnected crisis that unhoused people and people who use drugs, both in Mass and Cass and across Boston, conditions that people are fighting to survive every day are the result of the city of Boston criminalizing, displacing, and the coordinated abandonment of people to not only continue these practices, but double down on them all. As Councilor Arroyo said, will only exacerbate the symptoms this ordinance supposedly seeks to address. We've seen how this played out in other cities. We've seen how it played out in Boston. That's how we got here. Criminalization is cruel and counterproductive and does not solve homelessness. For the councilors who've noted expense, it is more expensive to criminalize people than to invest in evidence-based solutions that would support them. Others have listed, and we know what the solutions are. It's clear that they make some people more uncomfortable than caging and evicting unhoused people from public space and people who use drugs from the community. I think we have to move beyond stigma. I don't know that we need an anti-stigma campaign and the moralizing of substance use, and quite honestly, get beyond our information resistance. The evidence is clear, and we need to follow it in order to support people and really address the issue that people are trying to survive every day. I'll just reiterate solutions, many of which others have already shared, but permanent low threshold housing first, expanded harm reduction, including OPC, overdose prevention centers, decriminalization, safe supply, ending forced and coerced treatment, including Section 35, investing in voluntary treatment on demand, removing the police and policing entities, and those who have other interests, such as the Business Improvement District, from what should be a public health and community response, and ending the practices of sweeps, and certainly not passing this ban. Thank you.
Thank you. Mark Martinez, housing attorney with the Massachusetts Law Reform Institute.
Hi, my name is Mark Martinez. I'm a Roxbury resident and, as mentioned, a housing attorney at the Massachusetts Law Reform Institute. I want to thank Councilor Arroyo for inviting me to be here to testify on this critical issue. Despite what the administration may say, you cannot just call something a public health solution and make it so, and this ordinance is far from a public health approach. My other colleagues on this panel have spoken to this far better than I could, as they are experts in their field. I echo all of the concerns and want to speak on the concerns that I have as matters of law and policy as it relates to how this ordinance is currently drafted. I first want to begin by pointing out that the city has previously been sued when they tried to enact a similar policy via executive order. The case only ended because the city promised to make certain changes to the policy, and ultimately the policy, or at least its enforcement, came to an end. It is clear that the city learned some lessons last time around and applied them to the drafting of this ordinance. My fear is that this ordinance has been drafted in a way that purports to follow the letter of the law, but leaves the door far too wide open to violate the spirit of it. Furthermore, it is drafted in a way that will make any future legal action very challenging until the ordinance is in place and harm has already been brought upon unhoused people in the city of Boston. I want to explain a little bit why, and forgive me for being maybe a little too legal here. The prevailing legal authority on the issue of anti-camping ordinances is Martin v. Boise, a case that held that unhoused people cannot be punished for sleeping outside on public property in the absence of adequate alternatives, and that doing so is a violation of the constitutional protection against cruel and unusual punishment. The ordinance is drafted is designed to be responsive to this holding by including language that says the prohibition against camping does not apply during a period when shelter is unavailable. Language that on its face seems to align with the holding in Martin v. Voisey until you dig a little bit deeper. First, the ordinance claims that the city will maintain a list of available shelter beds. Anyone familiar with how the shelter system works in Boston knows that a real-time, accurate list of available shelter beds, while a nice idea, isn't really possible. Furthermore, and possibly the most concerning part of this ordinance, is a language that allows the city to promulgate any additional restrictions relative to time, place, and manner for camping and density of campsites during this period. This could mean to absolutely anything and could lead to a constructive, permanent ban on camping, if not an actual one. More concerning language can be found in the offer of shelter section of the ordinance. Here we have language that says that shelter space offered shall be a shelter, housing accommodation, or alternative sleeping space, with absolutely no clear definition of what an alternative sleeping space is. If we were to learn from past experiences, the city has considered sleeping in a cafeteria or doubled up on lounge chairs as suitable sleeping places. These two provisions are exactly what I mean when I say this is drafted in a way that leaves the door open for this ordinance to violate the spirit of the law. They purport to follow the letter of the law by saying they will not enforce this ban unless there are adequate alternatives, but includes language that make it impossible for us to know if these alternatives are adequate or if they will ever meaningfully not enforce the policy. In addition to this case, both the United States Constitution and its predecessor, the Massachusetts State Constitution, protect our due process rights and protect us against unreasonable seizures. In other words, the city can't just throw away people's stuff without a clear process to protect them from it. As it pertains to this ordinance, the city once again purports to respect these inalienable rights by providing a notice period before seizing trash and reference to the city storage program policy. The only problem there is we have no idea what that policy is. We don't know what belongings can be stored, how long they can be stored, or the manner in which people will have access to these belongings. If we go based off of what the city did last time they attempted sweeps of the area, we know that belongings that were wet were not allowed to be stored, or belongings that you wouldn't allow the police to search. So once again, while the city will have you believe that this ordinance is drafted in a way to respect the civil rights of unhoused people, they leave us with language that makes it impossible for us to know until it is too late. And one more troubling provision that doesn't violate any constitutional rights but still raises questions for me is in regards to enforcement. The ordinance grants enforcement power to any sworn law enforcement agency empowered to make arrests within the city of Boston. What does that mean? Who does that apply to? And even if I were to buy the idea that the Boston Police Department is well enough trained to handle these types of enforcement interactions, which to be clear, I'm not, I find it even harder to believe that university police or transit police or maybe even private entities are equally trained. I want to end my remarks talking not as a lawyer, but as the son of two parents who struggled with substance use disorder. Some of you on this panel know 3 years ago I lost my father to an overdose. My father died alone on the floor of a dirty motel because he didn't have access to services or housing, which is exactly what this ordinance will do. It will create more people like my father and leave more families like mine behind. And for all of the reasons that I mentioned, I of course stand in stark opposition to this.
Thank you. I want to thank our second panel for their openings and their presentations. I'm going to open this up to questioning just like the first panel. We will go in order of arrival for who is here, which means Councilor Murphy, you are first. I'm going to give you 5 minutes.
Sure. Thank you for being here and sharing your view, and you all have extensive experience working with people who are struggling, and agree with a lot of what you're saying, that is this ordinance needed, and is it going to do what we are being told the intent is? So just thank you for uplifting all that. It's something that I'm going to continue. I know, hopefully, I'm not sure yet if the chair is going to be having a working session, but there's still, which is a good thing. When we have hearings like this, we leave with more questions than not, so there's homework for me to continue to do, and talking with my colleagues to see what is the right thing. And I agree that a lot of the concerns people have with the illegal activity that goes on down there daily, we already have the power to do that. Is this ordinance necessary? And will we be placing more people in the right spaces that they need? Safe shelters, safe spaces with recovery, wraparound services in a community setting where they can get better. And I'm not sure if this ordinance is going to do that. So just thank you for sharing your expertise. Thank you.
Councilor Flynn, the floor is yours. You have 5 minutes. Thank you, Mr. Chair.
Just have a couple quick questions. Why, can you say the name of your group again to the attorney? Yeah.
The Massachusetts Law Reform Institute.
Okay. So why would the Mass Law Institute, so you'd be against the proposal, but why would, and I'm just trying to figure this out, why would the ACLU be in favor of it?
I don't know that the ACLU is in favor of it. I don't have that anywhere.
Well, I have this memo here. I think we all received a memo.
What memo?
What memo?
Do you mind reading it, Councilor Flynn? It won't count as your time. Or is it too long for that?
Yeah, it's too long.
Can you read the portion?
It looks like it was addressed. It looks like it was addressed to the committee, Chair Arroyo and members of the committee.
And it sounds like it just came in. Okay.
Yeah, it was in the testimony book. But basically, I mean, they don't necessarily come out and say that they're in favor of the proposal, but they come pretty close to saying that. But I'm just curious, why would one progressive group be in favor of it and another progressive group be against it?
Well, I can't respond to a memo that I haven't read, and I think saying that they come short of endorsing it does not mean that it's an endorsement, so that's a difficult question for me to answer. All I can do is refer you to the testimony that I gave about why the Mass Law Reform Institute is against this. One, just as a legal drafting issue, I think it's incredibly vague. I think it leaves the door open to an incredible amount of abuse of unhoused people, and that is a significant problem for us.
Okay. But I think we all agree that we just can't have tents and tops up in the city of Boston and having people living wherever they want to live. We need to work with people that are having those challenges, but having said that, you just can't pitch a tent up wherever you'd like just because you think that's appropriate.
One thing I'll say, because this came up before, is that I do have patients come out of the encampments that come see me in clinic. Like I said, I practice at Southampton Street Shelter, and will say, I need to get into detox. And 9 times out of 10, when we call that evening, there's not a bed available, because detox was something that came up. And the other piece that's really difficult is that people will come out of detox because they were waiting for a long-term treatment bed, and there wasn't one. They'll sometimes wait for a week, 2 weeks, when they're just supposed to be there a few days. And those are the two of the most heartbreaking moments for me, is that if someone is coming out of the tents, like Councilman Flynn, you mentioned they're asking for help and we just don't have that. This ordinance doesn't do anything for those folks that I see on a daily basis, including tinnitus. So if you all want to come to Southampton Street to my clinic with me tonight and see some of these things in real time, you're welcome. 4:30 to 8:30, hopefully I'll make it.
My position prior to being a city councilor, I was a probation officer at Superior Court, and that's all I did all day was get people into drug treatment programs. A lot of times they were court ordered to be in drug treatment programs. They would relapse, and I'd have to work with the clerk magistrate to get them into a drug treatment program, even if they didn't want to go into a drug treatment program because they were in violation of their terms of probation. And I agree, a lot of my probationers would relapse. A handful would make it, but a lot of them did relapse. But what I could say though is any of my probationers that were using drugs, it was only a matter of time before they picked up another criminal charge. And that's based on my experience supervising people on probation, especially the homeless community or people with serious criminal activity on their quarry.
One thing I'll say too about mandated treatment, because that's come up a lot too, is there was a study in Massachusetts that did show that it doubled people's overdose death risk, which is something we try to avoid. But one of the things that we've talked about before too is that a lot of these things sort of snowball. If we make, like, let's say having a tent illegal, and then that charge adds to all the other things that someone is dealing with and can make it even harder and harder to, for example, eventually get into housing. The quarry barrier to people getting into different housing programs is something we face every day, and we actually started a legal program at our clinic to try to help get people through.
People need drug treatment, they need medical care, they need detox. But putting someone in a house, in an apartment, in a townhouse, without getting medical care, without being in a detox, from my experience as a probation officer, is a recipe that does not work. Thank you, Mr. Chair.
Thank you, Councilor Flynn. We have Councilor Mejia.
Thank you. And I'm sorry I had to step out, but I'm back. And that's what matters, okay? But, you know, I think I would ask you all the same thing as I asked the panel earlier. And I would recommend, as we continue to move these conversations forward, I would have loved to have heard from y'all first, and then or have them hear you all, because there's something to learn or something to at least exchange. So I would have loved to have that ability to ask you both questions at the same time so that y'all can go back and forth with each other. But I'm gonna work with what I have, so I'll just ask y'all. So I guess, because there's so much tension about what we should do, right? And it just sounds like people are digging their heels in what they believe is the right way to go, right? And we have seen so many different iterations of how we support our loved ones who are struggling in mass and cast. If I had to ask you the same question that I asked the administration, which I want to note for the record that whenever we have hearings, we're lucky if we get them for 45 minutes. But since this is something that they wanted to do, they gave us 5 hours of their time, which is really interesting. I just want to make that note for the record for those who are listening in, that y'all can't just pick and choose how you want to utilize the administration, okay? Anyways, back to what I was here to discuss. Can you tell us if you had to find a way to both address the public safety concerns that have been identified as the reason why we're having this conversation to begin with, what would you say would be the way to move through this conversation in a way that both addresses the public safety concerns that have been put on the record, and also, which is the most important piece of this conversation, at least for me, being able to affirm people's will and civil rights to make their own decisions. So I'm just curious if you could what would that look like for y'all?
One of the things that I've written about is that there really is a sense of community there. If you talk to people who stay in the tents, they will talk about watching over each other. All of them know how to use Narcan better than most of the doctors that I know, because they use it on a regular basis to keep each other alive. So I think respecting that folks who are there are trying to be safe. I think building a safe consumption site or an overdose prevention center like they've done in New York and San Francisco, Vancouver, many other places is a piece of it. I think because people don't want to see people using drugs in public, too, it's really helpful that that could be a place that's inside. We know that decreases litter, injections that are, needles that are left outside. It also increases the chance that people get into treatment. So that's one piece of it, putting basically a building around what people right now don't want to see. The second piece is that we know that Boston is an extremely expensive place to rent. Rents are very, very high, among the highest in the country. So when I see someone in early sobriety has done a lot to get themselves there, because to stay at Southampton Street and get sober is very challenging. And then they're like, well, now what do I do? The BHA list or whatever is years long. They can get on all the lists that they can, but it still means being in that space and being sober for a long, long time. So figuring out a way to very, very aggressively subsidize housing for folks, build out short-term and long-term, permanent supportive housing for folks, so that it's not this very challenging off-ramp.
Yes, I appreciate that. And the safety that I want to just bring into the space is the impact to the small businesses that are there, right? There's one pizza shop in particular that are owned by Dominicans, and their windows always get broken all the time. And I'm talking about the the human trafficking. I'm talking about the violence, in particular. When I think about safety, this is what a lot of folks were talking about here in this space. So I'm just curious about kind of like what your input is and ideas around tackling that activity.
One thing I'll say is that just because if it doesn't happen at mass cast doesn't mean it doesn't happen.
Mm-hmm.
So it's not like there's no sexual assault, no trafficking, no stabbing anywhere in the city except for at mass casts. And in a lot of ways, again, people there tell us that at least with a set of tents around them where they know who's there, they can try to watch over each other and keep over safe. These are each other safe. This is something we get from the interviews that we've done down there. But it's not clear, and certainly the studies that we've seen show that their risk of bad things increases if you make them be alone in other parts of wherever there might be, in smaller encampments, maybe in an alley. So I don't know that we know that it's better to not have the encampments as far as those sorts of violent events and things, at least for the people who are staying in the tent.
Yeah, so I want to start, I appreciate the question, but I think it's important to note that I don't think both sides are using the same definition of public safety, right? And so I think that that's a really hard thing to bridge when we're not using words that mean the same thing, and that when one version of public safety leaves out a group of people and leaves out the people that we want to keep safe. And I also think I'm hesitant to name a compromise when, I think as Councilor Arroyo and some of the other doctors here have pointed out, right, like the approach that we're talking about here is backed by evidence, right? Backed by decades of research and data and evidence that this works. While some of the other approaches are based off of anecdotes. And so to find a compromise between what your personal experience is versus what decades of data says works is also another really hard proposition for me. And again, just to reiterate another thing that has been said here, nothing is preventing the police from doing their jobs in this space, right? Dealing drugs is illegal, trafficking is illegal, sexual assault is illegal, nothing is stopping them. And if they say it's because, someone is running into the tents and we don't know what to do there, I just find that really hard to believe. If someone with a gun runs into a house in Beacon Hill, the cops are not gonna throw up their hands and say, well, what are we gonna do? I guess we better ask them to tear down their walls, take off their roof, and install transparent walls so we can see what's going on inside of there, right? So the things that are happening here are happening everywhere else. Somehow brick walls aren't an impediment to the police doing their jobs and keeping people safe, but fabric tents and tarps are.
Yep. And I'm so glad that I asked that question because it provided those folks who are following to really understand the magnitude. And I think that is the point right there. And I also think that we're not speaking truth in this chamber because it's not just around the public safety. It also is an eyesore for some folks, and that's probably one of the reasons why they want to also get rid of it. And no one has the courage to speak that into this mic, right? Because I think that is also at play, right? So it's a guise under the public safety when in reality it's a bigger than that. And I just want to name that as maybe my interpretation of what potentially it could also be at play. And I'm just going to name it because that's just what I do.
You also have, we do have 3 remote panelists, and one of them has their hand up on your question, so I want to make sure I give them a chance to answer as well. Dr. Germanis?
Yes, thanks so much. Yeah, I mean, I have a couple of things to point out here. I think, Dr. Chatterjee and also Mr. Martinez mentioned as well, that we're talking a lot about anecdotes here, what somebody has experienced in their career versus compared with a body of scientific evidence. I didn't get a chance to go through the data about what overdose prevention centers are able to do, but over 35 years of evidence demonstrates that they actually prevent overdoses, reduce risk of infectious disease transmission, they actually increase connection to health services, and they improve public safety by reducing public injections, and they even decrease participants' risk of physical or sexual violence. So, it's something that we haven't even really seriously considered in Massachusetts, though there has been one that could open in Rhode Island. And I think that we should be shifting this conversation here. And, I think that the data gives us a clear set of directives, housing first and real permanent housing opportunities. And that I think is my main concern here. When you give somebody a stable place to live, and I just want to say, we're in a mental health crisis and a crisis of healthcare staffing. And I hear time and again that people can't find a therapist, can't find, there are not addiction beds to be given, given out. It's not like people wait and wait and wait for admission to treatment programs. This is not just an easy thing to come by that someone's being lazy and not being able to get into. And, and the meaning of having permanently on your record an additional piece of criminalization due to having lived in a tent, which has suddenly been deemed illegal, is again something that can put somebody at risk of being able to get back into the housing market, get back into the job market in the future. And, it's just one more notch against them that makes it really difficult to kind of get on track and be productive in the future. And, whereas when you take a look at what is possible with Housing First programs, I just think that this crisis of housing is such a huge issue. And if we could get creative, get innovative, like some of these programs in other parts of the country, we could really be making a major impact in a different way. And I'm concerned that we're kind of running into a vicious cycle of, sweep, and then we have a couple of years, and then you're kind of back in this vicious cycle again. Thank you.
Thank you. Cassie Hurd also has her hand raised.
Yeah, I just wanted to add a few things to what folks have already shared. Just to echo what Dr. Chatterjee said about people are in community and taking care of each other and responding and supporting each other, but people have also been increasingly pushed into an extremely small space, right? When Sheriff Tompkins paid for there to be fences erected, right, as they evicted unhoused people along Bradston Street, along Southampton Street, people were pushed together, and just this past summer, half of Atkinson Street was cut off. So tensions have obviously increased. And yes, there may be things that are happening where people are being, put in situations that are unsafe. But if people were not kettled into such a small space and criminalized already for being in other spaces, tensions would not be nearly as high, right? There's a constant cruiser at the end of the street, a cruiser at the other end, just watching and surveilling people. There are cameras everywhere. There's security. And, I think about any sort of challenge people might have in their private home, but having to have that in public. And so providing places for people to be, while at the same time not criminalizing people for existing in public space, because we all should be able to be in public space and not making that public space private through planning, right, and zoning. And just also to offer that, folks have talked about OPCs, and I do think they're one of the best examples of both, perhaps the general public being uncomfortable with the solution, but that solution actually addressing sort of the symptoms of what we're currently doing, right? And I think that's where a lot of dichotomous thought comes of people don't want to see people on the street using drugs. They don't want to offer people an OPC because of the moralizing of feeling like it enables people. But people are going to use drugs, right? That's just what we do. And let's provide people a place to be safer and have connection and care instead of just relegating people to using between parked cars or, in a park. People want to be safe. And so we're removing that opportunity for people by not doing this.
Thank you. I believe next is Councilor Anderson.
Thank you, Mr. Chair. I guess I just have a couple of questions in terms of, decentralizing services. And yes, this is, sort of a condensed population in that area. And so what have you seen in comparison to research? And how do you see that transitioning into eventually I don't want to call it displace, but I guess centralizing people, decentralizing people in services or proper services elsewhere.
Yeah, one thing I'll speak to that a lot of my colleagues are advocating on is methadone. So methadone is extremely important. I know a lot of this has come up before, but we know that it decreases your risk of overdose death by 50%. We want patients to be on medications like methadone. But right now, because of federal regulations, there are very few methadone programs, OTPs, in Boston. Two very, very big ones are right at Mass Cass. Methadone programs require daily attendance almost for everyone. So it's this thing where even if you got rid of the tents and all that, people are all going to have to, by federal law, go to get this medication that in other countries, people are allowed to be prescribed and take it home, just like you would any other medication like your insulin for your diabetes. So on the one side, we're advocating for making federal regulations around methadone easier, so it's not that you have to have this concentration of people there with opioid use disorder to have to go to one place every day like that. It's inhumane for people, and it also starts to contribute to this issue of centralization because it's very difficult to get a methadone program started. There's two big ones right there. It's difficult to see a way in which that's not going to be a nexus for people, right? So I think we're really lucky in Boston because we have Long Island. I'm really hopeful that within the next, 4 to 5 years, whatever they're saying, that can be a place for treatment beds, long-term programming, work, housing, shelters, all that stuff. That'll help be an off-ramp as far as decentralization. But at least as far as trying to get people on a life-saving medication when the rules are from the federal government that they can only be in certain places, I see a difficult challenge. Yeah, I'll just leave it at that.
Thank you. I guess the challenge with one is enough, then decentralizing it is a bigger challenge, you're saying?
Well, because if you build other low threshold housing sites, harm reduction sites that I think have been very effective, but then you're like, okay, but you still have to cross the city to go to Mass Cass every day because that's a federal law for you to get your medication. That's just not going to be, it's just going to lead to more of what we have. So breaking down methadone laws, making more mobile methadone units, which is something that is allowed now, building out programs like BMC has with Faster Paths, so you can start methadone at any clinic and continue will be helpful.
As far as consumption sites, safe consumption sites, I'm in strong agreement that this works. It's based on research, not just on opinions. I mean, I think that, yes, our opinions are relative to our experiences, and respectfully, I disagree with some of my colleagues and just say that obviously I don't think we have one, right? Okay, so there goes a huge problem. And then with with Long Island, one of the issues when transporting clients there or working there on site was that, the different, buildings on campus were all sort of, it felt like it was also centralized there as well. And so how do you envision the design so that we're managing transitions or we're encouraging progress?
I think one of the things that people really appreciate about Long Island was just the open space. I mean, there were like deer, there were blackberry bushes. There was the biggest, I think the only organic farm in Boston was out on the island. So I think, there are the buildings that were there. It's been used for public health purposes for a long time. It was a TB sanitarium. It was a home for unwed mothers, a psych hospital. But I think, envisioning a space that all the buildings sort of taking in that outdoors feel, will be helpful. I'm not, I know that there are a lot of other people planning how that's going to look, but I think the idea of going from an area like Mass Cass that, just unfortunately it smells, the buildings are run down, the streetlights don't work, to a space like Long Island where it's like green and beautiful is extremely empowering and supportive of recovery. So that's got to be part of what we're doing for our folks down there.
Thank you. For those listening, that bridge was horrific. It was super scary driving there every day. It did feel like you would sink into that river. I wanted to ask your opinion about just decriminalizing drugs in the future for either one.
I'm in favor. I don't.
No, sure.
Right. I mean, I think. Right. It comes down to all of this, right? Like, criminalizing behaviors that we don't like is not the answer, right? It's never been the answer, whether it be in the context of this or other things. And so I think, the doctors and the clinicians here can speak to this a lot better than I can, but right, it decreases barriers to entry, to service. If you're not afraid that you're gonna get thrown in jail for being found out that you use some, whatever substance it may be. And also, it can improve relationships with police as well. Again, the fear of going, I know, right, part of the fear of people en masse and casse, to the extent that we are going to talk about this underreporting problem, and I'm sure it's, a problem to a certain extent, part of it is that fear of going to the police, part of that is that fear of reporting it to authorities, and decriminalization helps with all of those aspects.
What are your views on Lisbon, Portugal? Last question, I promise. What are your views?
Hold on. I'm not trying to cut you off. We have people on Zoom who also want to answer your question. Dr. Germanis and Cassie Hurd in that order, and then you can ask your final question.
Thank you.
Thanks so much. Yes, I didn't get a chance to go through, but I actually had a slide specifically about the case of Portugal, and I'll say, I actually had a conversation about this with our current Undersecretary of Health in Massachusetts, Dr. Melnea, who is also practices caring for patients with opiate use disorder. And he commented to me offhand that, if we know how to deal with drug use disorder, we just need to follow the case of Portugal. It's just a matter of political will. I mean, we have this scientific evidence before us. The question is, are we willing to follow the textbook? In the case of Portugal, Portugal was struggling much more than, frankly, the situation at Mass and Cass right now. 1% of the whole population of the country was addicted to heroin in the late 90s. And then they just, did this striking move in 2001, decriminalizing all drugs. Drug-related deaths then fell and have remained below the average for the European Union. The proportion of prison population with drug offenses dropped from over 50% down to 15%. Rates of drug use also remain consistently below the EU average, and Portugal actually used to account for over 50% of the yearly HIV diagnoses that were linked to injecting drug use in the entire EU used to come from Portugal, and now that's only 1.7%. So it's really, preventing injection-related HIV. And this is tremendous. And, I think that